Buenos días and good morning. We will going to start soon, but we try to tratamos de mantener la lista que teníamos para el punto 4.5 y que es el tema de enfermedades no transmisibles. Entonces, por eso tienen el micrófono en verde. Si ustedes quieren seguir teniendo la palabra, por favor no tocarlo porque tratamos de conservar el orden de forma manual. Si por error está en verde o si ahora no quieren hablar, sí, lo aprietan y se apaga. Pero les pedimos que por favor, si están en verde y quieren hablar, que lo mantengan ahí porque estamos guardando su turno. Vamos a empezar en unos minutos. Gracias. So we have quorum, and I think we are ready to start any minute now. Thank you. Whenever you want, President.
Good morning, honorable ministers, delegates. We would like to resume. Yesterday when we adjourned, we were considering agenda items 4.5 and 7.5, Plan of Action on Non-Communicable Disease Prevention and Control 2025 to 2030, and the Strategy for the Prevention and Control of Non-Communicable Diseases. There were a number of requests for the floor when we adjourned, and this morning I now want to give the floor to Ecuador.
Muchas gracias, señor presidente. Muy buenos días y buenos días a todos los delegados y delegadas presentes el día de hoy. Ecuador mira con agrado la presentación del Plan de Acción sobre la prevención y control de las enfermedades no transmisibles 2025-2030 y resalta la importancia de renovar el compromiso de todos los estados y de la cooperación internacional para cumplir estos objetivos e indicadores planteados. Ecuador destaca del plan su aporte como un marco regional integral para reducir la carga de enfermedades y mortalidad por ENT al priorizar las 4 patologías y sus factores de riesgo comunes, promover políticas públicas, fortalecer la atención primaria y mejorar los sistemas de vigilancia bajo un enfoque multisectorial y orientado al cumplimiento de los ODS. En Ecuador, la encuesta STEPS de 2018 evidenció que una cuarta parte de la población adulta presenta 3 o más factores de riesgo y que más del 11% de las personas entre 40 y 69 años enfrenta un alto riesgo cardiovascular en los próximos 10 años. Ante esta realidad, impulsamos políticas públicas para hacer frente a estas inminentes amenazas y proteger la salud de nuestra población y evitar complicaciones prevenibles. Entre las principales acciones podemos mencionar la regulación en bares escolares, etiquetado de alimentos e impuestos a bebidas azucaradas y al alcohol, programas de apoyo a la lactancia materna. Hemos además avanzado en la implementación de la iniciativa HEARTS, alcanzando hasta ahora el 81% de los establecimientos de salud de la red pública integral en apoyo a la prevención y control de enfermedades como la obesidad, la hipertensión y la diabetes. Hemos alcanzado acuerdos para el acceso de medicamentos contra el cáncer infantil y adolescente, así como el inicio de tamizaje de cáncer cérvico-uterino con pruebas moleculares de HPV. Además, la segunda ronda de la encuesta STEPS, que con el apoyo de la OPS y del Instituto Nacional de Estadísticas y Censos del Ecuador, permitirá actualizar datos claves para orientar las políticas y decisiones en la prevención y control de las ENTs. Ecuador considera que el plan presentado y su proyecto de declaración resultan ser instrumentos indispensables que nos permitan trabajar en conjunto para fortalecer la cooperación técnica y financiera, ampliar las intervenciones costo efectivas, apoyar la transformación digital de los sistemas de salud y consolidar la vigilancia regional de las ENT asegurando sostenibilidad de los recursos y la equidad en el acceso a medicamentos y tecnologías esenciales. La prevención y el control de estas enfermedades debe asumirse como un compromiso intersectorial e institucional orientado a abordar sus causas, prevenir su aparición y controlar sus complicaciones evitables, integrando la equidad como principio transversal en todas sus acciones. Muchas gracias.
Thank you, Ecuador. I now give the floor to Honduras.
Buenos días, presidente, delegaciones. Honduras reconoce la necesidad de crear un verdadero plan de prevención y control de las enfermedades no transmisibles. En tal sentido, manifiesta su apoyo a la implementación del Plan de Acción sobre la prevención y el control de las enfermedades no transmisibles 2025-2030. Asimismo, resalta la oportunidad que representa este plan para intensificar alianzas multisectorales y la cooperación técnica con la OPS-OMC, en particular apoyando el desarrollo y fortalecimiento de recursos humanos especializado en las oficinas de país, que facilitaría la adaptación, implementación y monitoreo de las acciones en el contexto nacional. Finalmente, Honduras subraya la necesidad de priorizar en la prevención y control de las enfermedades no transmisibles, el abordaje de los determinantes sociales de la salud y las inequidades que impactan a las poblaciones vulnerables. Estos aspectos deben ser incorporados como mensaje clave en el diálogo multilateral para garantizar un impacto sostenible y equitativo en la región. Muchas gracias.
Thank you, Honduras. I now give the floor to Jamaica.
Mr. President, Jamaica has made progress in its efforts to combat NCDs, ranking 14th overall in the Americas and second in the Caribbean according to the WHO NCD Accountability Framework, with 8 targets fully achieved and several others partially met. Key achievements included development and implementation of legislation promoting smoke-free environments and restrictions on alcohol availability, Tobacco Control Bill Framework Convention on Tobacco Control, which we promulgated, will bring Jamaica into full compliance with WHO Convention. We have been working closely with the relevant ministries, civil societies, and other stakeholders to advance policies on food reformulation, front-of-package labeling, and restrictions on alcohol advertising. Although Jamaica has achieved progress in certain risk factor policies, it faces ongoing challenges with increasing prevalence of obesity and physical inactivity. We continue to implement innovative interventions and public education campaigns on healthy diets, physical activity, including Jamaica Moves programs in schools, workplaces, and communities. Jamaica's health system response has seen improvements through the implementation of the primary health care reform, under which we will expand the number of primary care sites offering care for non-communicable diseases routinely and implement specialist clinics in primary care. We have updated guidelines for NCD management and implemented screening guidelines for priority diseases. Jamaica has also extended access to diagnosis and treatment of priority cancers with introduction of specialist services of urology, oncology, gastroenterology, and in more hospitals. There is ongoing strengthening of surveillance, including the upcoming Jamaica Health and Lifestyle Survey 4, updating and expanding the National Cancer Registry and evaluation of the National NCD Surveillance System by PAHO. Jamaica commends the PAHO organization for the action plan on NCD's prevention. We recognize the importance of indicator 3.3.1 of the plan. However, the details require social determinants will be challenging. Implementing during the timeline with current resources may not be feasible or practical, especially with the limited human resources. We ask for reconsideration of the indicator to the number of countries and territories with a standardized system for recording primary healthcare services, user data that includes the 4 main NCDs. Finally, further to the highlighted concern, Jamaica has no objection to the strategies and actions outlined and endorses the new plan of action for NCD prevention and control. Thank you.
Thank you, Jamaica. I now give the floor to Panama.
Gracias, señor presidente. Panamá, al igual que el resto del mundo, enfrenta el desafío de abordar un grupo de enfermedades que aporta más del 75% de sus muertes. Estamos hablando de las enfermedades no transmisibles y la lucha que representa abordar sus factores de riesgo en ámbitos multisectoriales más allá de la salud. Este plan llena las expectativas que hemos venido visionando como país para continuar abordando las ENT, orientado a tomar medidas para disminuir su prevalencia y mortalidad, centrados en el manejo hacia la reducción de sus factores de riesgo, su diagnóstico temprano y control efectivo, así como su abordaje integral en el ámbito de la salud. Enfocados en el cumplimiento de las metas mundiales, en Panamá se realizan esfuerzos para alcanzar las metas y objetivos trazados a nivel nacional, regional y global. Puedo mencionar que actualmente trabajamos en la implementación del Plan de Aceleración para detener la obesidad con indicadores de seguimiento y evaluación, al tiempo que avanzamos en la adopción de las directrices de la OMS para la actividad física y el comportamiento sedentario, la implementación de un plan de acción para la reducción del consumo de sal, sodio y eliminación de ácidos grasos trans, que ha permitido brindar el impulso de políticas públicas y establecer acuerdos con la industria de restaurantes para el retiro de los saleros en la mesa. Comprometidos en la integración de las ENT en la atención primaria de salud, estamos expandiendo la estrategia HEARTS a nivel nacional e implementando la guía para la detección temprana y atención oportuna de la sospecha de cáncer en niños y adolescentes. Se redujo el precio de 60 medicamentos esenciales accesibles para tratar diabetes, hipertensión arterial y otras enfermedades comunes en farmacias del Ministerio de Salud en beneficio de la población. La vigilancia de las ENT y sus factores de riesgo son un desafío y un reto que venimos enfrentando, enfocados en la construcción de un sistema que integre la información de las instituciones públicas de salud con miras a la integración de la información de los servicios de salud privados. Continuaremos desarrollando de manera asertiva las directrices contenidas en este plan en miras de contar con información de las 9 metas y los 25 indicadores del Marco Mundial de la Organización de la Salud. Muchas gracias.
Thank you, Panama. I now give the floor to Colombia.
Gracias, señor presidente. Colombia, coherente con la lectura integral de las enfermedades no transmisibles como resultado de condiciones estructurales en materia socioeconómica, política, cultural y ambiental y condiciones sectoriales relacionadas con el sistema de salud, trabaja en 2 campos. En el primero, el gobierno del presidente Gustavo Petro viene avanzando en disminuir la desigualdad, buscando la garantía plena de los derechos económicos, sociales y culturales, transformando el modelo económico y la matriz energética y del transporte dependiente de los combustibles fósiles hacia las energías limpias, implementando la reforma agraria, la reindustrialización, la soberanía alimentaria, la fiscalidad progresiva y protegiendo y ampliando el trabajo como generador de riqueza. Esto en un marco de luchar para mitigar y adaptarnos al cambio climático y para alcanzar la justicia climática y la paz. Esto sin duda es el terreno que genera las condiciones para prevenir la masiva y desigual extensión y profundización de las enfermedades no transmisibles, en especial del sufrimiento y la enfermedad mental. En el segundo campo, el del sector salud, impulsamos actualmente una reforma sanitaria que garantice la salud como derecho fundamental, universal, público, territorializado, participativo, intercultural y gratuito en el momento de la prestación del servicio, lejos del actual manejo de la salud como mercancía, como negocio y como espacio de corrupción. En el entretanto, hemos avanzado en estos 3 años en aspectos clave con impacto sobre la CNT. La inversión de más de $2 trillones en la implementación de más de 10.000 equipos médicos en todo el país, con capacidad para hacer educación, detección y protección específica temprana. La implementación de más de 1.600 proyectos de recuperación, ampliación y modernización de hospitales y centros de salud en todo el país. La adopción de un Plan Nacional de Choque para detección y atención del cáncer de cuello uterino, mama, próstata, colon y leucemia pediátricas. El incremento del financiamiento del sector a cerca del 39% en los últimos 3 años, la adopción de una política de salud mental integral que incluye habilitar una red nacional de salud mental y el manejo de sustancias psicoactivas con enfoque de reducción de riesgo y daño y salud pública, la implementación de impuestos saludables a alimentos ultraprocesados y bebidas con exceso de azúcar libre y grasas saturadas, a lo que se agrega el fortalecimiento de los impuestos al tabaco y los sucedáneos, así como la regulación de sodio, el fortalecimiento de la soberanía sanitaria hacia la producción de medicamentos, insumos e inicio de la recuperación de capacidad para producir vacunas. Todo lo anterior bajo la adopción de un modelo de atención preventivo, predictivo y resolutivo que incluye territorializar la salud. Colombia, aunque reconoce la calidad e integralidad del plan de acción, lamenta que desaparezcan categorías analíticas como el enfoque de género, cambio climático y equidad. ¿Acaso la distribución de la enfermedad y la muerte no se reparten ni se atienden diferencialmente según las injustas condiciones que discriminan a las mujeres y las niñas? ¿O negar el cambio climático evitará la emergencia climática que amenaza la vida, sobre todo los más excluidos en nuestros países? ¿Acaso no mencionar los ODS nos eximen de eliminar la desigualdad en nuestras naciones? Pero apostamos al consenso y por eso apoyamos la adopción del plan de acción, seguros de que aquí nadie renuncia a la ciencia, la vida y la justicia social, porque creemos que la defensa del multilateralismo como plataforma para alcanzar y mantener la paz, en particular para apalancar los esfuerzos que tenemos que hacer para detener el genocidio en Gaza. Muchas gracias.
Thank you, Colombia. I now give the floor to Aruba.
Chair, Excellencies, distinguished delegates, it is a privilege to address the 62nd Directing Council of the Pan American Health Organization for the first time. I wish to begin by thanking you, Chair, for this intervention, and by expressing the gratitude of Aruba and many of other small island developing states for the opportunity to take part in this most important forum. For many years, PAHO has been a trusted partner, offering invaluable cooperation and technical assistance that have strengthened public health systems across the region. Aruba deeply values this support, which has enabled us to advance important health initiatives and deliver concrete benefits for our population. This week marks a milestone for us. Yesterday, Aruba signed its new country cooperation strategy, developed with the latest data and evidence from our 2023 STEP survey, as stated in our National NCD Multi-Sectoral Action Plan 2020-2030, which was executed under PAHO's guidance and accordance with its standards. With this new CCS and the mentioned achievements, this reflects both the indispensable role of PAHO and the solid results achieved through its technical collaboration. On behalf of Aruba and in solidarity with other small island development states, I express our hope for continued investment in health improvement just in recent years. Such collaboration is essential not only to safeguard the health of our citizens, but also to ensure that Aruba remains a safe, healthy, and welcoming destination for visitors from across your countries. Once again, we thank PAHO, its member states, and you, Chair, for your leadership and commitment. Masha danki.
Thank you, Aruba. I now give the floor to Puerto Rico.
Gracias, señor presidente. Buenos días. Queremos felicitar al secretariado y a la OPS por presentar este plan, el cual ha sido muy bien estructurado y establece claramente sus objetivos en forma integrada. La consulta realizada a los países miembros dio la oportunidad de fortalecerlo y atemperarlo a las necesidades de la región de forma estratégica. De esta manera, la OPS reafirma su función de acompañamiento y cooperación técnica. En Puerto Rico, al igual que en las Américas, las enfermedades crónicas representan una gran carga de enfermedad con las consecuencias socioeconómicas que todos conocemos. Claro está, hay variaciones, incluso como las que quisiera mencionar en esta mañana. En Puerto Rico, el Alzheimer ha desplazado como la tercera causa de mortalidad en Puerto Rico a la diabetes. Yo creo que son datos que ayer se discutieron que nos tienen que tener una visión de alarma de cuánto se están moviendo las enfermedades crónicas de una forma a veces impredecible. Actualmente, Puerto Rico está elaborando su próximo plan de prevención de enfermedades crónicas y tomará como referencia el aprobado en esta ocasión. En aquel momento se está tomando de base el último plan de enfermedades crónicas aprobado, que fue el 2014-2020. Sin lugar a dudas, estamos realizando los esfuerzos para alinearlo al próximo plan de prevención de enfermedades crónicas de la OPS. Muchas gracias, señor presidente.
Thank you, Puerto Rico. I now give the floor to Trinidad and Tobago.
Thank you, Chair. The government of Trinidad and Tobago would like to take this opportunity to reaffirm its unwavering commitment to the provision of comprehensive health services and supporting programs, with particular emphasis on the prevention, treatment, and control of non-communicable diseases. We recognize the risk factors of NCDs and acknowledge that these are largely preventable and require multi-sectoral, all-of-government actions. Our approach is anchored in a life course model, which addresses NCDs at every stage of development. This integrated approach allows us to accompany individuals from birth through infancy, childhood, adolescence, adulthood, and in the later years of life. By embedding prevention, care, and wellness promotion across the lifespan, we aim to secure a healthier and more sustainable future for all citizens. A central pillar of this model is empowerment, empowering individuals, families, and communities to take charge of their own health through behavioral change and self-management. We believe that this primary healthcare-oriented strategy will not only improve health outcomes, but also contribute to stronger resilience, greater equity, and efficient use of resources. However, while Trinidad and Tobago has no objection in principle to the document, there are matters surrounding taxation and the banning of the advertising of alcohol for which require policy decision from the government. Moreover, Trinidad and Tobago stands in solidarity with other member states by its commitment to reducing morbidity through the prevention and control of NCDs. We look forward to continued collaboration and support as we implement these measures and work toward achieving, or at least making meaningful progress toward achieving, the UN Sustainable Development Goals by 2030. I thank you, Chair.
Thank you, Trinidad and Tobago. And now I will give the floor to an intergovernmental organization, a United Nations agency, and several non-state actors who have requested to make statements under this agenda item. I give the floor to the Andean Health Agency, Hipólito Unanue Agreement.
Buenos días, señor presidente, distinguidos delegados, doctor Yarvar Baborza. Mis primeras palabras son de agradecimiento a la Organización Panamericana de la Salud por el trabajo conjunto que venimos realizando hace más de 50 años a favor de la salud y el bienestar de los habitantes de Bolivia, Chile, Colombia, Ecuador, Perú y Venezuela. Asimismo, felicitar por los documentos consensuados que permiten fortalecer la prevención y el control de las enfermedades no transmisibles. Saludar la clara presencia de la enfermedad renal crónica presente en el 10% de la población. Nosotros contamos con la política andina de salud pública para enfrentar la enfermedad renal crónica y el Plan Andino 2024-2030 para la prevención, diagnóstico precoz y tratamiento de la enfermedad renal crónica por curso de vida en los países andinos. Recordar que la obesidad también es una enfermedad. Para el 2050 se calculan que 390 millones de adolescentes tendrán esta enfermedad. Nosotros contamos con la política y el plan para su prevención y control. En cuanto a cáncer, felicitar por la priorización de cáncer infantil. Tenemos la hoja de ruta para la atención de cáncer infantil y la política andina contra el cáncer al 2030. Hace 2 años inauguramos la Semana Andina de Vacunación en Fronteras, que nos permitirá también vacunar contra el VPH. Y no podemos dejar de mencionar el cambio climático y la salud y la importancia de la multisectorialidad con el trabajo conjunto que tenemos en la Mesa Andina Intersectorial de Concertación contra las Desigualdades. Muy contentos porque el día de mañana firmamos la extensión del memorándum de entendimiento con la Organización Panamericana de la Salud. Muchas gracias.
Thank you. I now give the floor to the United Nations Environment Program.
Excellencies, colleagues, the new PAHO Plan of Action on NCDs Prevention and Control addresses the region's leading killers, cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases. These conditions share common risk factors: tobacco, alcohol, unhealthy diets, physical inactivity, and air pollution, as recognized by the proposed UNGA Political Declaration on NCDs. But these risks are not only about personal choices. They are shaped by the environments in which people live, work, and grow. Here is where UNEP can make a difference. By bringing the environmental lens, we can help strengthen this plan in 5 key ways. Sustainable food systems, aligning nutrition policies with sustainable agriculture and reduce food waste. Healthy cities, supporting clean transportation, safe walking and cycling, and green spaces to combat air pollution. Clean air, reducing emissions and phasing out dirty fuels to cut the burden of chronic respiratory diseases. Pollution and harmful products, managing chemicals, plastic pollution, and waste. And One Health, ensuring that NCD's strategies also address the broader ecological and environmental determinants of health, and ensuring that the right actors come together to take decisions and put in place solutions. The message is clear. The NCD's crisis and environmental crisis are deeply interconnected. By bringing together PAHO's plan of action and UNEP's mandate, we can build healthier societies and healthier ecosystems at the same time, while saving precious economic resources and fully tapping on our development potential. Together, we can turn NCDs prevention into an opportunity for sustainable development in the Americas. Thank you.
Thank you. I now give the floor to corporate accountability.
Honorable President, Honorable Delegate, on behalf of Corporate Accountability, CLASS, Global Alliance for Tobacco Control, ASH, and Vital Strategies, we welcome the presentation of the final report and acknowledge the efforts of states in the region on this path, as well as the constant technical support from PAHO in strengthening and advancing NCD policies. We also recognize that the HLM represented a fundamental milestone to transform commitments into concrete actions that accelerate progress towards the 2030 target. The report highlights a persistent challenge: the interference of unhealthy commodity industries, which continues to limit the adoption of policies such as nutrition labeling, restriction on advertising, and fiscal measures. For this reason, it is crucial to safeguard their implementation by applying the conflict of interest provisions of the FCTC, celebrating its 20th anniversary this year, and replicating this experience in alcohol policies and healthy diets. In addition, supporting health-promoting fiscal measures is among the most effective intervention. They reduce consumption, generate revenue, and strengthen collaboration between Ministries of Health and Finance. We also celebrate the WHO's decision to include cysteine as a treatment for smoking cessation, expanding access to safe and affordable therapies. We urge member states to shield policies from commercial determinants interference, to explore actions that hold industries accountable for their abuses, and to advance regulatory frameworks grounded in human rights and gender equality. Thank you.
Thank you. I now give the floor to Healthy Caribbean Coalition.
Thank you, Chair. The Healthy Caribbean Coalition, CLASS, Let's Unpack It, Earthmedic Earthners, United for Global Mental Health, NCD Alliance, and Movendi International welcome the PAHO Plan of Action on Non-Communicable Disease Prevention and Control 25-2030, even as member states of the UN General Assembly prepare to adopt the political declaration of the 4th UN High-Level Meeting on NCDs and mental health. We applaud the clarity and simplicity of the plan. We welcome the specific indicators on regulatory actions across risk factors and the emphasis on fiscal tools such as taxation, obesity, TFA elimination, operationalization of better care for NCDs, including the expansion of hearts, access to essential medicines and HPV testing, and surveillance systems and research. We are, however, concerned about the absence of an indicator to measure multisectoral response mechanisms which support social participation and safeguard against conflicts of interest. Policy interference due to weak governance is among the greatest barriers to progress on NCD prevention and control. Thus, a critical element of the NCD response must be the protection of policy making to facilitate implementation of robust, evidence-based regulations. The plan continues to use the outdated and inconsistent term harmful use of alcohol. Finally, the 4x4 approach underpinning the plan excludes both mental health and air pollution, thereby undermining their integration across the NCD agenda and reinforcing a siloed approach to NCDs, mental health, and climate change. While we acknowledge PAHO has a strategy for mental health, we believe the plan should have explicitly referenced both mental health and air pollution in acknowledgement of the broader 5x5 approach. In summary, HCC and our civil society community welcome the plan and look forward to partnering over the next 5 years to support its implementation. Thank you.
Thank you. And now give the floor to the Campaign for Tobacco-Free Kids.
Good morning. On behalf of the Campaign for Tobacco-Free Kids, I would like to highlight the importance of the PAHO WHO Tobacco Control Strategy 2025-2030, which provides a roadmap for intersectoral collaboration to advance and empower policies. Our focus has been on smoke-free environments, packaging and labeling, advertising bans, and raising taxes, the most cost-effective interventions available. These measures are especially crucial for protecting vulnerable groups, particularly children and youth, who must remain at the center of our public health efforts. It is equally important that PAHO continues to exercise a leadership role in surveillance. The recent decision by the U.S. Centers for Disease Control and Prevention to defund its support for the Global Adult Tobacco Survey and the Global Youth Tobacco Survey threatens critical data collection in our region. Without sustained investment in these tools, policymakers will lack the evidence needed to design, monitor, and evaluate effective tobacco control measures. Another critical issue facing our region is road safety. Through our Global Health Advocacy Incubator, we work with civil society partners to advance evidence-based policies in speeding, helmet, and seatbelt use, drink driving, child restraints, and vehicle safety. Motorcycle crashes, in particular, demand urgent attention. Road safety is about protecting life and opportunity. It is not a luxury, it is a right. We look forward to continuing collaboration with PAHO on call on all members to prioritize road safety as a core public health issue. We also collaborate with PAHO to support and advance regulatory measures and policies to prevent obesity and other related diseases in Latin America and the Caribbean. We are making progress in numerous areas, including sugar-sweetened beverage taxes, the restrictions of marketing to children, the regulation of food labeling, and the regulation of food environment in schools and other public settings. We look forward to our ongoing collaboration with PAHO. Thank you.
Thank you. I now call on to give the floor to the Inter-American Society of Cardiology.
Gracias, señor presidente. La Sociedad Interamericana de Cardiología es una organización continental con 81 años de historia que nuclea 27 sociedades nacionales de cardiología y representa a más de 40.000 cardiólogos, con 21 consejos científicos y 5 grupos de trabajo en diferentes áreas, conformados por colegas expertos de todo el continente. Ellos están abocados tanto a la prevención como a la incorporación de nuevas tecnologías, tanto al manejo de patologías prevalentes como la hipertensión arterial y las dislipidemias, como a patologías sociales en expansión como la enfermedad de Chagas. Pero más allá de la producción científica y académica, en los últimos años la SIAC ha prestado particular atención a las tareas de advocacy, es decir, a las intervenciones dirigidas a colaborar con las políticas públicas de cada uno de los países en los que tiene representatividad. En ese camino, desarrollamos desde campañas de promoción de salud como la que estamos realizando en estos días en el marco del Día Mundial del Corazón, con cientos de actividades implementadas por nuestras sociedades miembros, hasta la capacitación de equipos de salud, la implementación de espacios para el debate de estrategias sanitarias y el apoyo técnico para el armado de anteproyectos de ley y normativas. Somos un aliado natural de la Organización Panamericana de la Salud y en ese sentido estamos comprometidos con el apoyo a la implementación de la iniciativa HEARTS 2.0. En términos del plan estratégico de la OPS, podríamos decir que la SIAC puede jugar un rol de acelerador de los procesos para alcanzar los objetivos estratégicos planteados para el periodo 2026-2031. Enfrentando los desafíos del nuevo plan estratégico, queremos ofrecer colaboración técnica junto a nuestras sociedades miembros a todas las administraciones de salud del continente que consideren necesaria nuestra participación para la ejecución de sus políticas en el área cardiovascular. Muchas gracias.
Thank you. I now give the floor to the International Council of Nurses.
Thank you, Mr. President, and good morning, distinguished delegates. The International Council of Nurses acknowledges both the plan of action and the PAHO strategy for the prevention and control of non-communicable diseases, and emphasizes that a strong, well-supported health and nursing workforce is essential to delivering an effective and sustainable NCD response. Yet building effective and resilient health systems requires more than acknowledging this. It demands meaningful investment in education, regulatory reform, and service delivery models that empower nurses and other health professionals to work at their full scope. We envision a health system focusing on promoting positive well-being, not just avoiding disease. Achieving this requires a shift towards health equity, community empowerment, and care by multidisciplinary teams. Advanced practice nurses and nurse practitioners, when fully supported and autonomous, can lead in providing services such as screening, diagnosis, health education, chronic disease management, mental health care, and especially in those underserved and rural areas. The ICN's 2024 primary care report shows that advanced practice nurses improve continuity of care, community prevention, and health system responsiveness. Our 2024 mental health nursing guidelines highlight the need to integrate mental health into primary care for chronic illnesses. Nurse-led, community-based teams provide culturally responsive, accessible care tailored to local needs. However, insufficient focus and investment in these models threaten the strategy's long-term success. Despite the 2025 World Health Assembly resolution that recognized the urgent need to accelerate progress on nursing, extending the global strategic directions for nursing and midwifery to 2030, and underscoring the necessity of coordinated workforce investment, the WHO Saving Lives, Spending Less global investment case for NCDs fails to acknowledge nurses, even though no NCD strategy can succeed without them. In conclusion, advancing the NCD agenda requires recognizing health professionals, especially nurses, as leaders in multi-sectoral collaboration. Strengthening regulations, investing in education, and supporting nurse-led care are key to building equitable, people-centered, and resilient health systems. Thank you.
Thank you. I give the floor to the International Federation of Medical Students Associations.
Good morning, Honorable Chairperson and distinguished delegates. My name is Mia Milicevic, and on behalf of the International Federation of Medical Students Association, we as a federation stress the urgency of tackling non-communicable diseases and mental health as we gather here today. Non-communicable diseases claim over 43 million lives each year, including 18 million people under the age of 70. In the Americas, NCD-related deaths have increased by 43% since 2000, reaching 6 million in 2021, nearly 40% of which were premature. Obesity affects 1 in 3 adults, physical inactivity exceeds 35%, and diabetes prevalence is above 13%. Air pollution alone causes nearly 7 million premature deaths annually, mostly in low and middle income countries, and remains an overlooked determinant. Despite these alarming figures, underinvestment persists. Also, the lived experiences of people with NCDs, including young people, are too often excluded from decision-making. We call for evidence-based, multi-sectoral strategies addressing social, commercial, and environmental determinants through a health in all policies approach. Stronger primary health care for equitable, affordable, and culturally safe services, medicine, and technologies. Fiscal and regulatory measures such as taxation on harmful products, clear nutrition labeling, and advertising restrictions targeted youth. Investments in prevention with focus on children, adolescents, and marginalized groups. Urgent action on air pollution through clean energy, transport, and WHO-aligned air quality standards. And sustainable financing to close persistent gaps. Above all, we urge meaningful youth engagement, not as beneficiaries, but as co-creators. Medical students and young people bring innovation, lived experience, and motivation. Together, let us turn commitments into action and ensure healthier, more equitable futures for all. Thank you.
Thank you. I now give the floor to the International Federation of Pharmaceutical Manufacturers and Associations.
President and distinguished delegates, the International Federation of Pharmaceutical Manufacturers and Associations and the Latin American Federation of Pharmaceutical Industry welcomes WHO and PAHO's continued efforts to tackle the rise of non-communicable diseases. The high-level meeting on NCDs and mental health, which took place last week, has had an important role in rallying global efforts to ensure there is the right political commitment to tackle the growing burden of NCDs across the world. There is an opportunity to capture the momentum of the UN high-level meeting to bend the curve against NCDs in the Americas and the world. The draft declaration includes welcome recognition of the critical role of research and innovation, the importance of vaccines and immunization as part of NCD prevention, and the need for integrated approaches to these diseases. Considering the interconnectedness of chronic conditions, a life course approach to preventing and tackling NCDs is the only way to reduce the huge burden placed on patients and healthcare systems worldwide. Looking ahead, we have an opportunity for countries to go further, to support healthier populations, resilient healthcare systems, and stronger economies. New research published by IFPMA earlier this year demonstrated that by investing an additional 1% of GDP in public healthcare spending, where at least 40% of this is aimed at preventing and treating NCDs, close to 5 million lives could be saved each year in low and middle income countries. Our industry remains a committed stakeholder in tackling NCDs. With more than 1,400 NCD medicines launched in the past 10 years and 75% of our R&D pipeline dedicated to NCDs and their risk factors, we are optimistic about the benefits that scientific innovation will bring to millions of patients. We will continue working with others to build solutions and contribute towards stronger health systems to improve the lives of people living with NCDs. Thank you.
Thank you. I now give the floor to the International Pharmaceutical Students Federation.
Thank you, Mr. President. Honorable Chair, distinguished delegates, the International Pharmaceutical Students Federation Pan American Regional Office, IPSF PARO, represents over 60,000 pharmacy students and recent graduates in 15 countries. Our region faces an urgent crisis. 112 million adults live with diabetes, which tripled since 1990. Cardiovascular diseases claim 2.2 million lives annually. NCDs will cost South America $7.3 trillion by 2050, equivalent to our regional GDP. Yet, prevention remains inadequate. IPSF, Pan American Regional Office, urges PAHO WHO to establish community pharmacy networks partnering with universities for NCD screening and monitoring, support student-led public health initiatives promoting prevention through education and outreach, and integrate pharmacy students into national NCD action plans as community health educators, particularly for diabetes, hypertension, and obesity prevention. We stand ready to contribute our expertise and motivation and innovation to reduce the NCD burden. IPSF PARO strongly supports PAHO's 2025 to 2030 NCD strategy and requests to be a strategic partner in implementation. Thank you.
Thank you. I now give the floor to the Latin American Responsible Self-Care Association and Global Self-Care Federation.
Muchas gracias, señor presidente, estimados delegados. La Asociación Latinoamericana de Autocuidado Responsable, ILAR, con el apoyo de la Global Self-Care Federation, se complacen en presentar esta declaración al Consejo Directivo de la OPS en respaldo al punto 4.5 del programa. Las enfermedades no transmisibles representan la principal carga de enfermedad y mortalidad en nuestra región. Reconocemos el liderazgo de OPS al presentar un plan de acción que prioriza la reducción de factores de riesgo, la integración en la atención primaria y el fortalecimiento en la vigilancia. Subrayamos también el papel del autocuidado responsable como aliado estratégico. La evidencia demuestra que el acceso seguro y oportuno a intervenciones de autocuidado contribuye a reducir riesgos, prevenir y manejar las enfermedades no transmisibles, al tiempo que empodera a las personas para tomar decisiones informadas sobre su salud. Estimaciones recientes confirman que la adopción del autocuidado en América Latina ya genera alrededor de $7.000 millones anuales en economía para los sistemas de salud, con el potencial de alcanzar $13.000 millones para 2030. Sin embargo, persisten desafíos. Según el índice de alfabetización en autocuidado recientemente lanzado por ILAR, aunque más del 80% de los latinoamericanos reconoce la importancia del autocuidado, solo la mitad considera tener los conocimientos y herramientas necesarios para practicarlo eficazmente. Para liberar todo el potencial del autocuidado e impulsar positivamente la implementación del plan de acción, instamos a los Estados miembros a: primero, integrar el autocuidado en las estrategias nacionales de enfermedades no transmisibles y de atención primaria. Segundo, fortalecer la alfabetización en salud y autocuidado para empoderar individuos y comunidades. Y tercero, promover marcos regulatorios basados en riesgo que garanticen un acceso seguro y equitativo a las intervenciones de autocuidado. El autocuidado es una solución costo efectiva y escalable que puede acelerar y complementar la implementación del plan de acción de la OPS. Quedamos a disposición para apoyar en este proceso. Muchas gracias.
Thank you. I now give the floor to Movendi International.
Thank you, Honorable Chair and distinguished delegates. We all share a common vision, a world where every person can live a healthy life, free from preventable harm. But this vision is under threat. Alcohol, I repeat, alcohol remains a leading driver of the NCD crisis in the Americas. Movendi International and CLASS welcome the draft plan of action. We support the recognition of alcohol as a leading driver of disease and emphasizes the need to address the unequal burden it places on communities and people in vulnerable conditions. We welcome the inclusion of high-impact alcohol policy measures, such as taxation, regulation of marketing and availability, and brief interventions. These are proven, cost-effective solutions that deliver lasting benefits for people's health, social justice, and sustainable financing. However, we are concerned about alcohol industry interference because the September version of this draft dilutes key provisions compared to earlier drafts. References placing the region's alcohol burden in a global context have been removed, despite the Americas having the highest alcohol use disorder rates in the world. This erasure only benefits the alcohol industry. We support the recommendation to structure alcohol taxes to reduce affordability, but the corresponding indicator has been weakened. The removal of World Health Organization best buys for alcohol policy indicators also jeopardizes effectiveness and accountability. Finally, and you've heard this a number of times, the growing use of a flawed term, harmful use of alcohol, contradicts science and perpetuates a stigma. We urge member states and PAHO to restore ambitious, evidence-based commitments aligned with World Health Organization best buys and the SAFER program, and to resist pressures, whether they come from industry or even member states, that risk weakening the region's response. Thank you very much.
Thank you. I now give the floor to Public Service International.
Señor presidente, delegados, la Internacional de Servicios Públicos es una federación sindical global que representa a más de 30 millones de trabajadores, de los cuales casi el 60% son trabajadores de la salud y cuidados. Reconocemos la inclusión del tema en la propuesta de la resolución CE 176/RN9 y quisiéramos llamar su atención hacia la salud mental de los trabajadores de la salud y tomar ese tema como fundamental para la sostenibilidad de los sistemas sanitarios resilientes. En la región, la pandemia de COVID-19 evidenció una crisis ya existente que afecta tanto a las personas trabajadoras como también la calidad de atención a los pacientes. El riesgo de problemas de salud mental es mayor en los trabajadores de salud que en la población general. Durante la pandemia, del 23 al 46% del personal reportó síntomas de ansiedad, depresión y burnout, sin mencionar el estrés postraumático. Los trabajadores de salud tienen 24% mayor de riesgo de suicidio que en otros sectores y especialmente entre mujeres y el personal de enfermería. Somos una población altamente vulnerable. Proponemos que la OPS incluya dentro de la estrategia para mejorar la salud mental y la prevención del suicidio de la región de las Américas una sección específica de salud mental para las personas trabajadoras de la salud con los siguientes ejes. 1. Reconocimiento del acceso a los cuidados de salud mental como derecho humano y condición indispensable para garantizar sistemas de salud resilientes. 2. Prevención y reducción de riesgos psicosociales, jornadas excesivas, inseguridad laboral, violencia, discriminación y falta de personal suficiente y un trabajo decente. Acceso oportuno y gratuito a servicios de salud mental para las personas trabajadoras sin estigmatización y confidencialidad. Fortalecer la negociación colectiva y el diálogo social. Y 5, inversión sostenida en políticas de bienestar laboral y cuidado con descanso adecuado, espacios de conciliación familiar y programas de autocuidado. Colocar la salud mental de quienes cuidan en el centro de la agenda es un imperativo ético y una decisión estratégica para garantizar la calidad, universalidad y sostenibilidad de los sistemas de salud resilientes. Gracias.
Thank you. I now give the floor to the World Federation of Societies of Anesthesiologists.
Good morning, distinguished chair and esteemed delegates. My name is Faye Evans. I'm a pediatric anesthesiologist here in the U.S., but today I'm here as the Director of Program for the World Federations of Societies of Anesthesiologists. The WFSA represents 500,000 anesthesiologists in more than 150 countries around the world, including 23 member societies in the PAHO region. We commend the commitment of the PAHO member states to tackling non-communicable diseases, which we know remain the leading cause of global morbidity and mortality. However, treatment and diagnosis, particularly those requiring surgery and anesthesia, are often overlooked in NCD policies and plans. Surgical care is essential to NCD management. Up to 80% of cancer patients will require surgery at some point, whether for diagnosis, curative treatment, or palliation. Cardiovascular disease, the top global killer, frequently demands surgical or interventional procedures supported by safe anesthesia. Timely surgical and anesthesia care for congenital conditions such as cleft palate is also critical to preventing lifelong disability and poor developmental outcomes. We therefore urge member states to integrate surgical and anesthesia services into NCD strategies, including workforce development, essential medicines, and access to monitoring technologies such as capnography. Embed perioperative and critical care within universal health coverage frameworks to promote equitable access. Invest in capacity building through training, regional collaboration, and data systems that track surgical and anesthesia services for NCD care. And establish a sustainable financing mechanism to ensure affordability of surgical and anesthesia services as part of comprehensive NCD management. By explicitly recognizing surgical and anesthesia care in NCD strategies, PAHO member states can move from aspiration to action, closing the treatment gap and saving lives across the region. Thank you.
Thank you. I now give the floor to the World Heart Federation.
Honorable Chair, distinguished delegates, the World Heart Federation supports the Regional Plan of Action on NCD Prevention and Control 2025 to 2030. We commend WHO and member states for the strides made in addressing the burden of NCDs. The region of the America has shown exceptional leadership in tobacco control, hypertension management, and strengthening primary care. However, remain to achieve SDG target 3.4. We urge member states to accelerate action, adopt operational plans for NCDs, and prioritize prevention and control of cardiovascular disease and its risk factor. WHF welcomes the 4th UN political declaration on NCDs and an important milestone. Yet, to truly change the trajectory of CVD, member states must go further and implement evidence-based, cost-effective measures at scale, including treating 500 million more people globally with hypertension, achieving at least 50% hypertension control by 2030, raising taxes on alcohol and sugar-sweetened beverage by at least 50%, and on tobacco products by at least 75% to reduce consumption and generate health revenues. Implement the 2021 WHO air quality guidelines. We commend Brazil for its leadership in hosting COP30, addressing systemic health inequities and establishing sustainable financing structures for CVD management, and committing to a 50% reduction in NCD-related deaths in disabilities by 2050. The U.S. National Multi-Sector NCD Commissions to strengthen prevention and management, ensure coordinated action across health, finance, agriculture, trade, education, and environment, and address the social, environmental, and commercial determinants of health, safeguarding policymaking from industry interference. Thank you.
Thank you. And now I yield the floor to Dr. Hennis to respond to the comments.
Thank you so much, Mr. President, and thank you so much to let's get my orientation. Thank you so much to the 28 member states who have spoken in response to the plan of action, and also to the 15 representatives of non-state actors who have also commented on the plan of action on NCDs 2025 to 2030. And just to reiterate, the purpose of this plan of action is to support member states in accelerating actions necessary to meet the global NCD targets. It is based on the fact that a whole-of-government and whole-society approach with multi-sectoral partnerships is critical to addressing NCDs. So I think this came through very, very clearly that we are all ad idem with this fundamental concept. It is clear that this full recognition of the burden of NCDs as well as mental health and the challenges they pose, not only to healthcare systems, but to socioeconomic advances, and importantly, but often not said, to human development. Member states in their interventions have highlighted the relationship between NCDs and the social determinants of health, and disproportionate adverse impact and those in vulnerable situations, leading to worsening disparities. It is also stated explicitly that health is a universal right. Also of importance is the approach, which is a life course approach through the entire life cycle from even before birth. A number of member states highlighted their alignment between their national NCD plans and the strategic lines of action of this plan. So regarding approaches to risk factors and health promotion, many of the interventions noted national advances in tackling rising rates of childhood obesity through school-based environmental interventions, front-of-package labeling, and taxes on sugar sweetened beverages. And I will state here that the region of the Americas, and particularly Latin America, is really a global leader in terms of advancing interventions, policies, and actual implementation of front-of-package labeling for harmful ultra-processed food products. Many countries also shared the progress they're making in terms of tobacco prevention and control through legislation and policies. We also heard of experiences in terms of promoting physical activity, as well as the importance of breastfeeding. Many countries also, and many of the non-state actors, spoke about the importance of climate as well as air pollution. And questions were asked about why we're doing a 4x4, not a 5x5 approach. In fact, I'll just point out, by way of observation, that the high-level meeting and the political declaration are actually, again, based in 4x4. I am not one to be able to explain why it is shifted this way, but mental health has actually had more of a profile. But our work encompasses mental health, and you will recall that in 2023 and 2024, there were specific resolutions on mental health, and in 2024, there was the first resolution on mental health and suicide prevention. And as you heard also in the discussions, the region of the Americas actually has the highest suicide rate of all the WHO regions, with actually a 17% increase in suicide between the period 2000 and 2020. So these are all considered, these are all in progress, and all being operationalized. Now, in terms of strengthening and integration of NCDs and primary health care, this was universally supported, with many member states speaking about the importance of expansion of primary health care, the need for investment both financially and in terms of investment in human resources and capacity building. Many countries also spoke about the impact of hearts in the Americas. And as you know, this has been the tip of the spear for the Better Care Initiative. And the relevance of improving blood pressure control and reducing premature cardiovascular mortality was a universal theme as well. And I congratulate member states who have made progress, who are implementing successfully, and who are improving blood pressure control in the region. This has been shown unequivocally to actually reduce premature cardiovascular mortality. And we stand ready and willing and able to work with you in terms of expanding the coverage and the control of hypertension, and also expanding the work that's been done in heart so far to include diabetes management, as well as other elements in terms of the Better Care for NCD initiative, which is also being rolled out in the region of the Americas. Also stated was the importance of improving quality of care, which is really the underpinning driver of the Better Care initiative. Many member states spoke about the importance of improved access to medicines and technologies, and I'll use this opportunity again to reiterate the importance of the regional revolving funds, and trust that you were able to attend the side events yesterday, which shows the value of the regional revolving funds, the importance of pool procurement, and the reduction in costs by virtue of using the PAHO regional revolving funds. Financing of health systems, again, was a theme that was quite consistent in many of the presentations, and whereas some countries have actually spoken about integrating special teams in primary health care, the work that we have been promoting includes using a system of referral and country referral, because clearly all elements of NCDs cannot be managed at primary health care. So one must have a system of referral and country referral. The importance of the use of guidelines, and many member states also shared their experiences in improving the quality of care normative guidance, via clinicas, which again is important for accountability in processes. In terms also of improving the quality of care is the importance of digital health. And as you know, there's been a tremendous uptake and progress in terms of the information systems for health, which the Pan American Health Organization has been working with member states in terms of technical cooperation. Countries spoke also about the challenges with surveillance. Many countries reported on the recent implementation or ongoing implementation of plans for operationalizing steps. So clearly surveillance is important, and as part of surveillance also is the importance of providing feedback to health providers and health systems, because quite often there's the information collection which goes on to the administrative level, but those providing care actually don't know how well they're doing or where the gaps exist. So the number of cross-cutting themes, the importance of multi-sectoral approaches, many of the non-state actors highlighted the importance of partnerships. Equity, again a cross-cutting theme, and as stated explicitly, it is important to leave absolutely no one behind. Some of the member states spoke to issues of gender, particularly related to women and children, and also, above all, is the importance of political commitment to what has been achieved to make things happen. And I think, of course, with the high-level meeting, and we're hoping for a final resolution on the political declaration, this is the time to also work to accelerate progress in NCD prevention and management in the region of the Americas. Now, a number of countries made specific inputs, and just 1 second. So we recognized inputs from Cuba, inputs from Costa Rica, also recommendations from Trinidad and Tobago. And these will actually be considered in the implementation and monitoring of the plan as we go forward. Thank you.
Thank you, Dr. Hennis. I'll give the floor to the Director.
Thank you, Mr. Chair. I really want to thank all the comments, suggestions, sharing your accomplishments, sharing the challenge that you have in every country. I also want to thank the non-state actors that have provided some meaningful comments. After all these several comments and from our member states, I think that I just want to highlight 3 topics. But let me first start in recognizing the accomplishments that we have achieved in this region. Because when we compare several indicators from the Americas is the leading region on the response to non-communicable diseases. Since 2007, 18 years ago, when the heads of state of the Caribbean, for the first time in history, clearly stated that non-communicable diseases are not a public health problem, but a problem that was constraining the social and economic development, the countries in this region have developed several relevant initiatives. Last week, during the UN General Assembly, I had the opportunity to interact and to share with the heads of states and ministers of health of our region several side events that clearly showed the similar commitment that we have. For this reason, that the prevalence of the use of tobacco in this region is the lowest in the world. And it didn't happen by chance. It happened because political commitment, public policy implemented based in evidence, scientific evidence, are working and are saving thousands of lives. This is a region that has the most important implementation of the HEARTS initiative. And some countries that have shared their concrete examples, we have in these countries the proportion of hypertension control raising from 25%, 21% to up to 60%. This is saving thousands of lives. This is a region that started in Chile, the front of package labeling, that now has several countries from the North America, from Central America, Caribbean, South America that have already implemented this. And this happened because political commitment, approval of laws and regulations in these countries. So I think that we really need to celebrate these achievements because this was a very important movement in this region that at this moment positioned the Americas as a leader in the world in the response to non-communicable disease. But at the same time, we need to call also our attention to some challenges that still persist. We need to strengthen surveillance systems. I know that several countries have already implemented these steps, but we are still missing several countries in the region that don't have disaggregated data to show what is the picture, what is the situation of the main risk factors in order to propose public policies to address these risk factors. And we need to be bold. I think that we need to be innovative. We need, for instance, to use cell phone-based surveys that are cheap when we compare to populational surveys to provide real-time information to our member states, to Ministers of Health, about what is happening in their countries with the main risk factors, alcohol use, tobacco use, lack of physical activity, ultra-processed food consumption, and other unhealthy behaviors. Second, about the health promotion, we have made a tremendous progress, but you have challenges. Countries that have disaggregated data clearly show that with the vape, the e-cigarettes, and other strategies that the tobacco industry is adopting and implementing, the experience of tobacco among adolescents is increasing. So we cannot, all the progress, all the achievements that you had in the last 2-3 decades can be completely lost if the new generation will recover the prevalence of tobacco use that their grandparents had in the past. So we need to clearly address these new challenges that you have. We need to improve also and we strengthen the dialogue between the health sector, the Congress, the Ministries of Finance, to show that the economic losses related to non-communicable diseases can be reduced if we approve, among other measures, taxation on unhealthy products, on alcohol, on unhealthy food, tobacco, based on the concrete experience that we already have in the region. And finally, we also need to provide a response to people that already have hypertension, diabetes, and cancer. We are making progress. So when I mentioned the success that we have had with heart, but we still need to in each one of the countries, to see the clear, what are the bottlenecks that we still have to transform some very successful pilot projects into national public health policies. It does not make a difference for the population if you have an excellent heart initiative implemented in 20 or 30 health centers. Sorry, but this will not change the game. This will not move the needle. We need to learn with the experience in some countries, El Salvador, Dominican Republic, and several others that have already implemented in more than 80% of the health centers, the heart initiative. This is changing the game. This is saving lives. So we really need to provide better technical support to our member states to identify how we can implement this initiative. What are the bottlenecks? What are the barriers? What are the challenges that you have? Because this will change the game. The same thing goes to diabetes. Now, we still have a lot of undetected diabetes cases that are producing a very important burden of blindness, of kidney diseases, amputation, and other severe outcomes because we don't have the primary health care able to offer screening, treatment, access to medicines and others. So we really have very important challenges. Finally, I want to share with you that as Anselm Hennis also mentioned, and we presented yesterday during the technical briefing, in some events that we had during the UN General Assembly, that our revolving funds are working to provide increased access for equipment to be used at the primary healthcare level, to increase the detection of diabetes and hypertension and cancer, but also access to medicines. Responding to a request from our member states, because we are a member states-driven organization, we started a very productive negotiation, conversation, bidding process with the manufacturers of drugs, medicine for cancer, and now we have the possibility to consolidate the regional demand. That for some treatments for cancer, we reduce the price in more than 50%. So this is a clear way to reduce the unacceptable rate that we still have in this region of cancers that are only detected at the level 3 or 4, that have a late detection. That explains the high rate of cancer mortality that we have in Latin America and the Caribbean when we compare to the cancer mortality rate in developed countries. So I think that I want to finalize. Thank you for your support, for all the conversations that you had during these months to establish the plan of action. This will be a very important guidance for our technical cooperation, for our technical work, to work with each one of the countries to identify the challenges and how we can provide more support, more technical cooperation, to increase your capacity to implement a better response to non-communicable disease. I think that this is really a very important moment of our Directing Council, the approval of this plan of action, because we need to build on the success that you have already had in this region, but they are not enough. We have huge challenges ahead, but I think that with your commitment, with the clear, concrete examples that we already have in this region, we can move further in a very swift way, and by the end of the period of this plan of action, 2030, we will be able to report very important progress in every country and territory of this region. Thank you, Mr. President.
Thank you, Dr. Barbosa. I now ask the rapporteur to present the proposed resolution for the consideration of the Directing Council.
Thank you, Chair. Proyecto de resolución, Plan de Acción sobre la Prevención y el Control de las Enfermedades No Transmisibles 2025-2030. El 62º Consejo Directivo, párrafo preambular primero, habiendo examinado el Plan de Acción sobre la Prevención y el Control de las Enfermedades No Transmisibles 2025-2030, documento CD 62/8, párrafo preambular segundo, reconociendo que las enfermedades no transmisibles, en adelante ENT, principalmente las enfermedades cardiovasculares, el cáncer, la diabetes y las enfermedades respiratorias crónicas y sus factores de riesgo comunes relativos al consumo del tabaco, del consumo nocivo de alcohol, la alimentación poco saludable y la inactividad física son la principal causa de muerte y discapacidad y constituyen el principal desafío para la salud y el bienestar de las personas en la región de las Américas y que suponen una considerable carga social y económica que amenaza el desarrollo regional y nacional. Párrafo preambular tercero. Reconociendo que los determinantes sociales, económicos y comerciales de la salud son los principales factores que impulsan el aumento de la CNT y hacen que supongan una carga desproporcionada para los grupos en situación de vulnerabilidad, lo que exige la adopción de medidas urgentes que abarquen a todo el gobierno y a toda la sociedad para promover la salud y mejorar la prevención y el control de las ENT. Párrafo preambular cuarto, reconociendo los avances realizados en la puesta en marcha de intervenciones para las ENT, costo efectivas y basadas en la evidencia, incluidas las relacionadas con políticas para abordar los factores de riesgo, como también en el fortalecimiento de los servicios de salud basados en la atención primaria y el suministro de medicamentos y tecnologías esenciales, aunque observando que los avances han sido desiguales e insuficientes de cara a la consecución de las metas del Marco Mundial de Vigilancia de la CNT. Párrafo preambular quinto, reconociendo que el objetivo de este plan de acción es ampliar a mayor escala las medidas esenciales que resultan necesarias para acelerar el progreso y reducir en 1/3 para el 2030 la mortalidad prematura por ENT por medio de la prevención y el tratamiento, resuelve. Párrafo operativo primero. Aprobar el Plan de Acción sobre la Prevención y el Control de las Enfermedades No Transmisibles 2025-2030, documento CD 62/8. Párrafo operativo segundo, instar a todos los Estados miembros, teniendo en cuenta sus contextos, necesidades, vulnerabilidades y prioridades, a que, letra A, promuevan la ejecución de las líneas de acción estratégicas contenidas en este plan de acción. Letra B, creen alianzas multisectoriales y fortalezcan la respuesta en todo el gobierno a las ENT, garantizando la coherencia de las políticas entre los distintos organismos gubernamentales y dando prioridad a la prevención y el control de las ENT mediante un enfoque que incluya la salud en todas las políticas, al mismo tiempo que se mejoran los resultados generales de salud de todas las personas afectadas por las ENT. Letra C. Fortalezcan los servicios de atención primaria de salud para garantizar la adopción de un enfoque integrado en relación con las ENT y abordar las brechas en materia de acceso y disponibilidad de servicios, medicamentos y tecnologías esenciales para las ENT que llevan a niveles insuficientes de diagnóstico y tratamiento y a tasas de control por debajo del nivel deseado. Letra D. Fortalezcan los sistemas nacionales de vigilancia con miras a hacer un seguimiento continuo de la prevalencia de la CNT y sus factores de riesgo, fortalecer los sistemas de información en los centros de salud para hacer un seguimiento de la atención y los resultados de las personas con ENT y producir informes de seguimiento de la CNT desglosados por sexo, etnicidad y otros factores. Párrafo operativo tercero. Solicitar al director que, letra A, proporcione cooperación técnica a los Estados miembros para fortalecer las capacidades que contribuyan a la ejecución de este plan de acción y al logro de sus objetivos. Letra B. Brinde apoyo a la cooperación para catalizar y crear sinergias con las iniciativas regionales pertinentes, como la Alianza por la Atención Primaria de Salud en las Américas y la transformación digital de los sistemas de salud, como también la promoción de alianzas multisectoriales para garantizar las intervenciones en materia de prevención y control de las para garantizar que las intervenciones en materia de prevención y control de la CNT sean componentes integrales de estos esfuerzos. Letra C. Informe periódicamente a los cuerpos directivos de la Organización Panamericana de la Salud sobre el avance logrado y los retos enfrentados en la ejecución de este plan de acción mediante un examen de mitad de periodo en el 2028 y un informe final en el 2031. Es todo, presidente.
Thank you. I now yield the floor to the plenary for discussion or any comments. I see no requests. I declare the resolution adopted by consensus. We now move on to agenda item 3.3, election of 3 member states to the Executive Committee on the expiration of the periods of office of Chile, United States of America, and Uruguay. I would like to bring document CD 62/3 to the attention of the Council and report that the nominations of Haiti, Mexico, and Peru were received. I now yield the floor to the Secretary to present the item and report to the Council of the statutory provisions concerning this item.
Thank you, Mr. President. The Executive Committee, as established under the Constitution, is composed of 9 members of the organization elected by the conference or the council for overlapping terms of 3 years. This year, it is the responsibility of the council to elect 3 members to succeed Chile, the United States of America, and Uruguay, whose terms have concluded. I would also like to explain that while France, the Kingdom of the Netherlands, and the United Kingdom have voting privileges, they are not eligible for membership on the Executive Committee in accordance with the Constitution of the organization and the Rules of Procedure. Associate members and observer states are not entitled to vote, nor may they be candidates of the Executive Committee. In addition, the 3 outgoing members of the Executive Committee, again, Chile, the United States of America, and Uruguay, are not eligible for re-election, as the Constitution stipulates that a member may only be re-elected to the Executive Committee after 1 year has elapsed since the expiration of its term of office. The current members of the committee, Brazil, Canada, Colombia, Ecuador, El Salvador, and Guyana, are also not eligible for election this year. If the number of candidates does not exceed the number of vacancies, Rule 51 of the Rules of Procedure applies. And Rule 51 of the Rules of Procedure states, elections shall normally be held by secret ballot, except as concerns the election of an ad interim director when the number of candidates for elective office does not exceed the number of offices to be filled. No ballot shall be required, and such candidates shall be declared elected. Where ballots are required, 2 tellers shall be appointed by the President from among the delegates. Furthermore, Rule 57 of the Rules of Procedure states, the term of office of the members elected to the committee shall begin immediately after their election and shall continue until their successors are elected in accordance with Article 15, Paragraph A of the Constitution. Mr. President, thank you.
Thank you. I wish to inform the Council that as there are only 3 candidates pursuant to Rule 51 of the Rules of Procedure, Haiti, Mexico, and Peru are hereby elected to serve on the Executive Committee. I now ask the Rapporteur to present the proposed resolution formalizing the decision of the Council.
Thank you, Chair. Proyecto de resolución. Elección de 3 Estados miembros para integrar el Comité Ejecutivo por haber llegado a su término los mandatos de Chile, Estados Unidos de América y Uruguay. El 62º Consejo Directivo, párrafo preambular primero, teniendo en cuenta lo dispuesto en los artículos 9.b y 15.a de la Constitución de la Organización Panamericana de la Salud, párrafo preambular segundo, considerando que fueron elegidos Haití, México y Perú para integrar el Comité Ejecutivo por haber llegado a su término los mandatos de Chile, Estados Unidos de América y Uruguay, resuelve, párrafo operativo primero, declarar elegidos a Haití, México y Perú para integrar el Comité Ejecutivo por un periodo de 3 años. Párrafo operativo segundo, agradecer a Chile, Estados Unidos de América y Uruguay los servicios prestados a la organización por sus delegados en el Comité Ejecutivo durante los últimos 3 años. Es todo, presidente.
Thank you. If there are no objections, I declare the resolution adopted. Ministers, delegates, I now propose that we take a coffee break to resume at 11 a.m. And when we resume, we will start.
You want to make an announcement?
I'm sorry.
Thank you, Mr. President. Just a brief announcement before the break. We would like to remind the plenary that today will be the last day to visit the publication stand that you will find at the patio. All publications exhibited, books, brochures, flyers, and booklets, are free. and there are QR code cards to access them online, including all of the new country annual reports, which have a brand new format, so we encourage you to see those annual reports. We would also like to remind our delegates to please send your interventions to interventions@paho.org. This will help with the preparation, of the final report of the session. Please ensure that each intervention includes the name of your country and the agenda item written out in full. Mr. President, thank you.
Thank you. Thank you. As I said, we will resume at 11 a.m. and we will then proceed to items 4.7 and 7.6. Thank you.
In the Americas, as around the world, cardiovascular diseases are the leading cause of death. But so many of these lives could be saved with better control of hypertension. If we could raise population control from 36 to 50%, we would prevent nearly 440,000 deaths and almost 3 million cardiovascular events. From the global vision of the World Health Organization came hearts. The Pan American Health Organization, with leadership from the Ministries of Health of the region, expanded that vision into Hearts in the Americas, a strategy for quality improvement. Today, 33 countries are committed. More than 9,900 health centers are implementing Hearts, reaching 42 million adults. We are transforming primary health care with the Hearts clinical pathway, promoting team-based care and the use of data for continuous cycles of improvement. In 2025, over 6.3 million adults are receiving treatment, and more than half already have their blood pressure under control. But our story is still being written. Over 200 million adults in the Americas live with hypertension. And our goal is clear, that everyone has access to better care. This is Hearts in the Americas.
Los casos de sífilis están en aumento en América Latina y el Caribe, con un aumento del 30% entre los adultos de 15 a 49 años. Esta enfermedad afecta a personas de todas nuestras comunidades y se propaga rápidamente, pero tenemos el poder de detenerla. La sífilis congénita representa una amenaza seria para los recién nacidos, pero podemos prevenirla. Ahora es el momento de actuar. Las pruebas integradas y el tratamiento oportuno son esenciales para proteger a nuestras comunidades. Para más información, visita paho.org.
Aging opens up a world of possibility. The possibility of continuing to do what we love and be who we are. But without the right support, aging can also bring limitations. Poor health, vulnerability, loneliness. We believe that a safe, caring, and supportive environment can turn aging into an opportunity to be healthy, to live fully, to embrace change, and keep learning and developing. We believe all people have the right to thrive at any age. Adding dignity to years, well-being to years, life to years. It's a decade of healthy aging in the Americas, adding life to years.
On November 14, 1924, in Havana, Cuba, history was made for public health in the Americas. The Pan American Sanitary Code was signed ad referendum by representatives from 18 nations at the Assembly Hall of the Academy of Medical, Physical, and Natural Sciences, now known as the Carlos J. Finlay Historical Museum of Science. This code, later ratified by all countries in the Americas, defined the duties of the Pan American Sanitary Bureau, today known as the Pan American Health Organization, PAHO. It established clear responsibilities for countries to report disease outbreaks, standardize prevention and control efforts, and gather crucial health data. This collaborative approach, rooted in the values of Pan-Americanism, recognized that health cooperation was essential, not only for the well-being of each country, but for fostering safe international trade across borders. Even today, a century later, the Pan American Sanitary Code remains a guiding force, continuing to shape PAHO's mission to promote the health and well-being of individuals, families, and communities across the Americas. This code stands as one of the most remarkable achievements in health policy, uniting nations under a shared commitment to public health excellence. In 2024, a century after the signing of the code, we honor the legacy of its architects, as PAHO and its member states persist in their efforts to improve the health and well-being of all people in the Americas.
Our success has been through governments and the dedication and commitment of our health workers and our policymakers.
Everywhere where there is a community, you can train people from the community in doing diagnosis and treatment and report to you.
Próprio esforço do grupo, nós temos pessoas aqui dentro da malária que realmente estão dispostas a fazer o trabalho com motivação e carinho. Trabalhar com a própria comunidade foi a chave para chegar onde chegamos.
I would like really to congratulate these health workers in this area because I experienced the challenge they are facing to reach these places. You can't do that if you are not committed.
I think in the foreseeable future, we can envision a malaria-free Amazon.
We can change the life of many people by reaching this elimination goal.
Yo me llamo Daniela Gómez, me dedico a pintar, ilustrar y hacer murales también, pinturas en formatos grandes sobre nuestro entorno, con nuestra cultura. Me gusta mucho pintar.
Está muy bonito y muy alusivo a lo que en estos momentos está pasando con lo de la fiebre amarilla.
Estamos en el municipio de Ataco, un municipio que queda al sur del departamento del Tolima, hace parte del Foco Sur. Es uno de los municipios que tiene un número importante de casos y una letalidad bastante alta, es decir, tenemos 9 muertos como producto de la fiebre amarilla.
Entonces nosotros queremos, mediante el arte, poder llegar a la gente y poder invitarlos a que lo vean como algo amable, que se dejen de lado los mitos de que es algo malo y pues tomen la decisión de vacunarse para salvar las vidas.
Tu salud es tu poder. Claro que sí, porque es lo más indicado. Uno puede tener muchas cosas y puede tener todo, digamos, pero si no tiene la salud, que es lo primordial, no puede disfrutar, no tiene nada si no tiene salud.
Estamos haciendo este mural como parte de una estrategia para llegar a la comunidad, para sensibilizarlos de la importancia de la vacunación. Queremos que la comunidad entienda que acceder a la vacuna es de manera gratuita, que es solo una dosis para prevenir la enfermedad durante toda la vida y que es el poder que nosotros tenemos como personas, como humanos, para enfrentar este brote de fiebre amarilla en el departamento del Tolima y en todo el país.
Me parece excelente idea para que la gente tome conciencia y se vacune.
Welcome. Let's take a journey to understand how PrEP, or pre-exposure prophylaxis, can protect you from HIV. We'll explore the science behind this powerful prevention tool.
Oral PrEP are pills used to prevent HIV. But how exactly does it work?
Once you take the pill, it dissolves in your stomach and gets absorbed into your bloodstream, where it travels to areas where HIV might enter, like genital and rectal tissues. PrEP is made up of 2 main medications, tenofovir and emtricitabine. HIV typically targets CD4 cells, which are crucial for your immune system. But this is where PrEP steps in.
The medications in PrEP block the virus from replicating in CD4 cells, preventing it from establishing an infection.
By stopping HIV from copying itself inside your CD4 cells, eventually it dies off. This keeps your CD4 cells healthy and strong, effectively preventing HIV from spreading and thus transmission.
PrEP is highly effective when taken as prescribed.
It's a powerful tool that allows you to take control of your sexual health and live without fear. For those who prefer not to take a daily pill, there's an alternative called PrEP on demand or event-based PrEP. This involves taking 2 pills 2 to 24 hours before potential HIV exposure, followed by 1 pill 24 hours after the first dose and another pill 48 hours after the first dose. This method is ideal for people who don't have frequent sex and can't plan ahead. PrEP is recommended for people at higher risk of HIV. Side effects of PrEP are rare and usually mild, like nausea or headaches, and they typically go away after the first few weeks.
The best part, PrEP is over 90% effective at preventing HIV when taken as prescribed.
Talk to your healthcare provider to see if PrEP is right for you.
If using condoms isn't an option, PrEP puts you in control of your sexual health.
For more information, visit paho.org or talk to your healthcare provider today.
Life is better with PrEP.
Eu só ficava com o olho parado olhando para cima. E eu me desesperei, eu achei que ela ia morrer.
Ele não respondia, a gente falava, ele não respondia. Usando fralda, né? Estava bem magra.
Tuberculose, criptococose e histoplasmose são as 3 principais infecções oportunistas que mais matam pessoas com AIDS hoje em dia. A diferença dos testes rápidos para os métodos convencionais é que em 30 a 40 minutos nós conseguimos saber qual é a infecção oportunista que está acometendo essa pessoa.
E a gente ter um método diagnóstico rápido para fazer, ter certeza do que a gente está tratando faz muita diferença.
Melhorou do padrão ventilatório, também melhorou.
Agora eu já caminho um pouco sozinha, né? Evolucionei.
Aprendendo a caminhar de novo que nem um bebê.
Pra quem tava em cima de uma cama, sem falar, sem se mexer, isso é ótimo, né?
Eu me levantei, caí, tomava banho com a mãe, aqui com cima eu tomava banho sozinho, e agora sim, tudo eu agora.
Nós somos um grupo que se sensibiliza muito com as questões de HIV e AIDS, então eu chego até a me emocionar para falar deles. Mas que de fato é uma equipe que faz muita diferença assim, no trabalho aqui em Porto Alegre e que tem muita vontade de mudar as condições materiais de vida das pessoas.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Pues me manejo mucho en esto internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa, lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud y acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área de telesaúde. Isso aí, para mim, é como fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Antes, planear la adquisición de vacunas, medicamentos y suministros podía tomar a los países horas y múltiples hojas de Excel. Hoy, todo se hace en minutos en un solo portal. Este cambio inició en el 2023 con el lanzamiento del portal de Estados miembros de los fondos rotatorios de la OPS, una plataforma en línea para los países que permite centralizar la información y los procesos de compra del Fondo Rotatorio de Vacunas y el Fondo Estratégico. Cada año, los gerentes de programas nacionales de salud pública que participan en los fondos consolidan las necesidades de medicamentos, vacunas y otros suministros para sus poblaciones y las envían a la OPS, quien realiza una compra conjunta con todas las solicitudes recibidas de la región. En el pasado, los gerentes de programas realizaban estas solicitudes completando hojas de cálculo, pero hoy solo toma unos cuantos clics. Esta plataforma es una ventanilla única que agiliza el trabajo y fortalece la salud pública.
Me parece que es algo muy positivo para nosotros, nos agiliza mucho más. Obviamente estamos viendo que todo se va modernizando y se van generando herramientas digitales. Me parece que está muy bueno.
Tras su lanzamiento, el portal ha incluido mejoras, como un rediseño de su interfaz y 2 nuevos módulos en junio de 2025. Seguimiento a finanzas y compras, con los cuales los usuarios pueden monitorear recursos, línea de crédito y el avance de sus pedidos en tiempo real.
Nos permite dar seguimiento a nuestros pedidos, a nuestros inventarios, a nuestras necesidades, y eso siempre representa una ventaja para el funcionamiento de la cadena de suministros, especialmente para nuestras instituciones que somos prestadores de servicios de salud.
Tras 2 años de su lanzamiento, el portal tiene 800 usuarios activos. Los módulos de finanzas y compras se han consultado más de 1.500 veces y ha permitido la entrega oportuna de los planes de demanda anuales por su facilidad de monitoreo en tiempo real.
I'm happy for the digitalization. This is an easier way of doing it.
Los fondos rotatorios regionales de la OPS continuarán buscando mejorar la experiencia y la transparencia en la información, facilitando así la rendición de cuentas en sus Estados miembros para ofrecer cooperación técnica sólida, demostrando que juntos somos más fuertes.
Ministers and delegates, we will now resume. Agenda item 4.7, Strategy on Health and Migration 2026 to 2031, and item 7.6, Health of Migrants Final Report. I would like to bring documents CD 62/10 and CD 62/INF/6 to the attention of the Council and invite Dr. James Fitzgerald, Director of the Department of Health Systems and Services of the Pan American Sanitary Bureau, to come to the head table. I yield the floor to the representative of the Executive Committee to report on this item.
Thank you, Mr. President. Item 4.7, Strategy on Health and Migration 2026-2031, and item 7.6, Health of Migrants Final Report. The Executive Committee reviewed the results achieved under the policy on health of migrants and also discussed the proposed new strategy on health and migration for the period 2026-2031. Several delegates expressed support for the proposed strategy. It was pointed out that issues relating to health and migration do not only affect the individual countries, but are regional in scope, and that migration poses risks to health security of both migrant and host populations. The need to strengthen health systems to address health security issues and ensure that health and well-being of both migrants and host communities was underscored. The importance of cross-border cooperation on matters relating to health and migration was highlighted. Information sharing and collection of disaggregated data to bolster health surveillance was also considered crucial. At the same time, it was noted that individual contexts, needs, resources, capacities, and priorities of member states must be taken into account. Following the deliberations, the Executive Committee was unable to reach consensus on the proposed resolution on this item, and therefore adopted Decision C-176-D2, requesting the Bureau to facilitate the consultation process with Member States during the intercessional period prior to this directing Council. Thank you, Mr. President. This concludes my report.
Thank you, sir. I now yield the floor to Dr. Fitzgerald to present the item.
Honourable President, Director Dr. Barbosa, delegates to the 62nd Directing Council, I am pleased to present for your consideration the final report on health of migrants, CD 62, Information 6, and document CD 62-10, Strategy on Health and Migration 2026 to 2031. In 2016, the 55th Directing Council approved Resolution CD 55/13 on health of migrants, with actions to address the public health challenges arising from a significant increase in migration throughout the Americas at that time. The resolution that was adopted and the plan of action developed through the PAHO high-level ministerial meeting in 2018 called on Member States to generate health policies and programs to address the health needs of migrants, including targeted interventions to reduce migrants' health risks by strengthening public health programs and services. 9 years on, the final report being presented here today notes that some progress has been made in Member States, particularly in intersectoral policy development and cooperation between countries, and capacity development in the organisation and provision of health services in countries of origin, transit and destination. Innovative models to address the health of migrants are reported by countries, supported by robust legal frameworks and increased political engagement within and between countries. Notwithstanding, the report also highlights that important challenges remain as migration trends in the region of the Americas continue to increase in both complexity and scale. This evolving context has significant public health implications for both migrant and host populations, particularly in terms of health security and the resiliency of health systems, access to services, disease prevention and control, and continuity of care. This context is now reflected in document CD 6210, Strategy on Health and Migration 2026 to 2031. This strategy document was presented to the 176th Executive Committee in June 2025, following consultation with 14 countries in March 2025, multiple consultations with individual countries, and written comments incorporated from 9 countries. The Executive Committee, however, did not approve the resolution corresponding to this document, but through Decision 176/2 requested the Secretariat to work intercessionally with Member States to address pending issues. The strategy document being presented today aims to address those pending issues highlighted at the Executive Committee, and observations have been received through individual meetings with countries and through Member State consultation held on September 15th with 15 countries participating. Diverse comments were received at this time. However, it's important to note that no consensus was achieved on the proposal at this session. 3 lines of action are proposed, aimed at strengthening health security and health systems resilience through evidence-based decision-making and actions, and service delivery capacity in health and migration. Secondly, strengthening health surveillance, information management and sharing, and research to support decision-making. And finally, strengthening intersectoral partnerships and networks, including cooperation among countries. The Secretariat would like to thank all Member States for their support and contributions to the development of this strategy document thus far. Thank you, Mr. President.
Thank you, Dr. Fitzgerald. The Directing Council is invited to review the information presented in these 2 documents and provide any comments it deems pertinent. The discussions on the proposed resolution presented in Annex A of the document CD 62/10 will take place once the rapporteur has read the proposed resolution. I will now open the floor to the plenary for discussion of the documents presented. I give the floor to Guyana.
Mr. President, Guyana position. The strategy being presented here today differs considerably to the document that was presented to the Executive Committee in June. We recognize that substantive and significant difference in position were expressed on this document at the time, and we appreciate the efforts made by the Secretariat to reconcile these positions intercessionally, as reflected in the text of the strategy being presented today to the Directing Council. However, Guyana also notes that despite these efforts, no consensus on the third item has been achieved. We saw this clearly in the country consultation held in September 15th, 2025 on the new draft, where countries continue to express significant difference in their positions on the document. Noting this and the comments being presented here today, I would like to propose that we suspend discussion on this item at this time, that no resolutions be adopted on this item, and that the Secretariat continue to work with Member States on this issue, which may be retaken by PAHO governing bodies at a later date. I would also like to ask the Secretariat to continue to deliver the necessary technical support to Member States in this important area of work in the interim. Thank you.
Thank you, Guyana. I now give the floor to Belize.
President, distinguished guests, Belize welcomes the presentation of the Strategy on Health and Migration 2026-2031 and commends the Pan American Health Organization for its leadership in developing a comprehensive framework that responds to one of the defining health challenges of our region. Migration is not a distant reality for Belize. It is a daily experience. Our geographic location makes us both a transit and destination country. And we are seeing increasing flows of migrants and refugees, many in vulnerable circumstances. These dynamics place pressure on our national health system, particularly in ensuring equitable access to essential services, continuity of care, and maintaining preparedness for disease outbreaks. We strongly support the strategy's emphasis on three interlinked areas: strengthening resilient health systems and health security so that migrant and host population alike can access services without discrimination; improving health surveillance and information systems, including the integration of migration-sensitive variables and cross-border data sharing; and enhancing intersectoral and regional cooperation, which is vital for countries like Belize that depend on collaboration with neighbors to manage migration-related health issues effectively. For Belize, this strategy is not just relevant, but essential. It aligns with our commitment to universal health coverage and the international health regulations. By implementing it, we can strengthen primary health care, ensure continuity of care for returnees, and address broader social determinants of health such as housing, nutrition, and mental well-being. We recognize that to make this strategy a reality, adequate resources and sustained political will are necessary. Belize therefore calls on member states to commit the required technical and financial support, and we stand ready to share experiences and collaborate in building more inclusive and resilient health systems for our region. President, Belize fully endorses the proposed resolution and reaffirms our commitment to ensuring that no one is left behind, including those on the move. Thank you.
Thank you, Belize. There was a proposal by Guyana that consideration of this item should be postponed. I just wonder, is there any other country which is in support of this proposal? Guatemala. You have.
No, I thought it was, we were proposing. No, I was saying that you asked for other countries that were
in support of the proposal.
No, that we support that they should not be continued because the technical aspects were not totally elucidated.
Mm-hmm. I believe a number of countries, Costa Rica, you. I don't know. Guatemala thinks it should be postponed. Grenada, you're saying it should be postponed. Dominican Republic is saying so. Costa Rica is saying so. That's 4. Brazil is saying so. Paraguay is saying so. Bahamas, yeah, is saying so. So we have a number of countries. It's about 7 countries. So I'm getting a number of countries, obviously, that favor the postponement. Are there any countries that think that we should go ahead with it in these circumstances? Belize and Suriname. You're saying that we should continue with the discussion. So I think we have a proposal that it be postponed, and we have 2 countries that are saying that they prefer so that we continue the debate. So clearly, I think we might have to vote on this. Excuse me a minute. So, Colombia?
No, presidente, es un tema de orden porque no sé si le pasa a otros colegas, pero no estoy entendiendo la metodología para tratar este asunto. Le ruego a la mesa que nos aclaren la metodología para tratar esta situación.
Thank you. I'm going to ask that we take a 5-minute break so that we clarified with the legal, okay? Are you in agreement with that? Ministers, honorable ministers, delegates, before we took the short break, there was a proposal from Guyana that consideration of this matter be postponed. A number of countries indicated that they were in support of this proposal, and there were some others who thought that they were not in support of the proposal. Ideally, we would like to have a consensus position on this. Should we proceed with the debate, or should we adopt the position of Guyana that consideration of this matter be postponed? As I said, ideally, we would like consensus, a consensus position, but if that is an untenable situation, then we will have to go to a vote. I'm going to ask the question again. All countries in agreement with the proposal of Guyana that consideration of this matter be postponed? Is there any objection? No, we're not going to vote yet. Is there any objection to this proposal? Any honourable member wants to speak? And to Suriname, I believe.
Yes, Mr. Chair. I would like to know what the timeline is if we go with a postponing of this matter, because we are quite a while busy with this item, and I think that somewhere on the timeline you have to conclude. And even if we go on with it, you see that some items don't work, you can always amend. So what's the timeline? I think that a lot of our countries, as we speak, we are dealing with migrants. So what's the timeline? Thank you, Mr. Chair.
As I understand it, this matter would go to the executive committee, and they will prepare their agenda as to when it will be dealt with. That is my understanding. Are you clear, Suriname? The executive committee meets after the directing council. Immediately after this directing council, they have their first meeting. Does that answer your question?
Yes, Mr. Chair, I'm clear.
In Annex A, there are 3 options to the resolution. And I want to be clear, are we looking at the 3 options, or are we selecting one of the options?
My understanding is that we are deferring the entire thing, the entire discussion. We are not looking at the options of the resolution at this point.
Yes, I fully understand that, but deflecting it in consideration of which of the options?
I don't see any options. Which of the options you are referring to in the resolution?
So we have resolves to approve the strategy on health and migration.
Mm-hmm.
And then we have to urge all member states considering their contexts, needs, vulnerabilities, and priorities to support, strengthen, etc. And then we have the third. So, I mean, in consideration where 2 states considering their needs, their context needs, vulnerabilities, and priorities, I understand the issues that some countries would face, and I'm just wondering if it would be captured there.
I understand, from my understanding, we have the resolution, and what you're speaking to are the operational actions, paragraphs, operational paragraphs, and the resolution. But if we're not considering the resolution, then we can be considering the operational paragraphs. Does that answer your question? Yes. Thank you. So I'll go again. The proposal from Guyana that the consideration of this matter be postponed and be then transferred to the next meeting of the executive committee for consideration and to determine, try to reach consensus. Clearly in the intersessional meetings there was still not consensus, and obviously this needs more discussion. So I'm asking all members in agreement that this matter should be deferred, postponed to the next executive committee meeting. Is there any dissenting voice? I see none, so I take it that this matter will be postponed. For further consideration of this matter will be postponed. Thank you.
And we'll reflect it in the report.
Obviously, this will be reflected in the report of this meeting. Thank you. We now go to item 7.2, implementation of the international health regulations. I would like to bring document CD 62/INF/2 to the attention of the Council and invite Dr. Ciro Ugarte, Director of the Department of Health Emergencies of the Pan American Secondary Bureau, to come to the head table. I now yield the floor to the representative of the Executive Committee to report on the item.
Thank you, Mr. President. Item 7.2, implementation of international health regulations. After reviewing the report on this item, the Executive Committee welcomed the progress made in implementing the international health regulations, the commitment of states parties of the region to regional cooperation and coordination in preventing, detecting, and responding to infectious disease outbreaks was highlighted. State parties were encouraged to continue reporting public health events through their national IHR focal points in order to provide early warning and facilitate timely responses. Delegates drew attention to the current outbreaks of measles, Mpox, dengue, yellow fever, and other diseases, and emphasized the need for collaboration and continued strengthening of regional, sub-regional, and national capacity to detect, contain, and respond to public health threats. Sustained focus on the use of practical tools, such as external evaluations, to identify gaps and to build operational readiness was urged. Multilateralism, technical cooperation, and strengthened health systems were seen as essential pillars of a resilient and a more inclusive global health response. Coordinated implementation of the amended international health regulations and the new pandemic agreement was considered vital to ensure comprehensive, efficient, and inclusive management of future public health emergencies. Thank you, Mr. President. This concludes my report on the item.
Thank you. I now yield the floor to Dr. Ugarte to present the item.
Thank you, Mr. President, Director, distinguished Member States delegates, colleagues. I'm glad to present the agenda item 7.2, implementation of the international health regulations. In accordance with the IHR provisions, the current report centers on acute public health events, states parties' core capacities, administrative requirements, and governance. This report also highlights issues requiring concerted action by states parties in the region of the Americas and by the Pan American Sanitary Bureau to enhance future application and implementation of the regulations and compliance with them. This year, all 35 states parties in the Americas confirmed or updated the contact information of their national IHR national focal points, along with the updated list of 202 national users of the Secure Event Information Site. Connectivity routine tests also were successful by phone and email for 32 of the 35 states parties. From 16 July 2024 and 15 July 2025, a total of 58 of the 94 newly identified public health events were notified first by the IHR national focal points. Of the remaining 36 public health events, 19 events were identified from official information and published by national governments agencies, while a verification request was sent to the national focal points for 17 events. In conclusion, in the Americas, I am glad to mention that 85% of all the events were first reported by the countries, either through the IHR mechanisms or through official communications. Most of the events were infectious. 10 related to measles, 5 to Oropouche virus disease, 5 to influenza due identified avian or animal influenza virus, 4 to malaria, 4 to Mpox, and others. 1 was related with radionuclear event, 1 to product-related hazards, and 1 was chemical-related. Thanks to the rapid response of the countries and the support of the organization and other partners, only a few of these events affected more than 1 country. During this reporting period, PAHO published 40 epidemiological alerts and updates and 5 public health risk assessments on its website. Just in the last 3 months, the IHR regional contact point for the Americas in the Secretariat of PAHO sent 94 confidential daily reports of public health events to all countries in the Americas. These reports contained summaries of notifications, verifications, and additional information requests sent to the corresponding IHR national focal points. This reflects the close collaboration between the Secretariat and its member states. With respect to the core capacities, all 35 state parties in the region of the Americas comply with the submission of the State Party Self-Assessment Annual Report to the 78th World Health Assembly for the 3rd consecutive year. Special recognition to Honduras that have just completed the IHR voluntary external evaluation, including the immunizations component, and to Jamaica that has initiated the process and will complete the voluntary external evaluation this year. We encourage states parties to conduct these evaluations and develop national plans for health security to strengthen their emergency prevention, preparedness, and response capacities. In 2024, the regional average of the reported IHR core capacities was 64%, as in the previous year. 86% average in North America, 63% in Central and South America, and 60% in the Caribbean. A training on ship sanitation and the issuance of ship sanitation certificates for 14 states, parties, and territories in the Caribbean was held in Grenada in May of this year, with the support of trainers from the Public Health Agency of Canada. As you are aware, the IHR 2005 is a legally binding instrument for health emergencies, and its future governance is related to the implementation of the amendments adopted by the 77th World Health Assembly through the resolution WHA 77.17 on the 1st June of 2024. On August 8th of this year, the Director General of WHO notified all state parties of the rejections, reservations, and declarations submitted. The 2024 amendments entered into force on 19 September of this year for the states parties that did not reject them. PAHO convened also 2 informative sessions regarding the amendments with a special emphasis on in the designation or the establishment of the National IHR Authority. The 2024 amendments highlight the difference between the new National IHR Authority responsible to coordinate the implementation of these regulations across the country and to exercise rights and comply with the obligations with political connotations, leverage the decision-making. And the National IHR focal points remains in the same function to always be accessible and to comply with obligations regarding event-related communications, and the competent authority is related to the designated points of entry. States parties are expecting a notification from WHO inviting states parties to formally submit contact details of their national IHR authority to confirm the national focal points and also the competent authorities for the designated points of entry. WHO IHR contact platform is being adapted to host these authorities, and information details will be shared by the Secure Event Information site. The Directing Council is invited to take note of this report and provide any comments it deems pertinent. Thank you, Mr. President.
Thank you, Dr. Ugarte. I now invite the Directing Council to take note of this report and provide any comments it deems pertinent. I now open the floor to the plenary to begin the discussions. Jamaica, sorry.
President, Jamaica's experience over the last 5 years has served to underscore the importance of health system resilience that includes attainment of the core capacities defined in the IHR. Our health system has been in a constant state of response since 2018, from the protracted dengue outbreak, followed by the emergence of the COVID-19 pandemic and multi-country outbreak of Mpox, to several occurrences of severe weather events, including hurricanes, protracted drought, periods of severe heat stress, and occasions of flooding. Jamaica has made progress on implementation of IHR core capacities based on the state party's annual report. We have achieved 100% compliance with mandatory annual reporting, significant improvement realized through increased capacity for advocacy, increased focus on points of entry, and strengthening of the Jamaican IHR national focal point. Jamaica applauds the success on the amendments to the IHR and the continued work to conclude the annex to the INB for the completion of the pandemic accord. At the same time, we must state that the continuation of the review process of the INB PABS Annex is proceeding at an accelerated pace that is challenging to small island developing states like Jamaica. Jamaica will be conducting its first voluntary external evaluation in November to December 2025. Preparatory activities include the self-assessment phase of the 15 core capacities plus immunization has been conducted over the past 2 years with intense meetings and consultations involving relevant stakeholders and authorities in country. The commitment of Jamaica to this process with the support of PAHO has enabled the convening of all sectors involved in the development and maintenance of IHR core capacities. The development of a national action plan for health security based on the VEE is critical as the final aspect of the process. Jamaica commends the work of the Bureau and the Secretariat for amendments to the IHR and its implementation. We commit to continued participation in regional discussions on the review process and required actions to complete the PABS Annex to the INB towards a meaningful final pandemic treaty. In the interim, we want to highlight that Jamaica is committed to enhancing the One Health initiative and will continue to forge ahead with the implementation of the IHR capacities guided by the IHR monitoring and evaluation framework. Thank you.
Thank you, Jamaica. I now give the floor to Guyana.
Mr. Chairman, Ghana supports the report on the IHR implementation and continue to look at on the leadership of PAHO. The COVID-19 pandemic reminds us of the critical importance of IHR as the cornerstone of preparedness and response. Ghana has made progress in strengthening its IHR core capacities. With PAHO's support, we have expanded event-based surveillance and epidemic intelligence training, improved molecular biology laboratory capacity, and reinforced point of entry with stronger coordination among border and health authorities. We've also advanced the integration of the One Health approach, particularly in zoonotic disease monitoring. At the same time, challenges remain, such as limited specialized human resources and the need for stronger cross-border collaboration continue to affect its ability to fully implement the IHR. Going forward, Guyana looks to PAHO continued cooperation in building epidemiology and laboratory capacity, expanding digital tools for real-time surveillance, and strengthening emergency preparedness, including simulation exercise and risk communication. We have also underscored the importance of regional solidarity, guaranteeing timely access to vaccines, medicine, and diagnostic during future health emergencies. Chair, Guyana reforms its full commitment to the IHR and to working with PAHO and member states to build a resilient, responsive health system that protect the health security of our people and the wider regions. Thank you.
Thank you, Guyana. I now give the floor to Chile.
Gracias, señor presidente. Chile reafirma su compromiso con el fortalecimiento del Reglamento Sanitario Internacional como instrumento clave para la seguridad sanitaria global. Valoramos el esfuerzo regional en la implementación de sus enmiendas y la capacidad demostrada por los Estados parte para responder oportuna y coordinadamente ante eventos agudos de salud pública. En este contexto, reconocemos los significativos avances logrados en la vigilancia epidemiológica, impulsados por la consolidación de la vigilancia basada en eventos, labor que en nuestro país realiza el Centro Nacional de Enlace. La inteligencia epidémica, como ciclo de recolección, análisis e interpretación sistemática de información para detectar potenciales amenazas, mejoran la detección de brotes y aceleran la respuesta sanitaria. Con miras a mejorar la arquitectura sanitaria global, Chile reafirma su respaldo a la entrada en vigor de las enmiendas al Reglamento Sanitario Internacional en septiembre de este año, destacando la relevancia de su implementación progresiva, con énfasis en fortalecer las capacidades nacionales, la interoperabilidad de los sistemas y la transparencia en la comunicación de riesgos. El país avanza en la institucionalización del reglamento sanitario como mecanismo de gobernanza efectiva mediante la creación de una nueva división especializada dentro del Ministerio de Salud, encargada de coordinar su aplicación a nivel nacional en conformidad con los lineamientos entregados por la nueva Autoridad Nacional de Reglamento Sanitario Internacional. Asimismo, nos encontramos en desarrollo de un plan pandémico con participación multisectorial fundamentado en las lecciones aprendidas durante el COVID-19. Chile también respalda el nuevo acuerdo sobre pandemias como complemento estratégico del Reglamento Sanitario Internacional y subraya la necesidad de garantizar equidad, solidaridad y acceso oportuno a recursos críticos durante las emergencias sanitarias. Finalmente, reiteramos nuestra disposición a colaborar con los países de la región y con la Organización Panamericana de la Salud en la construcción de sistemas de salud más resilientes, integrados y preparados para enfrentar los desafíos del siglo XXI. Tomamos nota del informe y agradecemos sus recomendaciones. Gracias.
Thank you, Chile. I give the floor to Guatemala.
Muchas gracias, presidente. Agradecemos la presentación del informe sobre el estado de la aplicación del Reglamento Sanitario Internacional. Guatemala ha continuado con los procedimientos de autoevaluación de capacidades, notificación y verificación de eventos con base al RCI. En 2023, Guatemala se sometió a una evaluación externa voluntaria, la cual permitió realizar un análisis profundo de nuestras capacidades de preparación, vigilancia, alerta y respuesta ante varios eventos sanitarios de importancia internacional. Este ejercicio fue fundamental para identificar fortalezas y áreas de mejora y reafirmó nuestro compromiso con la seguridad sanitaria global. A través del trabajo de nuestro Centro Nacional de Enlace, hemos desarrollado actividades de coordinación interinstitucional y monitoreo de avances, alcanzando un 38% de progreso en la implementación del RCI durante el año 2024. El informe presentado hoy muestra resultados relevantes para la región de las Américas y Guatemala en particular. Según el cuadro regional comparativo, Guatemala logró mantener o mejorar sus 15 capacidades básicas en 2024 respecto a 2023, lo que evidencia un progreso sostenido. Reconocemos también que las enmiendas al RCI, que entraron en vigor para Guatemala en septiembre de 2025, representan un avance significativo. Estas modificaciones han permitido aclarar ambigüedades detectadas durante su implementación, especialmente en el contexto de la pandemia de COVID-19, y ofrecen una guía más precisa para fortalecer nuestras capacidades nacionales. Sin embargo, uno de los retos más importantes que enfrentamos es el establecimiento de la Autoridad Nacional para el RCI. Este proceso requiere un compromiso político sostenido y la designación de una instancia estatal con suficiente potestad jurídica y política para coordinar la respuesta multisectorial. Guatemala reafirma su compromiso con la implementación efectiva del RCI y con el fortalecimiento de nuestras capacidades para responder de manera oportuna y eficaz a eventos sanitarios de relevancia internacional. Agradecemos profundamente el acompañamiento y apoyo brindado por la OPS y la OMS, que han sido pilares fundamentales en este proceso, y aprovechamos este espacio para solicitar su continua colaboración y asistencia técnica con el fin de consolidar los progresos alcanzados y garantizar el cumplimiento pleno del RCI. Muchas gracias.
Thank you, Guatemala. I now give the floor to Antigua and Barbuda.
President of the Directing Council, Executive Management of PAHO, distinguished delegates, Antigua and Barbuda appreciates the report of the document CD62/INF2, Implementation of the International Health Regulations. The country continues to comply with the completion of the state's parties' self-assessment annual report, where the Ministry of Health leads the multi-sectoral comprehensive examination of the country's core capacity to prevent, detect, assess, respond to, and notify of public health threats of local, regional, or international origin. The annual reporting promotes transparency and mutual accountability among state parties as we remain committed to ensuring public health security. We recognize the deficits highlighted within the document that the Caribbean sub-region recorded average scores below 60% of the 5 capacities, namely chemical events, radiation emergencies, infection prevention and control, legal and normative instruments for implementing the international health regulations financing, acknowledging that these are key capacities that together contribute to the safeguarding of our countries and the health of our people. Antigua and Barbuda anticipates the continued technical cooperation of PAHO and partner agencies who support our progress in bolstering the weaker areas identified in the assessment. The country benefited from preparation for mass gathering events in the face of ongoing public health threats and emergencies, as the movement across countries through the growing cruise industry and easy transition through commercial aviation exists. We continue to build capacity in the area of human resources for health, as it is a strategic priority identified for Antigua and Barbuda within our National Strategic Plan for Health and the Essential Public Health Functions Assessment. We commit to the integration of the One Health approach into the international health regulation implementation, which will enhance detection and response to zoonotic diseases and strengthen collaboration among sectors involved in the regulation of human, animal, and environmental health. Antigua and Barbuda commends PAHO for committing to the daily reporting of events to member states from countries within and outside of the region of the Americas as a measure of strengthening epidemic intelligence. Thank you.
Thank you, Antigua and Barbuda. I now give the floor to the Bahamas.
Thank you, Mr. President. Effective implementation of the international health regulations is more critical than ever. Failure to fully implement the IHR leaves gaps in preparedness, undermining regional health security and the collective capacity to respond to emergencies. The COVID-19 pandemic demonstrated clearly the devastating impact on lives and livelihoods associated with gaps in preparedness and response. The Bahamas commends PAHO's report, noting progress in updated IHR NFP information, 91% connectivity, stronger direct reporting, and expanding surveillance capacity. Yet gaps in event notification and protracted Grade 3 emergency highlight the urgency for faster, coordinated responses. Full SPA participation shows regional commitment, but persistent disparities across sub-regions underscore uneven preparedness and threatens collective resilience. The decline from 77% to 54% of states maintaining or improving capacities, alongside financing for IHR falling to 51%, raises further sustainability concerns. Mr. President, the future effectiveness of IHR hinges on decisive actions to address persistent gaps and ensure full implementation of IHR core capacity. The Bahamas realizes that national-level actions are the foundation of effective IHR implementation, further noting the requirement for international commitments to be translated into national legal frameworks and the need for addressing core capacity gaps, which all essential to transform readiness in sustained, equitable health security. We remain fully committed to strengthening public health systems' resilience through health legislative review and revision while focusing on reducing the core capacity gaps. We thank PAHO for ongoing support. We urge PAHO's ongoing advocacy for sustained political and financial commitment for full national implementation of amended IHR, and request PAHO's ongoing exploration of additional IHR funding sources to reverse declining trend. We further urge scale-up targeted technical support with particular focus on advancing regional and sub-regional initiatives to strengthen weakest core capacities, and we request continued technical support for addressing small island state-specific core capacity gaps, which undermine our collective ability to prevent, detect, and respond to health emergencies. Thank you.
Thank you, Bahamas. I now give the floor to El Salvador.
Thank you, Mr. President. El Salvador reconoce el informe y al mismo tiempo hace constar que por medio de los avances y prioridades en la aplicación del Reglamento Sanitario Internacional, instrumento fundamental para proteger a nuestras poblaciones frente a emergencias de salud pública de importancia internacional, presentaremos los avances que gracias a esta iniciativa se han efectuado. Durante el periodo comprendido entre julio 2024 y julio 2025, la región notificó 94 eventos agudos de salud pública, de los cuales un 62% fue informado directamente por los Centros Nacionales de Enlace. Este dato refleja un progreso significativo en la capacidad de nuestros países para detectar y comunicar oportunamente los riesgos. A ello se suma el fortalecimiento de sistemas de inteligencia epidemiológica y de las redes que se tienen internamente, que procesaron más de 1.600 señales y permitieron verificar alertas tempranas. Además, hemos dado pasos importantes en la actualización de requisitos de vacunación, especialmente contra la fiebre amarilla, en cooperación con la iniciativa Resolve to Save Lives, para institucionalizar la meta 717, que busca mejorar la detección, notificación y respuesta en plazos más cortos y efectivos. Es cierto que aún enfrentamos heterogeneidad en el desarrollo de capacidades básicas y desafíos relacionados con recursos humanos, financiamiento y preparación frente a emergencias químicas y radiológicas. Las metas alcanzadas reflejan que el camino hacia la plena implementación del RSI es firme y que cada reto identificado viene acompañado de acciones concretas para superarlo. En septiembre de 2025 entró en vigor las enmiendas al RSI, un paso histórico que reforzará nuestro marco jurídico y operativo para actuar de manera más rápida y coordinada frente a emergencias sanitarias. El Salvador reitera su compromiso de seguir colaborando estrechamente con los Estados miembros y con la OPS para consolidar un sistema regional de salud más preparado, más interconectado y más resiliente. Es así como proteger la salud de nuestras poblaciones significa también proteger la estabilidad, el desarrollo y el futuro de las personas. Muchas gracias.
Thank you, El Salvador. I now give the floor to Panama.
Gracias, señor presidente. La delegación de Panamá toma nota del documento titulado Aplicación del Reglamento Sanitario Internacional como instrumento clave para la seguridad global. Expresamos nuestro agradecimiento por la presentación del informe y valoramos positivamente el análisis que contiene. Panamá acoge con satisfacción los avances registrados durante el año 2024 en la implementación del Reglamento Sanitario Internacional, especialmente en materia de preparación, notificación y respuesta frente a emergencias de salud pública. Reconocemos que el contexto sanitario internacional sigue siendo complejo y desafiante, lo cual reafirma la importancia de contar con un marco normativo sólido y actualizado. Panamá subraya la necesidad de seguir fortaleciendo las capacidades nacionales y regionales para la implementación efectiva del reglamento, incluso mientras se avanza en los procesos administrativos relacionados con la entrada en vigor de las enmiendas según los procedimientos establecidos. Reiteramos nuestro compromiso con el multilateralismo, la cooperación técnica y el fortalecimiento de los sistemas de salud como pilares fundamentales para una respuesta sanitaria global más resiliente e inclusiva. Muchas gracias.
Thank you. And Panama, I now give the floor to Cuba.
Señor presidente, Cuba, como Estado parte y firmante del Reglamento Sanitario Internacional, continúa su aplicación y evaluación sistemática y toma medidas para enriquecer su implementación y sostenibilidad. Durante el periodo analizado, mantenemos 24 puntos de entrada internacionales, todos cubiertos por personal y con las capacidades básicas necesarias según el RSI 2005. Se mantienen bien establecidas las coordinaciones pertinentes entre los diferentes organismos del Estado para el funcionamiento del RSI y todos los planes de acción que involucran a cada organismo que hacen posible el funcionamiento, sostenibilidad y desarrollo. Contamos además con los protocolos de actuación que enlazan desde las fronteras con los 3 niveles de la salud, hospitales, institutos y la atención primaria de salud, la Red Nacional de Laboratorios de Biología Molecular, el Laboratorio Nacional de Referencia y otras instituciones u organismos del Estado, lo cual ha permitido una preparación y respuesta a eventos de salud pública. El Centro Nacional de Enlace funciona adecuadamente como parte de la Dirección de Vigilancia en Salud del Ministerio de Salud Pública, ampliando progresivamente su trabajo intersectorial y garantizando el envío de la información a la OPS-OMS y respondiendo a las solicitudes de verificación de información según el RSI 2005. No se están aplicando en los puntos de entrada medidas adicionales no contempladas en el RSI, evitando la interferencia a los viajeros y el comercio internacional. Está implementado y funcionando el llenado digital de las declaraciones de salud de los viajeros antes del arribo, desarrollándose aún más el sistema de localización y control de viajeros arribados, lo cual se respalda tecnológicamente en todos los territorios del país. Cuba ha participado de manera activa y constructiva en las negociaciones para adoptar un instrumento jurídico robusto sobre la prevención, respuesta y recuperación ante las pandemias. Este acuerdo, aun con sus importantes limitaciones e insuficiencias, es un positivo e importante paso de avance. El sistema multilateral facilitará una evaluación más rápida de los riesgos y permitirá el acceso más eficaz, previsible y equitativo a productos necesarios para la prevención, preparación y respuesta a las pandemias. Para el fortalecimiento de la preparación nacional ante emergencias, se ha evaluado el estado de las capacidades básicas necesarias que exige el reglamento sanitario a todos los niveles del Sistema Nacional de Salud, los organismos del Estado y puntos de entrada, así como su aplicación, y se han impartido actividades de capacitación y preparación del personal de salud y otras autoridades en los puntos de entrada referente a la continuidad al enfrentamiento a la COVID-19, la viruela símica, la fiebre amarilla y otras arbovirosis en la región de las Américas y el riesgo que implica para el país los eventos de cólera reportados en el Caribe y África. Muchas gracias.
Thank you, Cuba. I now give the floor to Costa Rica.
Muchas gracias, señor presidente. Costa Rica reitera su compromiso con aplicación plena de las enmiendas al Reglamento Sanitario Internacional adoptadas en 2024 y que recién han entrado en vigor. En este marco, señor presidente, Costa Rica ha avanzado en la designación de la Dirección General de Salud como autoridad nacional para el RSI, lo cual representa un paso decisivo hacia una gobernanza más clara, coordinada y alineada con los compromisos internacionales. En este sentido, quisiéramos aprovechar la oportunidad para solicitar a la organización su acostumbrado apoyo, asesoría y acompañamiento. En este proceso de transición hacia la nueva gobernanza del RSI, la OPS es un aliado fundamental. Esperamos contar con su orientación y buenas prácticas para que la Autoridad Nacional del RSI en Costa Rica pueda cumplir con su mandato de forma eficaz y oportuna. Asimismo, reafirmamos nuestro compromiso para continuar trabajando junto con los estados de la región y la organización, promoviendo la solidaridad y la responsabilidad compartida para fortalecer la aplicación del RSI y mejorar la respuesta ante emergencias de salud pública. Muchas gracias, señor presidente.
Thank you, Costa Rica. And now give the floor to Peru.
Gracias, señor presidente. Mi delegación expresa su agradecimiento por el informe que constituye una puesta al día de los progresos en la aplicación del Reglamento Sanitario Internacional en nuestra región, además de los retos que aún atravesamos algunos países en materia de seguridad sanitaria. Los eventos agudos siguen generando muchos desafíos para nuestra región, como el incremento de casos de sarampión en algunos países, de la misma situación que pone en riesgo de reinstauración de la transmisión endémica de esta enfermedad. Con respecto al progreso de las capacidades básicas en estos últimos años, el Gobierno del Perú viene realizando esfuerzos para mejorar sus capacidades de preparación y respuesta. En ese camino ha fortalecido el marco normativo y operativo para ello. Y destacamos la aprobación de la Ley 31.961, que consolida la Rectoría del Ministerio de Salud en Vigilancia en Salud Pública, Inteligencia Epidémica y otorga el rango de ley al Centro Nacional de Enlace del Perú. Perú viene cumpliendo desde el año 2012 con la presentación de sus reportes anuales de autoevaluación, el SPAR, y en el presente año ha iniciado la evaluación externa voluntaria con el apoyo de la cooperación internacional. Hasta la fecha se han desarrollado 5 talleres de autoevaluación con participación de sectores clave como sanidad animal, los ministerios del ambiente, producción, transporte, interior, sector privado, sociedad civil y la academia. Paralelamente, el país viene consolidando la implementación del enfoque de una salud a través de las acciones articuladas con los diferentes sectores que tienen que ver con la salud animal, humana y del ambiente, que incluye el intercambio de información oportuna y la intervención en situaciones de brote. No obstante, reconocemos brechas pendientes, por lo que agradecemos el permanente apoyo de la Organización Panamericana de la Salud para completar la evaluación externa voluntaria y culminar con el Plan Nacional Multisectorial de Seguridad Sanitaria. Señor presidente, el Perú reitera su firme compromiso por concerrar las brechas en las capacidades del Reglamento Sanitario Internacional, ahora enmendado, con el multilateralismo en salud. Confiamos en que con el acompañamiento de la Organización Panamericana de la Salud y la cooperación internacional, logremos consolidar un sistema resiliente y preparado para responder de manera eficaz y oportuna a las amenazas a la salud pública y así proteger a nuestras poblaciones frente a las mismas. Muchas gracias.
Thank you, Peru. Ministers, delegates, we are about to take a lunch break. Before we do so, I'm going to ask the Secretary to give us any announcements.
Yes, Mr. President. I would like to inform the delegates that the briefing session on accelerating disease elimination by reaching populations living in vulnerable conditions, Best Buys for Action, will take place in Room B during the lunch break. A light lunch will be provided for delegates joining the briefing session. We hope to see you there. Thank you, Mr. President.
Thank you. We will now take our lunch break till 2:30. When we resume, we will continue discussion of this agenda item 7.2, and then we will proceed to 7.3 and follow the agenda as indicated. Thank you.
In the Americas, as around the world, cardiovascular diseases are the leading cause of death. But so many of these lives could be saved with better control of hypertension. If we could raise population control from 36 to 50%, we would prevent nearly 440,000 deaths and almost 3 million cardiovascular events. From the global vision of the World Health Organization came hearts. The Pan American Health Organization, with leadership from the Ministries of Health of the region, expanded that vision into Hearts in the Americas, a strategy for quality improvement. Today, 33 countries are committed. More than 9,900 health centers are implementing Hearts, reaching 42 million adults. We are transforming primary health care with the Hearts clinical pathway, promoting team-based care and the use of data for continuous cycles of improvement. In 2025, over 6.3 million adults are receiving treatment, and more than half already have their blood pressure under control. But our story is still being written. Over 200 million adults in the Americas live with hypertension. And our goal is clear, that everyone has access to better care. This is Hearts in the Americas.
Los casos de sífilis están en aumento en América Latina y el Caribe, con un aumento del 30% entre los adultos de 15 a 49 años. Esta enfermedad afecta a personas de todas nuestras comunidades y se propaga rápidamente, pero tenemos el poder de detenerla. La sífilis congénita representa una amenaza seria para los recién nacidos, pero podemos prevenirla. Ahora es el momento de actuar. Las pruebas integradas y el tratamiento oportuno son esenciales para proteger a nuestras comunidades. Para más información, visita pajo.org.
Aging opens up a world of possibility. The possibility of continuing to do what we love and be who we are. But without the right support, aging can also bring limitations. Poor health, vulnerability, loneliness. We believe that a safe, caring, and supportive environment can turn aging into an opportunity to be healthy, to live fully, to embrace change, and keep learning and developing. We believe all people have the right to thrive at any age. Adding dignity to years, well-being to years, life to years. It's a decade of healthy aging in the Americas, adding life to years.
On November 14, 1924, in Havana, Cuba, history was made for public health in the Americas. The Pan American Sanitary Code was signed ad referendum by representatives from 18 nations at the Assembly Hall of the Academy of Medical, Physical, and Natural Sciences, now known as the Carlos J. Finlay Historical Museum of Science. This code, later ratified by all countries in the Americas, defined the duties of the Pan American Sanitary Bureau, today known as the Pan American Health Organization, PAHO. It established clear responsibilities for countries to report disease outbreaks, standardize prevention and control efforts, and gather crucial health data. This collaborative approach, rooted in the values of Pan-Americanism, recognized that health cooperation was essential, not only for the well-being of each country, but for fostering safe international trade across borders. Even today, a century later, the Pan American Sanitary Code remains a guiding force, continuing to shape PAHO's mission to promote the health and well-being of individuals, families, and communities across the Americas. This code stands as one of the most remarkable achievements in health policy, uniting nations under a shared commitment to public health excellence. In 2024, a century after the signing of the code, we honor the legacy of its architects, as PAHO and its member states persist in their efforts to improve the health and well-being of all people in the Americas.
Our success has been through governments and the dedication and commitment of our health workers and our policymakers.
Everywhere where there is a community, you can train people from the community in doing diagnosis and treatment and report to you.
Próprio esforço do grupo, nós temos pessoas aqui dentro da malária que realmente estão dispostas a fazer o trabalho com motivação e carinho. Trabalhar com a própria comunidade foi a chave para chegar onde chegamos.
I would like really to congratulate these health workers in this area because I experienced the challenge they are facing to reach these places. You can't do that if you are not committed.
I think in the foreseeable future, we can envision a malaria-free Amazon.
We can change the life of many people by reaching this elimination goal.
Yo me llamo Daniela Gómez, me dedico a pintar, ilustrar y hacer murales también, pinturas en formatos grandes sobre nuestro entorno, con nuestra cultura. Me gusta mucho pintar.
Está muy bonito y muy alusivo a lo que en estos momentos está pasando con lo de la fiebre amarilla.
Estamos en el municipio de Ataco, un municipio que queda al sur del departamento del Tolima, hace parte del Foco Sur. Es uno de los municipios que tiene un número importante de casos y una letalidad bastante alta, es decir, tenemos 9 muertos como producto de la fiebre amarilla.
Entonces nosotros queremos, mediante el arte, poder llegar a la gente y poder invitarlos a que lo vean como algo amable, que se dejen de lado los mitos de que es algo malo y pues tomen la decisión de vacunarse para salvar las vidas.
Tu salud es tu poder. Claro que sí, porque es lo más indicado. Uno puede tener muchas cosas y puede tener todo, digamos. Pero si no tiene la salud, que es lo primordial, no puede disfrutar, no tiene nada si no tiene salud.
Estamos haciendo este mural como parte de una estrategia para llegar a la comunidad, para sensibilizarlos de la importancia de la vacunación. Queremos que la comunidad entienda que acceder a la vacuna es de manera gratuita, que es solo una dosis para prevenir la enfermedad durante toda la vida y que es el poder que nosotros tenemos como personas, como humanos, para enfrentar este brote de fiebre amarilla en el departamento del Tolima y en todo el país.
Me parece excelente idea para que la gente tome conciencia y se vacune.
Welcome. Let's take a journey to understand how PrEP, or pre-exposure prophylaxis, can protect you from HIV. We'll explore the science behind this powerful prevention tool.
Oral PrEP are pills used to prevent HIV. But how exactly does it work?
Once you take the pill, it dissolves in your stomach and gets absorbed into your bloodstream, where it travels to areas where HIV might enter, like genital and rectal tissues. PrEP is made up of 2 main medications, tenofovir and emtricitabine. HIV typically targets CD4 cells, which are crucial for your immune system. But this is where PrEP steps in.
The medications in PrEP block the virus from replicating in CD4 cells, preventing it from establishing an infection.
By stopping HIV from copying itself inside your CD4 cells, eventually it dies off. This keeps your CD4 cells healthy and strong, effectively preventing HIV from spreading and thus transmission.
PrEP is highly effective when taken as prescribed.
It's a powerful tool that allows you to take control of your sexual health and live without fear. For those who prefer not to take a daily pill, there's an alternative called PrEP on demand or event-based PrEP. This involves taking 2 pills 2 to 24 hours before potential HIV exposure, followed by 1 pill 24 hours after the first dose and another pill 48 hours after the first dose. This method is ideal for people who don't have frequent sex and can't plan ahead. PrEP is recommended for people at higher risk of HIV. Side effects of PrEP are rare and usually mild, like nausea or headaches, and they typically go away after the first few weeks.
The best part, PrEP is over 90% effective at preventing HIV when taken as prescribed.
Talk to your healthcare provider to see if PrEP is right for you.
If using condoms isn't an option, PrEP puts you in control of your sexual health.
For more information, visit paho.org or talk to your healthcare provider today.
Life is better with PrEP.
Eu só ficava com o olho parado olhando para cima. E eu me desesperei, eu achei que ela ia morrer. Ele não respondia, a gente falava, ele não respondia. Usando fralda, né? Tava bem magra.
Tuberculose, criptococose e histoplasmose são as 3 principais infecções oportunistas que mais matam pessoas com AIDS hoje em dia. A diferença dos testes rápidos para os métodos convencionais é que em 30 a 40 minutos nós conseguimos saber qual é a infecção oportunista que está acometendo essa pessoa.
E a gente ter um método diagnóstico rápido para fazer, ter certeza do que a gente está tratando faz muita diferença.
Agora eu já caminho um pouco sozinha, né? Evolucionei.
Aprendendo a caminhar de novo que nem um bebê.
Pra quem tava em cima de uma cama, sem falar, sem se mexer, isso é ótimo, né?
Eu me levantei, caí, tomava banho com a mãe, aqui com cima eu tomava banho sozinho, e agora sim, tudo eu agora.
Nós somos um grupo que se sensibiliza muito com as questões de HIV e AIDS, então eu chego até a me emocionar para falar deles. Mas que de fato é uma equipe que faz muita diferença assim, no trabalho aqui em Porto Alegre e que tem muita vontade de mudar as condições materiais de vida das pessoas.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Pues me manejo mucho en esto internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa, lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud y acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área de telesaúde. Isso aí, para mim, é como fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Antes, planear la adquisición de vacunas, medicamentos y suministros podía tomar a los países horas y múltiples hojas de Excel. Hoy, todo se hace en minutos en un solo portal. Este cambio inició en el 2023 con el lanzamiento del portal de Estados miembros de los fondos rotatorios de la OPS, una plataforma en línea para los países que permite centralizar la información y los procesos de compra del Fondo Rotatorio de Vacunas y el Fondo Estratégico. Cada año, los gerentes de programas nacionales de salud pública que participan en los fondos consolidan las necesidades de medicamentos, vacunas y otros suministros para sus poblaciones y las envían a la OPS, quien realiza una compra conjunta con todas las solicitudes recibidas de la región. En el pasado, los gerentes de programas realizaban estas solicitudes completando hojas de cálculo, pero hoy solo toma unos cuantos clics. Esta plataforma es una ventanilla única que agiliza el trabajo y fortalece la salud pública.
Me parece que es algo muy positivo para nosotros, nos agiliza mucho más. Obviamente estamos viendo que todo se va modernizando y se van generando herramientas digitales. Me parece que está muy bueno.
Tras su lanzamiento, el portal ha incluido mejoras, como un rediseño de su interfaz y 2 nuevos módulos en junio de 2025. Seguimiento a finanzas y compras, con los cuales los usuarios pueden monitorear recursos, línea de crédito y el avance de sus pedidos en tiempo real.
Nos permite dar seguimiento a nuestros pedidos, a nuestros inventarios, a nuestras necesidades, y eso siempre representa una ventaja para el funcionamiento de la cadena de suministros, especialmente para nuestras instituciones que somos prestadores de servicios de salud.
Tras 2 años de su lanzamiento, el portal tiene 800 usuarios activos. Los módulos de finanzas y compras se han consultado más de 1.500 veces y ha permitido la entrega oportuna de los planes de demanda anuales por su facilidad de monitoreo en tiempo real.
I'm happy for the digitalization. This is an easier way of doing it.
Los fondos rotatorios regionales de la OPS continuarán buscando mejorar la experiencia y la transparencia en la información, facilitando así la rendición de cuentas en sus Estados miembros para ofrecer cooperación técnica sólida, demostrando que juntos somos más fuertes.
El cáncer infantil afecta a miles de familias en el mundo cada año, generando angustia y sufrimiento. En la región de las Américas, los gobiernos, la OPS y sus socios se han unido en la iniciativa Cure All para afrontar este desafío y devolver la esperanza.
Desde el año 2019, la Organización Panamericana de la Salud, en colaboración con el St. Jude Children's Research Hospital, trabaja incansablemente para mejorar la detección oportuna del cáncer en niños, niñas y adolescentes. En Latinoamérica y Caribe estamos logrando que más países prioricen el cáncer infantil y lo incluyan en políticas públicas que contemplen actividades para promover el diagnóstico oportuno. En los últimos 5 años, se ha incrementado por lo menos en 3 veces el número de países que cuentan con una guía nacional de detección precoz y sistemas de referencia. Ya estamos viendo los primeros resultados y se está logrando que más niños puedan llegar temprano a su diagnóstico, que más niños puedan tener estadios precoces de enfermedad y que amplíen la posibilidad de curarse.
En el Perú, hemos logrado reducir el 50% del tiempo diagnóstico en un lapso de 5 años. Principalmente desde la Iniciativa Mundial de Cáncer Infantil. El tiempo en el que los profesionales de la salud, médicos y enfermeras, demoraban para hacer el diagnóstico en niños desde la sospecha de cáncer se ha reducido de manera significativa. Actualmente, los niños y adolescentes llegan más rápido a los establecimientos de salud. Este logro es un trabajo conjunto desde el Ministerio de Salud a través de políticas públicas que impulsan la detección temprana de cáncer infantil, asimismo el fortalecimiento de las capacidades de los profesionales de la salud, la sensibilización de la comunidad para poder realizar un diagnóstico oportuno y, por supuesto, la participación de la sociedad civil organizada.
Hemos logrado disminuir en un 50% los casos de estadios avanzados de cáncer en los niños. Esto significa que más familias reciben un diagnóstico temprano y más niños tienen una oportunidad de vida, educando y sensibilizando al personal de salud y a la población.
La Organización Panamericana de la Salud pone a disposición de los países diversos recursos técnicos, como cursos virtuales, talleres y guías interactivas para fortalecer la capacitación de los profesionales de la salud, así como materiales para campañas de comunicación dirigidas a los padres y a la comunidad en general.
A través de Cure All Americas, también se está apoyando a los gobiernos en el monitoreo sostenible y uniforme de sus progresos, así como en la implementación de políticas de salud que fortalecen el acceso al diagnóstico temprano, tratamiento y cobertura financiera. Todo con un objetivo, un diagnóstico temprano que salve vidas y mejore el futuro de nuestras familias y comunidades.
Cada intervención en salud pública, cada acción coordinada y cada esfuerzo compartido son pasos hacia un futuro donde hay más niños que puedan superar el cáncer.
Un diagnóstico temprano salva vidas.
Hola, hoy vamos a conocer el alfabeto de las hepatitis virales. Las hepatitis A, B, C, D y E pueden dañar el hígado y algunas de ellas se transmiten por contacto sexual. Comenzaremos explicando qué es la hepatitis viral. La hepatitis es una enfermedad causada por un virus que provoca la inflamación del hígado y puede producir epidemias, cáncer de hígado y hasta la muerte. Los síntomas de los 5 tipos de hepatitis son similares: fiebres, náuseas, vómitos, dolor abdominal, erupciones en la piel, pérdida de apetito e ictericia, o sea, coloración amarillenta de la piel. A veces, las hepatitis no presentan los síntomas, hasta varios años después de infectarse, pero para ese momento el hígado puede tener daños graves. La hepatitis A puede adquirirse por alimentos o agua contaminada, falta de higiene o por contacto directo con una persona infectada. Los síntomas aparecen de 2 a 3 semanas después de infectarse. Se puede prevenir a través de una vacuna. A diferencia de la hepatitis A, la hepatitis B no se transmite por agua o alimentos contaminados. Se transmite a través de la sangre, por vía sexual o de una madre infectada a su hijo durante el parto. Muy importante, no se transmite por compartir utensilios de cocina, por besarse o estornudar. Los síntomas pueden aparecer de 1 a 2 meses después de la infección. En algunos casos no presenta síntomas, pero si el virus no se trata, puede ocasionar daños graves al hígado e incluso la muerte. La buena noticia es que se puede prevenir con una vacuna. La hepatitis C también puede transmitirse a través de la sangre y jeringas contaminadas, o también por vía sexual. Los síntomas pueden aparecer entre 2 semanas a 2 meses después de haber contraído el virus. Sin embargo, el 80% de los casos son asintomáticos. No hay vacuna para prevenirla. Pero la buena noticia es que existen medicamentos que curan la enfermedad en tan solo 3 meses. La hepatitis D es posible contraerla solo si tienes hepatitis B. También se transmite por vía sexual y a través de sangre contaminada. La vacuna contra la hepatitis B también te protege contra este virus. Y la última es la hepatitis E, pero no por eso es menos importante. Al igual que la hepatitis A, se transmite por agua y alimentos contaminados. Por eso es importante lavar bien las frutas y verduras antes de consumirlas, así como lavarse las manos con jabón después de ir al baño y antes de preparar los alimentos. Los síntomas aparecen entre 2 y 10 semanas después de adquirir el virus. Si piensas que podrías tenerla, visita el servicio de salud más cercano y pide hacerte la prueba. Y si quieres conocer más sobre las hepatitis, infórmate acá.
Dicen que hay lugares donde el camino se acaba, donde la carretera se convierte en mar y el viento en compañía. Pero también dicen que hasta allá llegan los compromisos más importantes, como el proteger la vida, para que nadie quede atrás. A la fecha, Las coberturas vacunales en influenza superan los 6 millones en población objetivo, colaborando esto con la disminución de casos graves y muertes por virus respiratorios. En el marco de la campaña de vacunación e inmunización 2025 del Ministerio de Salud de Chile y la Semana de Vacunación en las Américas, la OPS-OMS Chile, junto a un equipo del Programa Nacional de Inmunizaciones del Ministerio de Salud y autoridades regionales, emprendió una travesía hacia los rincones más australes del continente americano. 3 días, más de 4.500 kilómetros, un viaje impulsado por un propósito claro, una sola misión: llevar vacunas a quienes se encuentran en zonas aisladas o de difícil acceso en el país, llevar vacunas a donde nadie más llega. Desde Santiago a Balmaceda, de Balmaceda a Coyhaique, nuestra primera parada. Allí reconocimos la clave del éxito de la vacunación en esa remota zona. Un equipo de salud altamente comprometido, que camina de la mano de líderes y lideresas comunitarias que convocan a mujeres y hombres, niños y adultos mayores para llegar a todas y todos. Además, cuentan con el apoyo intersectorial de las alcaldías, diferentes estamentos del Estado y la sociedad civil en general. La tradición de proteger a su pueblo a través de la vacunación es parte del ADN de Chile, desde las primeras campañas del siglo XVIII hasta la rápida y eficaz respuesta frente a la COVID-19. Nuestro país ha liderado con ejemplo, dejando una huella imborrable a nivel mundial. De Coyhaique partimos por tierra hasta Puerto Cisnes, y desde allí zarpamos iniciando la travesía que nos llevó al corazón de comunidades apartadas. El equipo bordó ambulanchas, botes adaptados como verdaderas clínicas flotantes, para llegar hasta Puerto Gaviota, una comunidad a la que solo se accede por mar. Ahí, entre rocas, cerros verdes y mar indómito, se vacunó a niños, niñas y adultos mayores. El segundo día el equipo zarpó hacia Isla Gala, rodeados de volcanes y fiordos. Nuevas distancias, nuevos desafíos, mismo objetivo: proteger a la población. Cada dosis aplicada fue un acto de cuidado, una promesa cumplida, una señal de que la salud pública no tiene fronteras. Finalmente el equipo regresó a Coyhaique. Misión cumplida, vocación intacta. La travesía terminó, pero el compromiso sigue. Porque llegar a los rincones más alejados no es solo una meta logística, es una declaración: que nadie quede atrás, que la salud es un derecho y que en Chile se vacuna hasta el fin del mundo. Estamos seguros de que Chile logrará las metas establecidas por el país según las recomendaciones de OPS-OMS.
Amid a challenging security environment, vital work by the Ministry of Public Health and Population is strengthening routine immunization services in Haiti. Supported by PAHO and funded by the Canadian government through the Can Give initiative, these efforts seek to ensure equitable access to life-giving vaccines for vulnerable communities and groups, including girls and pregnant women. Through 3 regional exercises, 105 department-level trainers received important updates on vaccination norms and protocols, including on COVID-19 vaccines, which have been integrated into Haiti's national immunization program. Through cascade training, these regional trainers then shared their knowledge with nearly 400 health providers. In addition, 124 health providers involved in epidemiological surveillance were trained in specific protocols for surveillance of vaccine-preventable diseases. And 221 health facilities benefited from supportive supervision to ensure their compliance with vaccination quality standards. In 2024, more than 421,000 Haitian children received critical vaccinations through catch-up campaigns and routine services. And as Haiti faced recurring cases of deadly diphtheria, PAHO supported the vaccination of more than 340,000 children against the disease.
Oh oui, vaccin li gen an pile importance dans cadre routine et raison c'est parce que gen zone qui vraiment éloigné. Des fois, parents pas de possibilité pour les mener ti moun dans centre là pour les venir faire vaccin. Des fois, négligence parents tout et les nouveaux équipes sur terrain comme ça a vraiment aidé parents yo, aider ti moun yo pour capable joindre vaccin dans localité côté que yo vivent là.
Parler des maladies évitables à la vaccination, nous apprenons et diphtérie. Effectivement, c'est un cas de diphtérie suspect que l'équipe aidée là a fait réponse. Et nous en pleine activité réponse. J'en ai remarqué, nous cherchons rougeole, rubéole, nous cherchons syndrome rubéole congénitale, qui est moins d'un an. Nous cherchons catankou paralysie flasse aiguë. Nous cherchons surtout Kaiti et moun qui gen moins que 15 ans.
El tracoma es una enfermedad infecciosa que afecta principalmente a los párpados, posteriormente a la córnea y puede dejar invalidado a un paciente produciéndole una ceguera permanente e irreversible. Se contagia de forma directa, es decir, de persona a persona.
En especial los niñitos, digamos, se tocan y pueden estar dando la mano a otro niño y así se puede contagiar, ¿no?
Cuando ya tienen triquiasis ya se van sacando las pestañas, sino depilando, le estorba ya.
Esta enfermedad se ve principalmente en zonas con poca o ninguna sistema sanitario.
Donde no haya agua segura.
Con dificultad en sistemas de alcantarillado.
Han levantado ya hace más de un año un tanque, han puesto agua, han hecho pozos, pero el agua no es buena.
Cuando estamos mal de los ojos nos afecta, ¿no?
no solo en Las Flores, ¿no? Sino en distintas comunidades. Hay deficiencia, ¿no? En el tema de lo que es salud y de educación más que todo, ¿no?
Nunca me hablaron del tracoma. No sabía de esta enfermedad.
Nunca había escuchado del tracoma.
Para nosotros es por primera vez que han venido a ver los ojos de nosotros.
Nunca había escuchado esa enfermedad tracoma.
Nunca había escuchado de que se pueda contagiar la enfermedad tracoma así con la mano sucia.
Dentro del registro que nosotros manejamos como Ministerio de Salud, no tenemos incidencia, ¿no? A nivel nacional, ¿no? Sin embargo, tenemos países vecinos en los cuales sí ha sido un problema de salud pública. Es por ello que estamos ejecutando este proyecto, que es una evaluación rápida para tracoma ocular en comunidades vulnerables, ¿no? Una vez termine este proyecto, nosotros vamos a tener la capacidad de poder determinar si tenemos o no y si realmente el tracoma ocular para nosotros es un problema en salud pública.
En esta actividad también hemos diagnosticado otras patologías además del tracoma y bueno, como Ministerio de Salud estamos programando ya actividades también para poder atender estas otras patologías como son las cataratas y terrigio, que son de mayor relevancia en la población adulta o mayor. Estaremos visitando el departamento de Pando, las comunidades indígenas, posteriormente el departamento de La Paz, el norte de La Paz específicamente, porque son las comunidades indígenas que estamos priorizando para poder ampliar la cobertura en la búsqueda de la patología denominada tracoma.
Esta enfermedad puede tratarse con una higiene adecuada. No se trata solamente de venir y curar, se trata de venir y enseñarles cómo cuidarse. Eso es más importante que, te diría, el mismo tratamiento por sí mismo.
Estamos a 15 kilómetros de la cabecera municipal que es San Lucas Tolimán y a 250 kilómetros de la ciudad capital de Guatemala.
Tuvimos una semana de capacitación bastante intensa en la cual nos dieron a conocer sobre tracoma, que era una enfermedad infecciosa prevenible, tratable y que es también una de las causas de ceguera a nivel mundial, que está producida por una bacteria que se llama Chlamydia trachomatis y que normalmente nosotros podemos manejar a nivel domiciliar con tratamiento.
La enfermedad del tracoma, ¿verdad?, que es lo que estamos ahorita manejando, pues se ha dado en diferentes comunidades del país. Entonces lo que se quiere ahorita es verificar la prevalencia que existe esa enfermedad dentro de la comunidad. Entonces la temática es pues realizar visitas domiciliarias, realizar el examen ocular a todas las personas que vivan en la vivienda de 1 año en adelante, ¿verdad?, para detectar en qué tipo de población se está dando la enfermedad.
El cual consiste en una inspección exterior del ojo, ¿verdad? Luego se les solicitará a la persona muy amablemente a que pueda inclinar la cabeza hacia arriba y nosotros poder visualizar el párpado superior, ¿verdad?
Según la OPS, existen unos antecedentes en la cual se ha desarrollado esta enfermedad, por el cual pues estamos realizando estas actividades y es importante verificar en cada una de las casas, ¿verdad? Específicamente en los lugares más postergados, en donde existen pobreza, se podría decir también, como deficiencia de agua o la contaminación de letrina.
Esta jornada es muy importante porque viene a apoyar a las personas. Recordemos de que los puestos de salud quedan en los pueblos y hay personas que por el escaso recurso que tienen pues les es difícil y muchas veces también de repente sienten los síntomas, pero las personas no acuden a los puestos de salud.
Parte de la prevención para esta enfermedad sería el adecuado lavado de manos y cara, específicamente la región de los ojos. Entonces, dentro de los planes que nosotros tenemos es, aparte de realizar la evaluación, darle un buen plan educacional a la familia para que ellos puedan comprender la necesidad de la higiene que deben de tener en el domicilio. Aparte de eso, también tenemos que hay comunidades que tienen dificultades con el agua, y también darles explicación de cómo poder utilizar el agua de mejor manera y que con eso pues puedan mejorar el lavado o la limpieza general.
Conformamos parte del equipo nacional de tracoma conjuntamente con el apoyo de Canadá, Organización Panamericana de la Salud y parte del Ministerio de Salud también. Conjuntamente lo hacemos esto para detectar y eliminar la enfermedad de tracoma.
HEARTS is an initiative of the Pan American Health Organization and the Ministry of Health, which aims to improve heart health and save lives by standardizing hypertension treatment, promoting healthy lifestyles, and strengthening primary health care.
The chronic non-communicable diseases are the leading cause of death in Grenada. Within the top 3, we have the cardiovascular diseases. For these reasons, we welcome the introduction of the HEARTS Initiative.
At the core of the HEARTS Initiative is the HEARTS Protocol, which provides a standardized approach to hypertension management and cardiovascular disease prevention in primary health care. It includes standardized treatment, effective and accessible medications, risk-based care, team-based approaches, healthy lifestyle promotion, and the strengthening of primary healthcare systems.
The integration or initiation of HEARTS has introduced a standardized approach to the way we manage high blood pressure patients.
The HEARTS protocol includes simple, standardized, proven treatments and interventions that can be easily incorporated into primary health care.
As part of the HEARTS program,
We have standardized blood pressure reading, ensuring that all categories of staff know how to check blood pressure. So in case a patient comes to the facility, anyone can assist them in checking their blood pressure.
The HEARTS protocol emphasizes a team-based approach which expands the responsibilities of hypertension management beyond the primary healthcare physicians to include nurses, pharmacists, nutritionists, and other healthcare professionals, so that they too play a significant role in saving lives.
As nurses, we ensure that our patients are compliant, making sure that they monitor their blood pressure as often as possible, take the medication, come to visit the doctor when they are low on the supplies, follow up with the nutritionist as well. And if they have any issues or concern that they are, feel free that they can come in. If they're not feeling well, they could come in at any time and speak to any one of us for advice. And we can do the proper referral if it's hospital or to doctor.
So as nutritionists and dietitians within the healthcare, whether it's primary healthcare or secondary care, we employ what is called medical nutrition therapy. This involves doing a comprehensive assessment. We look at body measurements, we look at the biochemical markers, the labs and so forth. We look at lifestyles, we look at dietary indication, and we also do a full physical exam. Once we're completed, we do a nutrition diagnosis, and then we will recommend and put together a targeted care plan with interventions as to how we can get that person to improve the overall lifestyle. So whether it's becoming more physically active lifestyles, whether it's changing diet, whether it's ensuring that person gets adequate amount of nutrients and filling the gap where there are deficits. We know that if we can correct the diet, also if we can maintain an adequate foundation for health, we know that we can see better outcomes when it comes to heart health.
The HEARTS protocol emphasizes the use of effective, affordable, and widely available medications to improve hypertension management.
The medicines that we'll be using as part of the HEARTS initiative, they're somewhat designed to be less burdensome on the patient because the number of pills that the patients would be required to use to control their conditions are reduced, because now we are making use of combination therapy. So one pill will contain maybe your 2 high blood pressure medication that you're taking at present.
Medication that are available through the HEARTS initiative are heavily subsidized, right? Patients that are less than 60 would pay a small fee. Those who are over 60 and over, it would actually be free as per protocol that already existed.
Following the introduction of the HEARTS initiative, we anticipate better compliance among our patients. We anticipate a reduction in the number of individuals who have uncontrolled high blood pressure. And at the end, we anticipate that in the long run, a reduction in the number of complications and the number of deaths that we are seeing as a result of high blood pressure and cardiovascular disease.
Me siento inmensamente agradecida que este proyecto se haya cumplido, que es un sueño hecho realidad.
Con el trabajo conjunto con el Ministerio de Salud Pública y Protección Social, la Secretaría de Salud del Amazonas, el personal de salud en este hermoso territorio y el apoyo del Gobierno de Canadá, se ha logrado instalar un puesto de vacunación autosustentable en La Chorrera, que nos va a permitir almacenar vacunas y otros elementos, la distribución y hacer que la vacunación sea una realidad permanente en La Chorrera y los territorios, las veredas aledañas.
Uno de los puntos autosostenibles es que tuvo una inversión aproximada de 380 millones de pesos, más o menos $93,000. Estos recursos han permitido la modernización del punto de vacunación de La Chorrera y mejorado la calidad de prestación del servicio de vacunación en esta zona.
Cuando la Organización Mundial de la Salud sueña con la cobertura universal en la salud, es esto: que todas las personas, sin diferencia, sin distinción, puedan tener acceso a tecnologías sanitarias tan eficientes y que han salvado tantas vidas como son las vacunas.
Acá en Chorrera tenemos 22 comunidades.
Nosotros tenemos comunidades que nos podemos demorar hasta 5 horas en llegar. Las temporadas de sequía o las temporadas de invierno nos impactan también negativamente. Cuando esos largos veranos llegan, el río se seca.
La cadena de frío en río.
Que baje la cava a hombro o el termo de vacunas a hombro por en medio de la selva, por trocha.
A las cercanas que están aquí llegamos por tierra, caminando. Y ahora con esto, o sea, me favorece mucho porque pues ya puedo tener a la funcionalidad del congelador eléctrico y el congelador 24 horas.
Decimos que es autosostenible porque tiene 3 principios fundamentales. El primero es que usando energías limpias manejamos energía solar al 100%, ya que en la comunidad no se tiene conectividad eléctrica, sino ciertas horas del día. Tenemos recolección de aguas lluvias y tenemos unos filtros que nos purifican el agua para que el agua en el servicio sea limpia para el proceso de lavado de manos, desinfección y también para la limpieza de los equipos. Y tenemos una antena Starlink que nos va a permitir tener el sistema de información diligenciarlo en tiempo real. Nos va a mejorar esos atrasos que tiene el sistema de información. Nos va a permitir tener el servicio completo, como la norma lo dice, pero también como la comunidad lo necesita.
Y ha sido el conocimiento y mandato de los mayores de que las dos medicinas son muy importantes, la medicina tradicional y también la medicina occidental, desde todo el conocimiento que ellos tienen. Esos dos conocimientos, esas dos medicinas, tienden a cuidar la vida.
Nos permite brindar a la comunidad seguridad y confianza para que puedan volver a acceder al servicio de vacunación.
Creo que sí, se van a acercar más familias, las mamitas van a tener confianza en que sí, ya tenemos un punto apropiado donde ellos pueden llevar a sus bebés a vacunar con toda la confianza del mundo.
Ver este cuarto frío aquí en nuestra comunidad, en plena selva, mejor dicho, es un beneficio para la niñez hasta los adultos mayores. Gracias, muchas gracias, gracias a Dios, gracias a ustedes por este proyecto hecho realidad.
Este proyecto permite facilitar la logística y asegurar que la vacunación, que es un derecho fundamental de la salud, esté permanente para la población de La Chorrera y las veredas aledañas.
I have children at home. I have 4 of them, so that's the 5th one. And it's first time in life I have to come to hospital to get my baby. My name is Sandra Francis and I'm from Yarong Par village, the beginning of Region 9. It's actually like 160 kilometers from here to there. And I find it strange from being far from home. But now I'm comfortable and as you can see, I find it like living with others and finding new friends, you know, and mixing around and we learn from each other in there.
Region 9 is a very vast area. We have 62 facilities. We have 5 sub-districts, and each sub-districts have various other health facilities attached to them. The SIP program, the SIP Plus program, came into existence in Region 9. So we had an online training course, and then we had a face-to-face training where the facilitators from Georgetown came down. The region is doing well in terms of maternal death because we haven't had a maternal death like 3 or 4 years now.
We enter the data into the computer. Whenever we have admissions, we enter them into the computer. When you pull up that mother's information, you will find it there, but in a hard copy, something you might not find the card anymore. It might be put away somewhere else that you can't find it.
I've worked at Georgetown Public Hospital before the system was implemented, so I know how it was to use the paper base. And transitioning to the electronic base, I have to tell you, it has been like such a great thing for us. I actually have a great example of when the system was very helpful to us. So we had a patient come in, she was unconscious, she actually had a seizure, so she was diagnosed with eclampsia. Being able to look at the system, we could tell like what her labs were right away, we could tell what her blood pressure was before, we could get a very clear picture of her trajectory throughout the pregnancy and up to when she was. We were able to tell her gestational age, we were able to know if to give her corticosteroids and how to best deliver her. So in the end, she had a good outcome.
This has been quite a transformation for our department, because prior to SIP, what we would have had is there was tremendous paperwork that had to be done.
When patients comes to admission, we used to have an increased surplus or increased volume of patients waiting for admissions. With the digital way, it's faster because physicians are pretty much aware of how the perinatology system works. So we input the information quicker and you don't have to do multiple copies in order to share to the different wards.
This is a very, very good decision-making tool in terms of maternal health policy and planning at the national and the regional level.
I think in Guyana over the last 4 years, we have made significant progress as it relates to reproductive health. We have PAHO, we have the Canadian government who has helped us. And so because of this assistance, we have accelerated what we've been doing. So I think in terms of sustaining what we've started, with our resources and with some help from our partners, we certainly would be able to sustain these gains.
My delivery date is anytime because I'm 38 weeks. Good. Yes. Yes. So I could feel my baby's really. I will stay. I have names, but I did not choose my baby name as yet. So when the baby born, then I will choose the names for my baby.
Because as a
Check.
Good afternoon, ministers and delegates. We will now resume. I give the floor to Suriname.
Yes, Mr. Chair, thank you. Suriname commends PAHO for its comprehensive review of international health regulations implementation in 2024. We fully recognize maintaining strong IHR core capacities is essential not only to protect our citizens, but also to contribute to regional and global health security. We are grateful for PAHO's continued support in this effort. With PAHO's assistance, Suriname has made progress in engaging multiple sectors to access capacities, identify gaps, and plan for strengthening. We know that only through sustained multi-sectoral collaboration we can effectively prevent, prepare for, and respond to threats that transcend borders. In line with our national priorities, we are strengthening capacities at points of entry and enhancing collaboration with neighboring Amazonian states for the detection and response to zoonotic disease. We welcome the training on ship sanitation certificates, which we are working to replicate in country, and we are pleased to be a member of the Amazon Darien Network for Emerging Zoonosis. We also wish to highlight Suriname's recent milestone. With PAHO's support, we achieved malaria-free status in this year, becoming the first country in the Amazon region to do so. In addition, we secured resources from the Pandemic Fund to strengthen surveillance, laboratories, and human resource capacities. Looking forward, Suriname welcomes PAHO's support in understanding and implementing the amendments to the IHR 2005. We are committed to establishing a national authority to monitor and evaluate implementation, which we expect will improve our SPAR scores. Esteemed President, Suriname reaffirms its strong commitment to the IHR and looks forward to next year's review, where we will present concrete improvements as part of our contribution to protect populations everywhere from cross-border health threats. Thank you.
Thank you, Suriname. I now give the floor to Grenada.
Thank you, Mr. President. Honorable delegates, on behalf of the government of Grenada, I wish to express our sincere appreciation to the Pan American Health Organization for a comprehensive and insightful report on the implementation of the international health regulations for the period 2024-25. This report reflects PAHO's unwavering commitment to strengthen health security across the region. It provides a clear and evidence-based assessment of our collective progress, challenges, and opportunities in building core capacities to detect, assess, report, and respond to public health threats. Mr. President, Grenada welcomes the recognition of the evolving regional context and the tailored support provided to member states. We are particularly proud to note that Grenada maintained or improved scores across all 15 IHR core capacities in 2024, a testament to our dedication to continuous improvement and resilience in public health preparedness. We also acknowledge the successful hosting of the Caribbean sub-regional training on ship sanitation in Grenada earlier this year, which brought together experts and practitioners from across the region. This initiative not only enhanced technical capacity, but also reinforced regional solidarity and collaboration. Despite these gains, we remain acutely aware of the vulnerabilities that persist, particularly in areas such as infection prevention and control, chemical and radiation emergencies, and financing for IHR implementation. These are complex challenges that require sustained investment, innovation, and technical cooperation. In this regard, Mr. President, Grenada respectfully requests PAHO's continued support in strengthening our IHR capacities. We look forward to deepening our collaboration through targeted technical assistance, capacity building initiatives, and the use of tools such as the State Party Self-Assessment Annual Reporting, simulation exercises, and early action reviews. We reaffirm our commitment to the principles and obligations of the IHR and to working closely with PAHO and our fellow member states to ensure that Grenada and the region as a whole is better prepared to prevent, detect, and respond to public health emergencies. Thank you, Mr. President.
Thank you, Grenada, and I'll give the floor to Brazil.
Senhor Presidente, tomamos nota das informações atualizadas e reconhecemos os avanços descritos no documento, em especial os esforços dos Estados-partes na manutenção das capacidades básicas, na notificação de eventos agudos de saúde pública e na articulação com os pontos focais nacionais. Gostaríamos de enfatizar nosso compromisso com o cumprimento do regulamento, tanto em nível técnico quanto político, por meio de uma abordagem multissetorial que acreditamos estar alinhada com os esforços para alcançar a cobertura universal de saúde e fortalecer esse importante marco jurídico. Nesse sentido, o Brasil realizou no ano passado sua primeira avaliação externa voluntária, utilizando a ferramenta de autoavaliação. Agradecemos o apoio da OPAS nesse importante processo de fortalecimento e monitoramento das capacidades essenciais do nosso país. Destacamos, ademais, a relevância do regulamento como pilar jurídico e técnico essencial para a prevenção, preparação e resposta a emergências em saúde pública. As emendas aprovadas pela 77ª Assembleia Mundial da Saúde representam um importante avanço ao introduzirem mecanismos concretos para fortalecer a equidade, o acesso aos produtos relevantes de saúde, a cooperação internacional e a mobilização de financiamento. O Brasil teve participação ativa nas negociações, contribuindo para uma definição mais ampla e inclusiva de produtos de saúde, bem como para o estabelecimento de um mecanismo financeiro de coordenação que apoiará a implementação plena do RSI, sobretudo em países com maiores vulnerabilidades. A internalização das emendas, no entanto, depende da aprovação do Congresso Nacional, processo que está em curso. Essa formalidade não impede o respeito às regras acordadas. Saudamos igualmente a aprovação do Acordo de Pandemias pela 78ª Assembleia Mundial da Saúde. Trata-se de um marco histórico que reforça o compromisso global com a solidariedade, a equidade e a resiliência compartilhada. Ressaltamos que a articulação entre o RSI e o Acordo de Pandemias será fundamental para garantir uma governança integrada, eficiente e inclusiva em futuras emergências sanitárias. Reafirmamos o compromisso do Brasil com a adoção dos devidos procedimentos para a internalização do pacote de emendas ao RSI no ordenamento jurídico do nosso país e colocamos-nos à disposição para elaborar com os demais países da região e com as OPAs ao longo desse processo. Muito obrigada.
Thank you, Brazil. I now give the floor to the Dominican Republic.
Gracias. La República Dominicana reitera su compromiso con la implementación efectiva del Reglamento Sanitario Internacional, reconociendo que la prevención, detección temprana y respuesta oportuna ante emergencias de salud pública son pilares esenciales para proteger la seguridad sanitaria de nuestra población y fortalecer la resiliencia de nuestro sistema de salud. Valoramos la coordinación regional y la cooperación técnica de la OPS, así como los instrumentos de autoevaluación y evaluación externa que nos permiten identificar brechas y fortalecer nuestras capacidades nacionales. Nuestro país ha logrado avances concretos en vigilancia epidemiológica y notificación de eventos de salud pública, aumentando el registro de nuevos eventos del 40% al 83%, lo que refleja nuestro compromiso con la transparencia, la colaboración multilateral y el cumplimiento del Código Sanitario Panamericano. Agradecemos los esfuerzos de la OPS y la OMS para apoyar a los países miembros en la implementación de las capacidades básicas del RCI, incluyendo el reporte a través del instrumento disponible con el cual la República Dominicana ha cumplido oportunamente, siempre reconociendo que los mecanismos nacionales, la soberanía de los estados y la importancia de preservar una gobernanza local sólida y efectiva es esencial. Entre 2023 y 2024, nuestro país avanzó de manera moderada en la implementación de las capacidades básicas del RCI, elevando su puntaje general al 60%. Hemos identificado fortalezas en laboratorio, marco de emergencia sanitaria, comunicación de riesgos y recursos humanos. Sin embargo, persisten desafíos, particularmente en financiamiento sostenido para la vigilancia y respuestas a eventos y en la capacidad operativa de puntos de entrada, para lo cual continuamos requiriendo apoyo de los Estados miembros con capacitaciones para el personal estratégico y operativo. El compromiso de la gestión en ese tema es tal que creamos un viceministerio de gestión de riesgo y salud mental con estructura y presupuesto propio y presencia transversal en todas las áreas y acciones de la gestión. La República Dominicana apoya y reafirma que la plena implementación del RCI debe conjugar la cooperación internacional con el fortalecimiento de las estructuras nacionales y locales, asegurando que cada país refuerce sus capacidades y las integre a la región y al mundo. Solo así podemos avanzar hacia mayor transparencia, resiliencia y preparación integral frente a emergencias de salud pública. Muchas gracias.
Thank you, Brazil. I now give the floor to Paraguay.
Presidente, delegados, Paraguay reconoce la importancia del Reglamento Sanitario Internacional como instrumento esencial para la preparación y respuesta frente a emergencias de salud pública y valora el informe presentado sobre su implementación en la región de las Américas. Desde el 2006, la Dirección General de Vigilancia de la Salud del Ministerio de Salud actúa como un centro nacional de enlace del Reglamento Sanitario Internacional, cumpliendo de manera continua con las funciones mandatadas. Durante el periodo 2024-2025, Paraguay notificó un evento de salud pública de posible importancia internacional y respondió oportunamente a las solicitudes de verificación solicitadas por la OPS, demostrando la solidez de sus capacidades nacionales. Mi país ha fortalecido la vigilancia y los sistemas de alerta temprana mediante la combinación de vigilancia basada en indicadores y en eventos, integrando inteligencia epidemiológica de fuentes abiertas, vigilancia comunitaria y monitoreo de rumores. Se han llevado a cabo ejercicios de simulación, como el realizado en el 2023 en la Triple Frontera, y en el 2025 se inició un examen temprano de acción bajo la meta 7/1/7. En cuanto a capacidades básicas, Paraguay mantuvo o mejoró 13 de las 15 evaluadas en el 2024, con avances significativos en vigilancia, recursos humanos, gestión de urgencias y puntos de entrada. No obstante, persisten desafíos, particularmente en la interoperabilidad de datos y en la comunicación de riesgo a nivel comunitario. En este contexto, Paraguay solicita que la OPS continúe apoyando el fortalecimiento de sistemas de vigilancia en tiempo real, plataformas multisectoriales de intercambio de datos bajo el enfoque de una salud, protocolos estandarizados de respuesta, ejercicios de simulación y capacitación, así como la movilización de recursos adicionales que permitan atender brechas prioritarias en los puntos de entrada fluviales. Paraguay renueva su firme compromiso en colaborar solidariamente con todos los Estados partes y con la OPS, a fin de continuar fortaleciendo la protección de la salud pública en nuestra región. Muchas gracias.
Thank you, Paraguay. I now give the floor to Ecuador.
Gracias, señor presidente. El Ecuador reconoce la relevancia de los hallazgos presentados sobre la notificación de eventos de salud pública en las Américas y reafirma su compromiso con la implementación efectiva de las enmiendas al RSI. Para ello, hemos fortalecido nuestro Centro de Control Nacional de Enlace, optimizando los procesos de notificación y verificación, e incorporado sistemas de alerta temprana más eficaces, capacitación continua del personal y fuentes diversificadas de información para la detección de amenazas emergentes. Este fortalecimiento abarca la vigilancia comunitaria local, la vigilancia epidemiológica en aeropuertos, puertos y pasos fronterizos y la integración de datos no convencionales que permiten una respuesta mucho más rápida y efectiva. Asimismo, se han consolidado mecanismos de coordinación intersectorial en emergencias y protocolos específicos frente a eventos zoonóticos. El país mantiene una alta cobertura de vacunación contra el sarampión, sin casos desde el 2018, gracias a campañas nacionales y al seguimiento, alcanzando en 2023 un 98% de cobertura en niños de 1 a 12 años contra poliomielitis, sarampión y rubiola. Estos esfuerzos le han permitido al Ecuador que conserve su certificación como país libre del sarampión. De igual forma, hemos participado activamente en los mecanismos de cooperación regional, compartiendo información crítica con la OPS y la OMS y países vecinos, reafirmando también nuestro compromiso con la seguridad sanitaria global y la implementación de las enmiendas al RSI. Mirando hacia el futuro, consideramos prioritario fortalecer las capacidades de los laboratorios nacionales, asegurar su equipamiento y certificación y conectarles además con redes regionales para un diagnóstico oportuno. La disponibilidad de pruebas rápidas y confiables es esencial para una respuesta efectiva, así como lo escuchamos ahora en el briefing del mediodía. Reiteramos también la necesidad de garantizar el acceso equitativo a vacunas, medicamentos y tecnologías sanitarias, eliminando todas las barreras económicas y logísticas que actualmente están afectando especialmente a países de renta media como lo es el Ecuador y que limitan la disponibilidad de insumos críticos durante las emergencias. Finalmente, hacemos un llamado a consolidar las capacidades en puntos de entrada internacionales con inversiones sostenidas tanto en infraestructura como personal y con protocolos actualizados. Muchas gracias.
Thank you, Ecuador. Now give the floor to Honduras.
Muchas gracias, señor presidente. Honduras reafirma su compromiso con la plena implementación del Reglamento Sanitario Internacional y reconoce el papel fundamental que este instrumento desempeña en la vigilancia de la salud pública regional y global. El país celebra los avances destacados en el documento, especialmente en el fortalecimiento de las capacidades nacionales, la promoción de mecanismos de autoevaluación y las iniciativas impulsadas por la OPS para fomentar la cooperación técnica, la transparencia y la rendición de cuentas en la región de las Américas. Honduras respalda particularmente las acciones dirigidas a consolidar una comisión intersectorial, modernizar la vigilancia epidemiológica y aplicar herramientas como el SPAR para el monitoreo sistemático del RSI. La experiencia nacional con la evaluación externa voluntaria subraya el valor del acompañamiento técnico y el intercambio de mejores prácticas promovidos por la CESAL, en conjunto con la OPS-OMS, en línea con el principio de solidaridad regional. Cabe señalar que persisten desafíos relacionados con la sostenibilidad financiera, la integración efectiva de sectores claves y la necesidad de actualizar ciertos procedimientos normativos técnicos del RSI al contexto nacional. El país solicita mantener espacios de discusión, intercambio y revisión periódica para lograr una mayor armonización técnica y política entre los Estados miembros, priorizando la flexibilidad en los tiempos de progreso hacia la aplicación del reglamento internacional a una velocidad adaptada a las capacidades del país. Honduras propone fortalecer la cooperación técnica bilateral y multilateral, enfatizando el valor estratégico del recurso humano especializado en la región. Estos equipos, juntos con la colaboración activa de OPS o OMS, son esenciales para alcanzar la resiliencia sanitaria requerida ante riesgos emergentes, garantizando una respuesta coordinada y eficiente en beneficio de la región y de cada Estado miembro, con la mejora de la capacidad de notificación por medio del Centro Nacional de Enlace y el resto de las capacidades de respuestas del RSI. Muchas gracias.
Thank you, Honduras. I now give the floor to Barbados.
Mr. President, the Director of PAHO, distinguished delegates, Barbados has been party to the international health regulations since 2007. With PAHO's valued support, we have made steady progress, though not without challenges, towards full compliance. Barbados' national IHR focal point remains fully engaged. Barbados has maintained open dialogue with PAHO on infectious events in the region and responded to 2 verification requests during the period under review. We especially acknowledge PAHO's support for the twice-weekly surveillance exercise during the ICC T20 Cricket World Cup, which was critical in safeguarding the public health of our region during this major international gathering. In the 2024 self-assessment tool SPAR, Barbados showed continuous increase in its performance, being above regional average in most areas, but gaps remain. Preparedness for chemical and radiation events stand just at about 40%, a challenge shared across much of the Caribbean. And while our National Public Health Laboratory achieved 91% in biosafety and security in 2023, our overall capacity fell to 52% in 2024. This is below the regional and global averages, largely due to the absence of comprehensive national biosafety guidelines. Closing this gap is a matter of priority. Colleagues, Barbados welcomes the amendments to the IHR adopted at the 78th World Health Assembly and which came into force on the 19th September 2025. These changes strengthen our collective capacity for early detection and timely response. We especially commend the new emphasis on solidarity, equity, and ensuring access to essential health products, and creating a coordinating financial mechanism to support countries meeting their obligations. But we must also be candid. The 22 rejections, reservations, and declarations submitted by some member states have real consequences. They risk weakening financing for capacity building, undermining coordinated global responses, and placing disproportionate burdens on small island developing states such as ours. Barbados will continue to monitor these developments closely. Looking ahead, we welcome the new State Parties Committee on IHR Implementation. Its mandate, which is non-adversarial, non-punitive, and assisted, is precisely what we need at this time. Barbados therefore pledges its full support because only through genuine partnership and solidarity we can build the resilient system the world needs and ensure that no country is left behind. Thank you so much.
Thank you, Barbados. I now give the floor to Belize.
Thank you, Chair and distinguished colleagues. Belize welcomes the report on the implementation of the International Health Regulations, IHR 2005, and aligns fully with its call to strengthen core capacities for prevention, detection, and rapid response to public health events. we appreciate PAHO's WHO's continued support and the region's collective progress. Belize has taken concrete steps to translate IHR commitments into action. Our certification as malaria-free in 2023 reflects years of sustained surveillance, cross-border collaboration, and community-based vector control. In 2025, we demonstrated vigilance by rapidly containing measles cases, reinforcing immunization, and preventing further spread. Unfortunately, we are again managing another set of measles cases, but this underscores the critical importance of ongoing surveillance, preparedness, and immunization efforts. Regionally, we support the systematic use of tools that sharpen preparedness and accountability. State parties' annual reporting, simulation exercises, after-action reviews, and the 717 framework to drive timely detection, notification, and response. We also endorse the integration of One Health, given our border dynamics and the interplay of human, animal, and environmental health. Belize continues to submit SPAR, engage in exercises to test readiness, and strengthen cross-border coordination with Guatemala and Mexico. Looking ahead, we respectfully propose 4 priorities. The first, sustained technical cooperation and financing to reinforce national laboratory networks, including genomic sequencing, and to complete our path to NIC designation. Secondly, invest in digital interoperable surveillance and epidemic intelligence that reaches primary care and border communities, aligned with the 717 ethos. Expanded AMR support across the continuum, from labs to IPC and antimicrobial stewardship, so that everyday quality improvements bolster emergency readiness. And the fourth, scale climate health action, climate-informed early warning, resilient facilities, and surge-ready supply chains with special attention to equity for remote and vulnerable populations. Finally, we note that under the IHR, there is a requirement for the establishment of a dedicated IHR office, and not only the designation of a focal point. Belize recognizes that this gap will need to be addressed in the future to fully meet our obligation and enhance coordination. I thank you.
Thank you, Belize. I will now give the floor to a number of non-state actors who have requested to make statements on this agenda item. International Council of Nurses, you have the floor.
Thank you, Mr. President. Good afternoon, distinguished delegates. The International Council of Nurses welcomes the adoption of the amendments to the international health regulations, which align closely with the pandemic agreement and signal a unified global approach to health security. Nurses are the backbone of health systems and are crucial in epidemic and pandemic responses, with skills rooted in evidence-based care. They must be empowered to influence preparedness and response planning as they best understand how to protect both health workers and the public. Governments must appoint and empower chief nursing officers with the authority to shape national preparedness strategies. Furthermore, every committee responsible for pandemic planning, whether it's global, regional, or national, must include nurses, ensuring that planning reflects frontline realities. ICN emphasizes that investment in strengthening the nursing workforce is an essential component of preparedness and response to health emergencies. Financing must go beyond systems and surveillance to reach the workforce directly. Sustainable surge financing should strengthen nursing education, retention, and protection, particularly in low and middle income countries where shortages are most acute. Nurses must have access to ongoing training and capacity building programs that prepare them to respond effectively to current and future epidemics and pandemics. Equally, protecting health professionals from preventable adverse events and emergencies is paramount. Health professionals are among the most vulnerable during crises, facing risks to their safety, security, and well-being. All forms of workplace violence, as outlined in the Health Emergency Preparedness, Response, and Resilience Framework, must be urgently addressed to ensure healthcare workers can deliver safe care. In sum, these amendments represent an important step, but their success depends on whether they empower nurses to lead, invest in their capacity, and protect them as they respond. Pandemic preparedness that excludes nursing leadership is incomplete preparedness. Thank you.
Thank you. I now give the floor to International Federation of Medical Students Associations.
Honorable Chairperson, distinguished delegates, my name is Barbara Bekele Kaidel, and I'm on behalf of the International Federation of Medical Students Association, whom acknowledges the significant progress achieved in the region of the Americas regarding the implementation of the International Health Regulations, IHR 2005, the increase in timely notifications of acute public health events, the strengthening of national focal points, and the introduction of early action reviews, EARs, through the 717 target are positive steps towards enhancing preparedness and response capacities. However, persistent disparities remain across our subregions. Core capacities such as infection prevention and control, financing and policy frameworks remain below the recommended levels in several countries, especially within the Caribbean and Central America. These gaps directly undermine equitable protection from public health emergencies and reflect structural barriers to health equity, sustainability, and resiliency. As FMSA, we reaffirm our commitment to the principles outlined in our policy documents on global health equity, universal health coverage, and pandemic preparedness. We emphasize the central role of youth and civil society in shaping resilient health systems that ensure inclusivity, transparency, and accountability. We call for prioritize equitable financing mechanisms to strengthening IHR core capacities, particularly in vulnerable subregions, implement transparency monitoring mechanisms, such as EARs and voluntary external evaluations, while ensuring data is publicly available. Invest in capacity building at points of entry and community-based surveillance systems, guaranteeing that marginalized populations are not left behind. Ensure meaningful youth engagement in decision-making space for pandemic preparedness and health emergency governance. Health security is a collective responsibility. Strengthening IHR's implementation requires bold political commitment, sustainable investments, and inclusive governance that recognize the right of all community to health without discrimination. Thank you.
Thank you. I now give the floor to the International Pharmaceutical Students Federation.
Honorable Chair, distinguished delegates, the International Pharmaceutical Student Federation, Pan American Regional Office, IPSF PARO represent over 60,000 pharmacy students and recent graduates in 15 countries. Pan American Health Organization 2024 reports highlights our region's heavy reliance on imported pharmaceuticals, a critical vulnerability during health emergencies. Pharmacists witness these gaps daily: inadequate medicine stockpiling, fragmented supply chain, and limited pharmaceutical surveillance that compromise rapid response. IPSF Pan American Regional Office urges Pan American Health Organization and World Health Organization to support academic institutions in integrating pharmaceutical emergency preparedness into pharmacy curricula, establish pharmacy schools networks for emergency medicine stockpile management, and supporting student-led surveillance initiatives for pharmaceutical quality during the emergencies, and also develop protocol for rapid pharmaceutical regulatory approval during health emergencies. We stand ready to strengthen regional health security infrastructure and strongly support Pan American Health Organization's efforts in enhancing IHR core capacity implementations. Thank you.
Thank you. And I'll give the floor to the Public Service International.
Obrigado, senhor presidente. A ISP é uma federação sindical global que representa mais de 30 milhões de trabalhadores e trabalhadoras em todo o mundo, quase 60% do setor saúde. A ISP reconhece os avanços na implementação do RSI, mas expressa sua preocupação com as deficiências que ameaçam a resposta à emergência e a segurança das trabalhadoras e trabalhadores de saúde na região. O relatório revela disparidades nas capacidades básicas. Isso é um reflexo direto do desfinanciamento crônico dos sistemas públicos de saúde e do avanço do setor privado nos sistemas de saúde da nossa região. Não é por acaso que apenas 51% dos estados têm atingido a meta de financiamento. Essa deficiência não é técnica, mas política e reflete décadas de austeridade e privatizações que enfraquecem a capacidade de respostas dos estados da região. Trabalhadoras e trabalhadores de saúde são a primeira linha de defesa contra as emergências sanitárias, mas continuam sem proteção adequada, mal remunerados, com contratos precários e sem formação adequada. A pandemia demonstrou que, sem uma força de trabalho estável, valorizada e qualificada, não há qualquer estrutura de vigilância que se sustente. Além disso, denunciamos a crescente dependência de parcerias com o setor privado para a vigilância sanitária. Essa deve ser uma responsabilidade pública que não pode ser delegada a partes que tenham lucros. Para concluir, senhor presidente, demandamos garantia de financiamento público suficiente para garantir capacidades básicas de preparação e resposta e proteção para as trabalhadoras e trabalhadores de emergência, garantindo trabalho digno, horas de trabalho adequadas, aplicação do princípio da precaução e saúde e segurança no trabalho. Sem trabalhadores protegidos e sistemas públicos sólidos, o RSI continuará sendo uma promessa não cumprida e a região continuará em perigo. Muito obrigado, senhor presidente.
Thank you. I now yield the floor to Dr. Ugarte to respond to the comments.
Thank you, Mr. President. And thank you for all the member states who provided comments, suggestions, and also analysis on the situation. I would like to highlight some of the topics that came along in this process. I will switch to Spanish. Okay. Durante muchos años, 14 años, los países han estado presentando sus reportes anuales, autoevaluación. Hay una distancia entre la autoevaluación de sus capacidades y la capacidad real para enfrentar emergencias. Si nosotros vemos los resultados en grandes emergencias que han pasado después del 2005, encontraremos que muchos países que dicen que tienen altas capacidades no tuvieron realmente la capacidad para enfrentar grandes epidemias. Ante ese contexto, hubo una iniciativa de seguridad global que estableció una posibilidad de hacer evaluaciones externas y se llamó JEE, Joint External Evaluation. Ese instrumento y ese proceso fueron colocados a disposición de nuestros Estados miembros y en reuniones sucesivas, 2015, 2016 y 2017, nuestros Estados miembros dijeron, ya tenemos el instrumento de autoevaluación. No queremos otro instrumento que mida otras cosas más. Entonces, a raíz de esas decisiones de los países, se estableció un mecanismo de evaluación externa voluntaria utilizando el instrumento del SPAR, pero con la metodología de la evaluación externa voluntaria. Es decir, convocando a sectores que normalmente no están en la evaluación, en la autoevaluación de los países. Y entonces ustedes en el documento van a ver las capacidades de cada país. Esto es amplio, esto es transparente. Y ustedes van a ver y ustedes van a notar cuáles son las capacidades, por ejemplo, en laboratorio, en coordinación, en temas químicos, radiológicos, etc. Entonces saludamos a los países que han avanzado en la evaluación externa voluntaria, pero al final lo que se requiere es un plan de acción para mejorar la seguridad, con financiamiento multisectorial. El Reglamento Sanitario Internacional no es propiedad exclusiva de los Ministerios de Salud, sino más bien de todos los sectores. Y es por eso que una de las enmiendas más importantes al Reglamento Sanitario Internacional es la creación de una autoridad nacional del Reglamento Sanitario Internacional que convoque a todos los sectores alrededor de financiamiento para que estas capacidades se mejoren. Hemos visto que estas capacidades en varios países han mejorado. Sin embargo, todavía subsiste la diferencia. Y entonces nos preguntamos, ¿cómo así estamos tan bien si no estamos tan bien? Requerimos entonces avanzar, pero en ese proceso nuestra región de las Américas ha avanzado en la transparencia en ese sentido, porque las últimas evaluaciones son mucho más precisas después de haber enfrentado la COVID-19. De hecho, disminuyeron esas capacidades el siguiente año de la COVID, en todos los países. Claro, y hay otros aspectos que hay que analizar. Y en este año se han mantenido en ese nivel y en promedio. Todavía los promedios esconden grandes diferencias. Pero quisiera reportar avances sustantivos que están vinculados al acuerdo pandémico y en particular con el acceso a patógenos y compartir beneficios. Nuestra región ahora contribuye al 63% de todas las secuencias de los nuevos virus de COVID-19 que se comparten a nivel global. 63% de la región de las Américas. Y eso proviene principalmente de Canadá, de Estados Unidos, pero también de Argentina, de Bahamas, de Barbados, de Bolivia, de Brasil, de Chile, de Colombia, de Costa Rica, de Cuba, República Dominicana, de Ecuador, El Salvador, Guatemala, Haití, Honduras, México, Nicaragua, Panamá, Perú, Paraguay, Surinam, Uruguay y Venezuela. Es decir, estamos aprendiendo a compartir información a tiempo. Aún así, hay un 20% de los eventos que no provienen de los Estados miembros y que se reportan o se capturan a través del sistema que tiene la OPS y el mandato que tiene la OPS de buscar fuentes no oficiales. Y en muchos de esos casos, el pedido para verificación no llega a tiempo. Estamos mucho mejor que otras regiones, pero aún subsisten esos retos. Requerimos ese trabajo conjunto. Estamos de mejor opción, porque si nosotros vemos esas capacidades antes de la pandemia y luego de la pandemia, encontraremos que hay puntos que requieren un financiamiento constante y un acuerdo multilateral. Tenemos fondos disponibles a través de los acuerdos con el Fondo Pandémico que fortalecen esas capacidades, pero también fortalecen capacidades de trabajadores de salud, de vigilancia, de laboratorios. También tenemos acuerdos con Resolve para poder mejorar los sistemas de alerta temprana en el mecanismo de los estándares de 717, con entrenamiento y también con otras agencias de Naciones Unidas para los documentos de sanidad en puertos y aeronaves. Y también seguimos teniendo la cooperación del CDC de Estados Unidos en esa colaboración. Quisiera resaltar lo que comenté al principio, que más del 80% de los eventos que son reportados se controlan muy cerca al foco. Y se hace eso por vuestra participación nacional y el trabajo conjunto con muchos socios, y eso es un avance fundamental. La confianza que existe en nuestra región debemos protegerla y debemos ampliarla. Y ese es un proceso que, bueno, llega al tema de la protección de los trabajadores de salud. El día lunes tuvimos un tributo a los trabajadores de salud, que son realmente aquellos que literalmente, muchos de ellos dieron su vida por la vida de los demás. Y creo que avanzando en ese proceso podemos estar cada vez más cerca a cumplir con el reglamento. El próximo año tendremos el panel, la reunión de alto nivel sobre prevención, preparativos y respuesta a la pandemia. Muchos actores han pedido que logremos algo concreto en esas reuniones, que no sea una declaración política, sino que se traduzca en acuerdos. Y ese es un espacio en que todos los ministerios de salud y nuestros países creo que tendrán una oportunidad de encontrar algo concreto para que el reglamento sanitario internacional se cumpla. Y lo segundo, que aquellos países que cumplen con el reglamento y que reportan eventos no sean castigados por los otros países en cierre de fronteras, corte de comercio, sanciones de algún tipo, sino más bien que tengan un incentivo a poder compartir la información. Y al mismo tiempo, activar los mecanismos que en la región de las Américas los tenemos para responder juntos a esas emergencias. Al mismo tiempo, las negociaciones del acuerdo, del anexo del acuerdo de las pandemias todavía sigue en marcha. Es una negociación difícil. Y si logramos el acuerdo pandémico en la Asamblea Mundial de la Salud de este año, con la condición que se apruebe el anexo, creo que estamos más cerca que lejos. Sin embargo, se requiere un trabajo extraordinario y no solo del sector salud, también de otros sectores dentro del país. Gracias, señor presidente.
Thank you, Dr. Ugarte. Dr. Babu.
Thank you, Mr. President. Muchas gracias por los comentarios de los Estados miembros y de los actores no estatales. Solo voy a complementar con algunos comentarios muy breves, porque yo creo que mucha información que se compartió y los comentarios también de ese lugar son importantes. Primero que, mira, yo creo que la autoevaluación empeoró después de la pandemia. Yo creo que ese es un buen señal. Es señal que ahora somos más realistas en la autoevaluación. Porque incluso la pandemia, que es un evento en el mundo real, nos ha enseñado que algunas capacidades que creíamos que teníamos, no las teníamos. Contestar que tenía capacidade de laboratório antes da pandemia era uma situação. Hoje é outra completamente distinta. Pero mesmo sem a pandemia, se quando temos brote de dengue, se tomam semanas para confirmar caso, porque não fomos capazes de ampliar rapidamente a capacidade de laboratório, não temos a capacidade de laboratório que é necessária. Então, eu creio que agora temos quizás uma base mais realista em la autoevaluação. Pero essa autoevaluação há que se complementar com as avaliações externas. E aí felicito a Honduras e Jamaica, e felicito também a Peru, porque mesmo com a perda do apoio que tínhamos do USAID para a avaliação externa de Peru, o país está comprometido com seus próprios recursos de fazer a avaliação. E los invito todos a atender a avaliação externa voluntária. A avaliação externa voluntária, como dizemos, o país compra um, não recebe dois. Porque, ao mesmo tempo que se faz a avaliação das capacidades, se faz também a avaliação de como se encontra o Programa Nacional de Imunizações, para identificar brechas, para identificar oportunidades de melhora. E segundo, como temos um alinhamento agora de los indicadores de la avaliação externa e de la autoevaluação, a avaliação externa serve também como uma linha de base para que o país pueda monitorear ano após ano o que está passando com suas capacidades. Ou seja, não é mais só um retrato de um momento, pero é uma linha de base que se vai atualizando todos os anos com a autoevaluação e que, sem dúvida, é muito importante. Um tema também importante que esse lugar te subrayou, todavia temos aí 15% de los informes que detectamos por la búsqueda ativa que hace la OPS. 85% já estão com o reporte de los países. Esse é um avanço, porque há par de anos era só 50%. Antes da pandemia era só 50%. Ou seja, eu creio que, como o Ciro subrayou, cresceu a confiança, mas temos que buscar mais mecanismos de que os países que têm transparência de compartilhar recebam também o mesmo apoio para a resposta, para o enfrentamento do problema das emergências de saúde pública. Y tenemos que construir, por los avances que tenemos en la región, Ciro ha mencionado los logros que fue construir una red de vigilancia genómica en la región, lo que posibilita hoy que para sarampión, para oropoche, para zika, para chikungunya, los países están utilizando essa rede, además de Covid-19, de influenza. Ou seja, a capacidade que temos hoje de detectar algum vírus novo, um vírus pandêmico de influenza, um novo coronavírus ou outro vírus que possa ser uma ameaça, é completamente diferente do que tínhamos antes. Pero a rede de vigilância genômica tem que se complementar com as outras dimensões, a integração com os serviços, o treinamento de profissionais de saúde, sistemas de informação, transformação digital das informações, ou seja, com todo o complexo que está involucrado com um sistema de vigilância efetivo. E, por último, o tema de aproveitar bem os projetos que são financiados com o fundo pandêmico, e temos já algumas boas experiências em los países que estão começando a implementação. Quase todos ou todos os projetos estão no marco de uma saúde, ou seja, estão a buscar de maneira integrada fortalecer a vigilância da saúde humana, animal, ambiental, resistência antimicrobiana, compartilhando informações, ou seja, é um momento importante de garantizar uma boa implementação desses projetos. Vamos seguir trabalhando com os países para apresentar novas propostas para as novas rondas do fundo pandêmico e creio que, sem dúvida, é onde podemos ter avanços mais importantes com propostas inovadoras, que possam servir de exemplo para os outros países da região. Assim que, muitas graças por compartilhar com a OPS de manter a alta avaliação da região em nível muito elevado entre todas as regiões, ou seja, compromisso de los países de brindar a informação e, ao mesmo tempo, de mirar essas oportunidades de melhora que temos, incluso para que na discussão do anexo, a região possa ter a mesma participação ativa que teve durante a discussão do acordo da pandemia. Há temas sensíveis, como como fazer de maneira concreta o tema de compartilhar riscos e benefícios, pero creio que os países vão encontrar com diálogo, com negociação, com diplomacia, vão encontrar os melhores caminhos para que se quede efetivamente com os anexos aprovados no próximo ano, se complemente essa ferramenta fundamental para que seja possível ter um acesso equitativo a vacinas, a meios de diagnóstico, a equipos de proteção personal, a medicamentos, ou seja, todas as tecnologias que se necessitam em caso de uma futura pandemia. Thank you, Mr. President.
Thank you, Dr. Barbosa. I would like to inform the Council that the discussions will be noted in the final report. We now move to agenda item 7.3. Monitoring of the resolutions and mandates of the Pan American Health Organization. I'd like to bring document CD 62/INF/3 to the attention of the Council and invite Mr. Nicholas Lagomarsino, Senior Advisor of the Governing Body's Office of the Pan American Sanitary Bureau, to present the item following the report of the representative of the Executive Committee. I yield the floor to the representative of the Executive Committee to report on the item.
Muchas gracias, presidente. Punto 7.3. Seguimiento de las resoluciones y los mandatos de la Organización Panamericana de la Salud. El Comité Ejecutivo acogió con agrado el informe sobre las resoluciones y los mandatos de la OPS y alabó la metodología aplicada para analizar las resoluciones. Las delegaciones reconocieron el valor de este tipo de informes para mejorar la transparencia, la rendición de cuentas y la eficacia institucional y para evitar la adopción de mandatos duplicados o contradictorios. También subrayaron la necesidad de garantizar que todas las resoluciones futuras sean claras en cuanto a sus mandatos, plazos de vigencia y requisitos de presentaciones de informe. Se instó a la oficina a seguir examinando periódicamente las resoluciones y los mandatos de los cuerpos directivos. Gracias, señor presidente. De esta manera concluye mi informe sobre este punto.
Thank you. I now yield the floor to Mr. Lagomasino to present the item.
Gracias, señor presidente. Señor presidente, doctora Siri Thomas, distinguidos delegados y colegas, me complace presentar el punto 7.3, seguimiento de las resoluciones y los mandatos de la Organización Panamericana de la Salud. En este informe, presentado de conformidad con la resolución CD 55R11, se proporciona un análisis actualizado sobre el estado de las resoluciones y los mandatos adoptados por los cuerpos directivos de la OPS al menos cada 3 años. El presente informe se basa en evaluaciones anteriores presentados a los cuerpos directivos de la OPS en 2016, 2019 y 2022 y proporciona información actualizada sobre la situación y la aplicación de las resoluciones de la OPS durante un periodo de 25 años, de 1999 a 2024. Para asegurar la uniformidad en el análisis, se aplicó la misma metodología utilizada en evaluaciones anteriores. Al igual que en informes anteriores, cada resolución se clasificó según criterios establecidos como vigente, condicionalmente vigente o cerrada. En el cuadro 1 del informe se presenta un resumen de estos criterios. En el periodo de 25 años, de 1999 al 2024, 403 resoluciones fueron aprobadas por los cuerpos directivos de la OPS. De este total, 272 han sido consideradas cerradas por los cuerpos directivos y por consiguiente no están incluidas en este reporte, en este informe. Las 131 resoluciones restantes se revisaron, se clasificaron según el área temática correspondiente y se actualizó su estado actual. De acuerdo con la metodología definida, 78 de estas resoluciones se han clasificado como vigentes, 8 como vigentes con condiciones y 45 como cerradas. Encontrarán un resumen detallado de las resoluciones y su estado en el anexo del documento, organizado por las áreas temáticas. Me gustaría reconocer la recomendación formulada por ustedes, por los Estados miembros, durante el Comité Ejecutivo, de visualizar mejor este análisis de los mandatos, incluyendo un enlace en el sitio web de la OPS. Aunque el documento ya está disponible en línea, está publicado, la Secretaría se asegurará de que se añada un enlace directo desde la página web de gobernanza que permita ver un resumen de los mandatos activos. Esto contribuirá a aumentar la visibilidad y facilitará el acceso a la información sobre los mandatos vigentes de la organización. Con esto concluye mi introducción. Estoy a su disposición para responder a cualquier pregunta. Muchas gracias, señor presidente.
Thank you. I now invite the Directing Council to take note of this report and provide any comments it deems pertinent. I now open the floor of the plenary to begin the discussions. I see no requests for the floor. You want to make a... Oh, sorry, Bahamas.
Mr. President, the Bahamas is pleased to participate in this important discussion on Agenda Item 7.3, Monitoring of Resolutions and Mandates. We commend PAHO for its continued commitment to transparency, accountability, and strategic alignment in implementing its mandates. The comprehensive analysis reflects a robust monitoring framework that enhances our collective ability to assess progress, identify gaps, and strengthen regional cooperation. We particularly welcome the classification of resolutions into active, conditional active, and sunset categories, which provides clarity and direction for member states. Mr. President, the review of PAHO's resolutions from 1999 to 2024 reveals a deliberate evolution of priorities, with 78 active resolutions. Of these, nearly 40% underscore sustained commitment to leadership, governance, and enabling functions, which make up the largest thematic category. This reflects PAHO's enduring focus on strengthening institutional frameworks to advance health across the Americas. Yet, the substantial proportion of sunset resolutions, 34.4%, signals both progress and the need for continuous renewal of mandates to remain responsive to emerging challenges. The classification process provides a vital tool for strategic planning, enabling PAHO to focus technical and political efforts where they are most impactful, while also ensuring that governance remains agile, relevant, and aligned with evolving health needs in the region. The number of active resolutions dedicated to determinants of health is encouraging. However, we must continue to prioritize policy actions to address the root cause of disease, disability, and death. The Bahamas is steadfast in advancing health under PAHO's Strategic Plan 2020 to 2025, expanding equitable access, strengthening health systems, and enhancing emergency response. We are advancing in mental health, investing in digital health, and addressing climate change with equity-focused action. Mr. President, while we celebrate these achievements, we acknowledge that persistent challenges, particularly in data systems and reporting capacity. We welcome PAHO's support in strengthening our ability to meet periodic reporting requirements and consolidating efforts across thematic areas. The Bahamas supports the recommendation that future resolutions include clear mandates, specific reporting timelines, and implementation support mechanisms. These elements are essential to ensuring that resolutions translate into tangible health outcomes for our populations. The Bahamas reaffirms its commitment to PAHO's mandates and regional solidarity in health. Thank you.
Thank you, Bahamas. I now give the floor to Brazil.
Obrigada, senhor presidente. O Brasil agradece a apresentação do relatório sobre o segmento das resoluções e mandatos da OPAS e parabeniza a repartição pelo compromisso com a transparência, a governança e a efetividade institucional. Reiteramos nosso apoio à resolução CD 55.R11, que estabelece a importância da análise periódica dos mandatos da organização como instrumento essencial para o monitoramento e a tomada de decisões informadas. Destacamos a relevância do esforço metodológico apresentado com a classificação das resoluções segundo sua vigência e área temática, em consonância com os resultados intermediários do Plano Estratégico 2020-2025. Essa abordagem fortalece a coerência programática e a capacidade de resposta da organização. O Brasil valoriza a continuidade dos mandatos propostos, com destaque para aqueles relacionados à saúde da mulher, à ampliação da cobertura vacinal e ao fortalecimento da imunização como bem público, à prevenção e controle de doenças transmitidas por vetores, bem como à melhoria da qualidade da atenção e à integração dos serviços de saúde, com vistas à ampliação do acesso e da resolutividade. Todos esses temas considerados prioritários para o nosso país. Chamamos atenção ainda para a necessidade de garantir que as futuras resoluções contenham sempre mandatos claros, prazos definidos e requisitos explícitos de apresentação de resultados, o que contribuirá para maior previsibilidade e efetividade na sua implementação. Agradecemos os avanços promovidos pela OPAS no sentido de consolidar relatórios temáticos e otimizar os processos de monitoramento. Nesse sentido, encorajamos a repartição a continuar aprimorando a análise de resoluções vigentes com condições para que não haja lacunas na resposta institucional às necessidades dos Estados-membros. Por fim, o Brasil reitera seu compromisso com o fortalecimento da OPAS como pilar fundamental da saúde pública nas Américas e permanece à disposição para colaborar ativamente na implementação dos mandatos regionais de forma coordenada, solidária e eficaz. Muito obrigada.
Thank you, Brazil. I now yield the floor to Mr. Lagomasino to respond to the comments.
Thank you, Mr. President, and thank you for the interventions of Bahamas and Brazil. In fact, thank you for the positive remarks on this report. It was a request from you, the member states. I assure you we will continue with this regular monitoring. We continue constantly continue monitoring the mandates and produce a report every 3 years. We will continue to do that. It's part of the also enhancing transparency in the organization, and we will continue doing so and revising and updating the information for you. So thank you so much. Thank you, Mr. President.
Thank you, Assistant Director.
Thank you, Mr. President. I want to say good afternoon to all delegates and to thank the Bahamas and Brazil for their comments, and also Mr. Nicholas for his report. Just to say that as the Secretariat, we see these mandates and resolutions as living documents. They actually are packed between member states and the organization, and we at PAHO see our responsibility in making sure they remain alive and they meet the needs of member states in a timely manner. So again, thank you for helping us to help you, and we promise that we will continue to monitor the mandates to make sure they meet the needs of our member states. Thank you.
Thank you, Dr. Seeley Thomas. I would like to inform the Council that the discussions will be noted in the final report. We now go to item 5.2, Financial Report of the Director and Report of the External Auditor for 2024. I would like to bring official document 372 to the attention of the Council and invite Mr. Christos Casabantonio, Director of Financial Resources Management of the Pan American Sanitary Bureau, to come to the head table. I yield the floor to the representative of the Executive Committee to report on the item.
Muchas gracias, presidente. Punto 5.2. Informe financiero del director e informe del auditor externo correspondiente al año 2024. El Comité Ejecutivo debatió el informe financiero del director luego de escuchar las presentaciones de la oficina y el auditor externo, y se informó al comité que el auditor externo había emitido un dictamen sin reservas sobre los estados financieros de la organización, lo que significaba que la auditoría no había revelado errores ni deficiencias que consideraran importantes para la exactitud, integridad o validez de los estados financieros. El Comité Ejecutivo recibió con beneplácito el dictamen de la auditoría. Se consideró que el informe financiero era una herramienta crucial para garantizar la transparencia, la rendición de cuentas y la buena gobernanza. La inclusión de las contribuciones en especie en los estados financieros fue bien recibida como paso hacia una mayor transparencia. Las delegaciones observaron complacidas los esfuerzos para armonizar mejor los controles internos de la OPS con las mejores prácticas internacionales y señalar los riesgos para la organización. Las delegaciones favorablemente las recomendaciones del auditor externo. También se agradecieron los esfuerzos para aumentar la eficacia y la eficiencia, y se elogió a la oficina para el uso de las herramientas tecnológicas y otros medios innovadores con el fin de obtener resultados de salud pública con los recursos existentes y sin comprometer la calidad de su asistencia técnica. Las delegaciones tomaron nota de la disminución de la recaudación de las contribuciones señaladas en el 2024 y del uso del Fondo de Trabajo por parte de la oficina para ejecutar el presupuesto por programa 2024-2025. Se instó a los Estados miembros a que cumplieran con sus compromisos financieros con la organización a fin de garantizar la continuidad de las actividades y los programas esenciales de salud y reducir la dependencia respecto del Fondo de Trabajo. Gracias, señor presidente. De esta manera concluye mi informe.
Thank you. I yield the floor to Mr. Casabantonio to present the item.
Thank you, Mr. President.
Mr. President, Director, Deputy Director, Assistant Director, sorry, distinguished members of the Directing Council, allow me to present the financial report of the Director and the report of the external auditors for the year ended 31st December 2024. The accounts of the Pan American Health Organization were prepared in line with the International Public Sector Accounting Standards as approved by the governing bodies. I'm pleased to report that PAHO received an unmodified opinion. This confirms that the financial statements present a fair view of the PAHO financial situation. The auditors conducted their review in line with the international standards, covering key areas such as budget management, procurement, treasury operations, payroll, IT controls, and visited 2 country offices, Trinidad and Tobago and Honduras, and followed up on previous recommendations. They emphasized that no weaknesses or errors material to the accuracy, completeness, or validity of the financial statements were identified. At the same time, the auditors noted areas for improvement and made recommendations which are included in the report. Management has already developed action plans which are either implemented or underway of implementation. The management actions to address the audit recommendations will be reviewed by the auditors during their upcoming visit to the headquarters from mid-October to mid-November 2025. And now allow me to share some highlights of the financial statements. Here we see the total revenue of PAHO. In 2024, total revenue reached $1.3 billion. This is a 1.7% increase over 2023, and importantly to highlight, above the pre-pandemic levels, which we consider as baseline 2019. The main sources of revenue were 62% of $813.7 million from procurement services of public health supplies, 15% or $199.7 million from voluntary contributions, 8%, $107.1 million from WHO allocations, and another 8%, $104 million from assessed contributions. Finally, $77.4 million was from other sources, mainly investment income and in-kind contributions, partly offset by foreign exchange losses. On this slide, we see the assessed contributions. This part is the collections. In 2024, collections reached $72.4 million, or 69% of the year's assessments. And on the right part, we see the unpaid balances. As at the year-end, unpaid balances stood at $50.6 million, which is $20 million higher than 2023. As was explained yesterday, the balance as of September was $116 million. So it's important that the unpaid balance is paid in order to support the technical cooperation approved here. On this chart, we see the revenue from procurement on behalf of member states. Procurement on behalf of member states reached $813.7 million. This was 9% increase over 2023, though still slightly below 2019. What is important to highlight is that these supplies are procured from member states, and it's not for PAHO itself. The 2024 results saw a return to pre-pandemic levels and reflect the region's strong commitment to immunization and public health programs. On this slide, we see the revenue from voluntary contributions. The non-emergency voluntary contributions was $75 million, down 6% from 2023. The emergency voluntary contributions was $25.7 million, down 58%, a decline which was expected as emergency operations unwinded after the COVID pandemic response. And national voluntary contributions, which are earmarked contributions by member states for their own projects, rose to $99 million, a 9% increase from 2023. Again, Notable is the comparison with the pre-pandemic situation in 2019, that the voluntary contributions overall are much higher. On this slide, we see the total expenses of the organization, which reached $1,227 million US. This is, of course, below the revenue, and the difference is the surplus for the year. Supplies and commodities, of course, is the largest category. And as we said, these are supplies purchased on behalf of member states. In order to get a better view of the expenses, we remove on this slide the supplies in order to see the remaining components. And you see again that there is a decline on the expenses. Contractual services is the biggest component here. The expenses fell by 34.4 million compared to 2023, mainly due to lower cost for meeting facilities, professional services, and technical writing. The staff cost was at 149.2 million, or 12.2% of expenses, a slight decrease from 2023, and travel costs fell sharply, down 27% to 41 million. Just to note here that travel cost does not include only PAHO staff, but also member state participants in meetings and training. Please note that from these 41 million, only 14 million was attributed to PAHO staff, which is 34%, and the percentage along the same lines for the previous year. The remaining was member state participants. On this slide, we see the after-service health insurance. This is the fund which is created in order to cover the health insurance, which is defined benefit obligation of the organization. And it's important to highlight that the defined benefit obligation decreased from 265.3 million in 2023 to 244 million in 2024. And the assets that exist to cover this liability, which is, as you see the trend, the percentage of assets to cover the liability is increasing, which is a positive trend, and it's attributed to the fact that there is effort to lower and manage the cost and increase the revenue, which is from contributions and interest earned from the investments. So, as a summary and key takeaways, PAHO received a clean audit opinion, and the management is working to address the audit recommendations, which are important for the integrity of the financial statements. Revenue exceeded the expenses, 1.3 billion revenue versus 1.2 of expenses. Revenues were above pre-pandemic levels, 2019, showing recovery and towards stabilization. Voluntary contributions remain stable, with national contributions growing. Procurement remains strong, supporting immunization and access to medicines. Expenses were managed efficiently, with reduction and savings in staff costs, travel, and services. And the asset liability decreased, though it remains a long-term obligation, and the assets to cover this liability as a percentage steadily increasing over time. In conclusion, 2024 was a year of recovery and efficiency. Thank you, Mr. President. I remain at your disposal for questions.
Thank you. I now open the floor to the plenary to begin discussions. I see no requests. Do you want to make a comment? Director.
No, thank you. Thank you, Mr. President. I think that this topic is very straightforward, so maybe for this reason, we don't have comments from our member states, but I think that is important to first recognize that it's important for us that we received again a modified audit opinion. We have now, you know, a new, not so new, but a new external audit, that is the Contraloría General de Chile, that performed a thorough evaluation about the financial aspects, administrative aspects of the organization, and released some recommendations that we take always very careful and review carefully each one by one, and design an implementation plan for each one of them. That is important. At the same time, to call the attention that, as clearly was stated during the discussion about the assessed contribution, we have a situation that we need to address, that is the unpaid assessed contribution for the year. On the other hand, it's important to recognize, and again, I want to thank the partners and donors that have partnered with CIPARRO since the pandemic, and some of them after the pandemic. We are still looking for new donors, new partners, because it's important to have them participating in the Americas. Sometimes I always say that we are not competing with other regions in the world. We know that several donors and stakeholders, they still think that only Africa and Southeast Asia, deserves needs to receive support. And we tell them, no, this is not the reality. First, we are the region with probably the biggest disparities in the world. We have the richest country in the world, the United States of America, but we also have a country with a fragile situation like Haiti that is struggling to keep the health services functioning. So we have this disparity not only among the countries, but also within the countries. And we have in several parts of Latin America and the Caribbean, pockets of poverty, extreme poverty, indigenous populations, vulnerable groups that don't have access or don't have the appropriate access to health services. So it's very important to call the attention that we have several countries that really need the support. Second, that we are not competing, because sometimes when we have an initiative that is well implemented in the region, this initiative, and it can be elimination of malaria, it can be elimination of cervical cancer, it can be providing better care for non-communicable diseases, digital transformation. This can serve an example and inspiration for other regions. So I think that is also important, and we have had several productive and constructive conversations with stakeholders that are increasing their support to PARRO, and I, at the same time, want to thank them because they are responsible for several achievements that the countries made in last year, this year. It's very important to keep them participating in this effort to advance the agenda, the public health agenda in the Americas. Thank you, Mr. President.
Thank you, Dr. Barbosa. I would like to inform the Council that the discussions on this agenda item will be reflected in the final report. I believe that we have now come to our coffee break, and we will break for 30 minutes, returning at 4:30. Thank you.
In the Americas, as around the world, cardiovascular diseases are the leading cause of death. But so many of these lives could be saved with better control of hypertension. If we could raise population control from 36 to 50%, we would prevent nearly 440,000 deaths and almost 3 million cardiovascular events. From the global vision of the World Health Organization came hearts. The Pan American Health Organization, with leadership from the Ministries of Health of the region, expanded that vision into Hearts in the Americas, a strategy for quality improvement. Today, 33 countries are committed. More than 9,900 health centers are implementing Hearts, reaching 42 million adults. We are transforming primary health care with the Hearts clinical pathway, promoting team-based care and the use of data for continuous cycles of improvement. In 2025, over 6.3 million adults are receiving treatment, and more than half already have their blood pressure under control. but our story is still being written. Over 200 million adults in the Americas live with hypertension. And our goal is clear, that everyone has access to better care. This is Hearts in the Americas.
Los casos de sífilis están en aumento en América Latina y el Caribe, con un aumento del 30% entre los adultos de 15 a 49 años. Esta enfermedad afecta a personas de todas nuestras comunidades y se propaga rápidamente, pero tenemos el poder de detenerla. La sífilis congénita representa una amenaza seria para los recién nacidos, pero podemos prevenirla. Ahora es el momento de actuar. Las pruebas integradas y el tratamiento oportuno son esenciales para proteger a nuestras comunidades. Para más información, visita pajo.org.
Aging opens up a world of possibility. The possibility of continuing to do what we love and be who we are. But without the right support, aging can also bring limitations. Poor health, vulnerability, loneliness. We believe that a safe, caring, and supportive environment can turn aging into an opportunity to be healthy, to live fully, to embrace change, and keep learning and developing. We believe all people have the right to thrive at any age. Adding dignity to years, well-being to years, life to years. It's the decade of healthy aging in the Americas, adding life to years.
On November 14, 1924, in Havana, Cuba, history was made for public health in the Americas. The Pan American Sanitary Code was signed ad referendum by representatives from 18 nations at the Assembly Hall of the Academy of Medical, Physical, and Natural Sciences, now known as the Carlos J. Finlay Historical Museum of Science. This code, later ratified by all countries in the Americas, defined the duties of the Pan American Sanitary Bureau, today known as the Pan American Health Organization, PAHO. It established clear responsibilities for countries to report disease outbreaks, standardize prevention and control efforts, and gather crucial health data. This collaborative approach, rooted in the values of Pan-Americanism, recognized that health cooperation was essential, not only for the well-being of each country, but for fostering safe international trade across borders. Even today, a century later, the Pan American Sanitary Code remains a guiding force, continuing to shape PAHO's mission to promote the health and well-being of individuals, families, and communities across the Americas. This code stands as one of the most remarkable achievements in health policy, uniting nations under a shared commitment to public health excellence. In 2024, a century after the signing of the code, we honor the legacy of its architects, as PAHO and its member states persist in their efforts to improve the health and well-being of all people in the Americas.
Our success has been through governments and the dedication and commitment of our health workers and our policymakers.
Everywhere where there is a community, you can train people from the community in doing diagnosis and treatment and report to you.
Próprio esforço do grupo, nós temos pessoas aqui dentro da malária que realmente estão dispostas a fazer o trabalho com motivação e carinho. Trabalhar com a própria comunidade foi a chave para chegar onde chegamos.
I would like really to congratulate these health workers in this area because I experienced the challenge they are facing to reach these places. You can't do that if you are not committed.
I think in the foreseeable future, we can envision a malaria-free Amazon.
We can change the life of many people by reaching this elimination goal.
Yo me llamo Daniela Gómez, me dedico a pintar, ilustrar y hacer murales también, pinturas en formatos grandes sobre nuestro entorno, con nuestra cultura. Me gusta mucho pintar.
Está muy bonito y muy alusivo a lo que en estos momentos está pasando con lo de la fiebre amarilla.
Estamos en el municipio de Ataco, un municipio que queda al sur del departamento del Tolima, hace parte del Foco Sur. Es uno de los municipios que tiene un número importante de casos y una letalidad bastante alta, es decir, tenemos 9 muertos como producto de la fiebre amarilla.
Entonces nosotros queremos, mediante el arte, poder llegar a la gente y poder invitarlos a que lo vean como algo amable, que se dejen de lado los mitos de que es algo malo y pues tomen la decisión de vacunarse para salvar las vidas.
Tu salud es tu poder. Claro que sí, porque es lo más indicado. Uno puede tener muchas cosas y puede tener todo, digamos. Pero si no tiene la salud, que es lo primordial, no puede disfrutar, no tiene nada si no tiene salud. Estamos haciendo este mural como parte de una estrategia para llegar a la comunidad, para sensibilizarlos de la importancia de la vacunación. Queremos que la comunidad entienda que acceder a la vacuna es de manera gratuita, que es solo una dosis para prevenir la enfermedad durante toda la vida y que es el poder que nosotros tenemos como personas, como humanos, para enfrentar este brote de fiebre amarilla en el departamento del Tolima y en todo el país.
Me parece excelente idea para que la gente tome conciencia y se vacune.
Welcome. Let's take a journey to understand how PrEP, or pre-exposure prophylaxis, can protect you from HIV. We'll explore the science behind this powerful prevention tool.
Oral PrEP are pills used to prevent HIV. But how exactly does it work?
Once you take the pill, it dissolves in your stomach and gets absorbed into your bloodstream, where it travels to areas where HIV might enter, like genital and rectal tissues. PrEP is made up of two main medications, tenofovir and emtricitabine. HIV typically targets CD4 cells, which are crucial for your immune system. But this is where PrEP steps in.
The medications in PrEP block the virus from replicating in CD4 cells, preventing it from establishing an infection.
By stopping HIV from copying itself inside your CD4 cells, eventually it dies off. This keeps your CD4 cells healthy and strong, effectively preventing HIV from spreading and thus transmission.
PrEP is highly effective when taken as prescribed.
It's a powerful tool that allows you to take control of your sexual health and live without fear. For those who prefer not to take a daily pill, there's an alternative called PrEP on demand or event-based PrEP. This involves taking 2 pills 2 to 24 hours before potential HIV exposure, followed by 1 pill 24 hours after the first dose and another pill 48 hours after the first dose. This method is ideal for people who don't have frequent sex and can't plan ahead. PrEP is recommended for people at higher risk of HIV. Side effects of PrEP are rare and usually mild, like nausea or headaches, and they typically go away after the first few weeks.
The best part, PrEP is over 90% effective at preventing HIV when taken as prescribed.
Talk to your healthcare provider to see if PrEP is right for you.
If using condoms isn't an option, PrEP puts you in control of your sexual health.
For more information, visit paho.org or talk to your healthcare provider today.
Life is better with PrEP.
Eu só ficava com o olho parado olhando para cima. E eu me desesperei, eu achei que ela ia morrer. Ele não respondia, a gente falava, ele não respondia. Usando fralda, né? Estava bem magra.
Tuberculose, criptococose e histoplasmose são as 3 principais infecções oportunistas que mais matam pessoas com AIDS hoje em dia. A diferença dos testes rápidos para os métodos convencionais é que em 30 a 40 minutos nós conseguimos saber qual é a infecção oportunista que está acometendo essa pessoa.
E a gente ter um método diagnóstico rápido para ter certeza do que a gente está tratando faz muita diferença.
Melhorou o padrão ventilatório, também melhorou.
Agora já caminho um pouco sozinha, né? Evolucionei.
Aprendendo a caminhar de novo que nem um bebê.
Pra quem tava em cima de uma cama, sem falar, sem se mexer, isso é ótimo, né?
Eu me levantei, caí, tomava banho com a mãe, aqui com cima eu tomava banho sozinho, e agora sim, tudo eu agora.
Nós somos um grupo que se sensibiliza muito com as questões de HIV e AIDS. E eu chego até a me emocionar para falar deles. Mas que, de fato, é uma equipe que faz muita diferença, assim, no trabalho aqui em Porto Alegre. E que tem muita vontade de mudar as condições materiais de vida das pessoas.
Ministers, delegates, let us resume. Item 5.3, amendments to the staff regulations of the Pan American Sanitary Bureau. I would like to bring document CD 62/12 to the attention of the Council and invite Mr. George Ballestero, Director of the Department of Human Resources Management of the Pan American Sanitary Bureau, to come to the head table. I now yield the floor to the representative of the Executive Committee to report on this item.
Thank you very much, Mr. President. Item 5.3, amendments to the staff regulations of the Pan American Sanitary Bureau. During its session in June, the Executive Committee confirmed several amendments to the staff rules, including amendments related to parental leave and to separation from service. The committee was informed that related amendments to the staff regulations would be needed and that those amendments would be considered by the current Directing Council. The committee adopted Resolution CE 176.R6, conforming the amendments to the staff rules and recommending that the Directing Council approve the amendments to the staff regulations. Thank you, Mr. President. This concludes my report.
Thank you. I now yield the floor to Mr. Jorge Ballestero to present the item.
Muchas gracias, señor presidente. Señora directora adjunta y assistant director, distinguidos delegados, colegas, buenas tardes. Agradezco la oportunidad de presentar el resumen de las enmiendas propuestas al Estatuto del Personal de la Oficina Sanitaria Panamericana. Estas enmiendas reflejan las recomendaciones de la Comisión de Administración Pública Internacional. Su propósito es garantizar la coherencia con las condiciones de empleo en los organismos que integran el sistema de las Naciones Unidas, al tiempo que además nutren de la experiencia organizacional y respaldan la aplicación de prácticas sólidas en la gestión de los recursos humanos. The amendments that we are proposing refer to the increase on accountability and efficiency. Article 9 refers to separation from service. The proposed amendment to Article 9.2 concerns the separation of staff. It clarifies that staff members may be separated if they fail to disclose relevant and critical information during the hiring process, or if the organization offers a reasonable reassignment and the staff members decline. These additions strengthen the accountability by underscoring the obligation to provide complete information, while also improving efficiency by reducing delays in the reassignment process when staff expectations happen to be unreasonable. We also have, Mr. President, editorial amendments. Article 6, regarding Social Security, proposes an amendment to make sure that Staff Regulation 6.2 replaces the reference to maternity leave with parental leave. This exchange ensures consistency with Staff Rule 760, which establishes a unified framework for parental leave, and it also reflects the decision confirmed by the Executive Committee at its 172 session in June of 2023. In conclusion, Mr. President, the approval of these amendments will strengthen accountability, ensure consistency with the United Nations Common System, and modernize our staff regulations in line with established best practices, supporting fairness, transparency, and efficiency in the management of our people. We respectfully submit these amendments for your consideration, and I'm certainly available for any questions you may have.
Thank you. I now invite the Directing Council to review the amendments to the Pan American Sanitary Bureau staff regulations contained in this document and to provide any comments it deems pertinent. The discussions on the proposed resolution presented in Annex B will take place once the rapporteur has read the proposed resolution. I will now open the floor to the plenary for discussions on the document presented. I see no requests for the floor. You want to come? Assistant? Oh, sorry.
I think we need to read the resolution. No, okay, it's okay.
Go ahead.
Thank you, Mr. President, and just to thank Mr. Ballesteros for the report that highlights the amendments to the staff regulations, and to show that we at PAHO believe that know and recognize that our staff are our greatest assets, and we will continue to update and facilitate any changes that are necessary to ensure the safety and security of our staff. Thank you.
Thank you, Assistant Director. And I ask the Rapporteur to present the proposed resolution for consideration of the Directing Council.
Gracias, señor presidente. Proyecto de resolución. Modificaciones del Estatuto del Personal de la Oficina Sanitaria Panamericana. El 62º Consejo Directivo, párrafo preliminar, habiendo considerado las modificaciones del Estatuto del Personal de la Oficina Sanitaria Panamericana, en adelante la oficina, presentadas por el director en el anexo A del documento CD 62/12, resuelve. Párrafo operativo primero. Aprobar las modificaciones del artículo 6.2 del Estatuto del Personal que sustituye la referencia a licencia por maternidad por licencia parental, a fin de mantener la consonancia con el artículo 760 del Reglamento del Personal, que establece la licencia parental unificada y que fue confirmado por el Comité Ejecutivo en su 172ª sesión en junio de 2023. Párrafo operativo segundo. Aprobar las modificaciones del artículo 9.2 del Estatuto del Personal, en que se aclara que el director tiene la autoridad para dar por terminado el nombramiento si, letra A, el miembro del personal no reveló hechos que habrían impedido su nombramiento, o B, el miembro del personal rechaza una reasignación razonable que es en beneficio de la oficina. Anexo. Modificaciones del Estatuto del Personal de la Oficina Sanitaria Panamericana. Las modificaciones que se presentan a continuación se aplicarán a los artículos específicos que se indican en cada caso. Artículo 6, Seguridad Social. 6.2. El director establecerá un sistema de seguridad social para el personal, incluyendo disposiciones para la protección de la salud, para la concesión de licencias por enfermedad y de licencia parental y para el pago de indemnizaciones razonables en los casos de enfermedad, accidente o muerte atribuibles al desempeño de funciones oficiales al servicio de la Oficina Sanitaria Panamericana. Artículo 9, cese en el servicio. 9.2. El director puede dar por terminado el nombramiento de un miembro del personal conforme a las condiciones del nombramiento del miembro del personal si las necesidades del servicio exigen la supresión del puesto o una reducción del personal, si los servicios del miembro del personal no son satisfactorios, si el miembro del personal rechaza una reasignación razonable o no se incorpora al puesto asignado, si, por causas de salud, el miembro del personal se haya incapacitado para el desempeño de su cometido o si el miembro del personal no reveló hechos que habrían impedido su nombramiento. Es todo, señor presidente.
Thank you. I now yield the floor to the plenary to begin discussions on the proposed resolution. I see no objection. I therefore declare the resolution adopted. We now move on to item 7.4, the midterm report on the implementation of the Sustainable Health Agenda for the Americas 2018 to 2030. I would like to bring document CD62/INF/4 to the attention of the Council and invite Mr. Ronnie Mazza, Director of the Department of Planning, Budget and Evaluation, the Pan American Sanitary Bureau, to come to the head table. I now yield the floor to the representative of the Executive Committee to report on the item.
Thank you, Mr. President. Item 7.4, midterm report on the implementation of the Sustainable Health Agenda for the Americas 2018 to 2030. In the Executive Committee's discussion of the midterm report on the Sustainable Health Agenda, delegates reaffirmed their country's commitment to the Sustainable Health Agenda for the Americas, which was seen as a key instrument for promoting health equity and sustainable development in the region. Delegates welcomed the advances made towards the goals and targets of the agenda, but expressed concern about the slow progress in several crucial areas, including non-communicable diseases, communicable diseases, and antimicrobial resistance, and about setbacks in areas such as maternal mortality and immunization. The need to understand the systemic barriers to progress and to take concerted action to overcome them was underscored. It was considered important to incorporate the conclusions of the report in the new PAHO Strategic Plan 2026 to 2031 in order to accelerate progress towards the fulfillment of regional and global commitments. Thank you, Mr. President. This concludes my report on the item.
Thank you. I now yield the floor to Mr. Mazza to present the item.
Mr. President, Assistant Director, Honorable Ministers, distinguished delegates, and colleagues, I am pleased to introduce item 7.4, a midterm report on the implementation of the Sustainable Health Agenda for the Americas 2018 to 2030. We refer it as the SHA 2030. Some of you here in the room may recall, so I see some familiar faces, back in 2016-17 when we developed this agenda, that you asked your Secretariat to help the member states to put together a visionary agenda towards 2030 in aligning the response of the health sector to the SDGs. That agenda was approved in 2017 following an extensive consultative process involving a countries working group comprised of 16 member states. I'm pleased to see some of the faces here, and I'm sure some online are listening. That group was responsible for developing that agenda, and we were pleased to help in that regard. This report is being presented as we reach the midpoint in the implementation of this framework, and it will serve as a resource to reflect on where we stand, but more importantly, on what needs to be done going forward in the 7 years that remain before its conclusion. Let me highlight, as the President of the Executive Committee already summarized some of the challenges, but let me highlight some of the progress documented on the report before you with regards to the goals and the targets. Based on the review that we did, and we conducted this exercise here in the Secretariat with existing information, 35 of the 60 targets that you approved back in 2017 are on track to meet the 2030. Yes, setbacks remain, but it's important to note that despite the challenges and the toll that the pandemic had, 35 of the targets are on track. 15 are at risk, and 8 are showing no progress, and 2 could not be assessed because there's no data at this time. The analysis indicates that there is still quite a bit of work for the region to be in a position to achieve the targets by 2030. And in Figure 2 of the report, you will see the details by the goals and where we are in terms of the indicators and the gaps, and a complete analysis presented there, also on recommendations. Indeed, the newly approved strategic plan of the organization for 2026-2031, the policies and strategies that you are approving in this August body, but also at the national level when you're developing national strategies and plans, are indeed an opportunity to look deep and see where action and focus and bold actions are needed. With regards to how the agenda was used, since the Executive Committee, we undertook a full review to see and ask our member states how the agenda had served to guide health sector planning and programming. We looked, of course, at our regional frameworks, but also at the country level, the national plans and strategies. We conducted a documentation review, and surveys, and several authorities were interviewed, national authorities, and we would like to take this opportunity to thank 20 of the member states who responded to the survey and those who participated in the interviews, giving us very valuable insight and feedback on how you see the implementation of the agenda, but most importantly, what we need to address going forward. The findings show that the agenda has been widely used as a key reference framework for health planning, and that there is broad alignment with its goals from the national level to the sub-regional and regional level. However, respondents also reported gaps in the visibility and use of the agenda, barriers on its implementation, such as limited resources and the need for a stronger intersectoral collaboration, which has also been highlighted in other frameworks in this Directing Council. The report offers a set of conclusions and recommendations for the consideration of member states. Allow me to conclude by saying that this agenda, that from the start has been led and owned by you, our member states, and as your secretariat, we have been honored to support the region in working towards achieving its goals and targets through our technical cooperation, the partnerships, and strengthening those going forward. So going forward, in the final years of this agenda, your secretariat remains, and we would like to reiterate our unwavering commitment to continue implementing the agenda. Kindly ask that you consider this report and provide us any comments that you deem pertinent. And thank you for your attention. I'll be glad to address any questions. Thank you, Mr. President.
Thank you, Mr. Marcer. I now invite the Directing Council to take note of this report and provide any comments it deems pertinent. I open the floor to the plenary to begin discussions. I give the floor to Panama.
Gracias, señor presidente. Valoramos el informe de mitad de periodo sobre la aplicación de la Agenda de Salud Sostenible para las Américas 2018-2030, liderizado por el señor Ronnie Massa, el cual ofrece información actualizada sobre el progreso alcanzado hacia el logro de los 11 objetivos y las 60 metas de la agenda desde su adopción en el 2018 hasta el 2024, seguida de un análisis del resultado de su adopción y aplicación por parte de los Estados miembros y la Oficina Sanitaria Panamericana como marco estratégico para el desarrollo de la salud en la región. También agradecemos las enseñanzas extraídas y áreas en las que resulta necesario aplicar medidas correctivas. Las conclusiones permitieron definir medidas que se adoptaron por medio del Plan Estratégico de la OPS 2026-2031 para acelerar el progreso hacia el logro de los compromisos regionales y mundiales. Deseamos recalcar que los resultados de este informe de mitad de periodo de la agenda serán tomados en cuenta para el proceso de formulación de la Política Nacional de Salud y sus lineamientos estratégicos del país para el periodo 2026-2035. Finalmente, tomamos nota del informe y nos comprometemos a redoblar los esfuerzos para avanzar hacia el cumplimiento de las metas rezagadas, por medio de la operativización de nuestro Plan Nacional de Salud para el próximo decenio, el cual representa una oportunidad histórica para evolucionar de un modelo fragmentado hacia el primer ecosistema integrado de planificación sectorial en Panamá, a través del sistema de monitoreo y evaluación del Plan Nacional de Salud, con 15 años de maduración y cerca de 1.300 usuarios activos, posicionándose como la plataforma tecnológica que puede habilitar esta transformación, requiriendo una estrategia integral que aborde los desafíos de confianza institucional y sostenibilidad financiera. Muchas gracias.
Thank you, Panama. I now give the floor to Jamaica.
Thank you, Mr. President. Mr. President, esteemed delegates, Jamaica wishes to commend PAHO for presenting this very comprehensive midterm report on the Sustainable Health Agenda for the Americas 2018-2030. which provides an update on the progress made towards achieving the goals and targets established since its inception in 2018 through to 2024. The country has taken the initiative to prioritize primary health care and universal health coverage in the Vision 2030 Jamaica National Development Plan, which serves to align national priorities with the SDGs. In addition to the recommendations listed in the report, Jamaica is further urging the Pan American Health Organization to increase its support to member states in strengthening institutional capacity, specifically in the areas rated in the report as being at risk or that have shown no progress. Jamaica, in collaboration with international development partners, has begun to modernize its public health system, with a major investment in the implementation of the electronic health record system and the digitization of the health infrastructure, which will allow for improved access and efficiency. In spite of the advances, member states will continue to experience challenges around issues pertaining to progress on NCDs, mental health conditions, communicable diseases, and maternal and child health. Jamaica therefore emphasizes the need for continued support to member states from PAHO in these areas. And in closing, Mr. President, Jamaica endorses the actions recommended in the midterm report and affirms its commitments to the advancement of the Sustainable Health Agenda for the Americas 2018-2030. Thank you.
Thank you, Jamaica. I now give the floor to Suriname.
The Ministry of Health, Welfare and Labor of Suriname welcomes the midterm report on the Sustainable Health Agenda for the Americas 2018-2030. For our country, the Sustainable Health Agenda for the Americas remains highly relevant. Its 11 goals ranging from equitable access to services and sustainable financing to human resources for health, medicines and technologies, and resilient information system speak directly to our national priorities. The agenda helps us align our policies with regional commitments, strengthen our planning, and ensure that health remains at the center of sustainable development. We particularly value the Sustainable Health Agenda role as a unifying instrument that links our national objectives with the Sustainable Development Goals. It provides us with a platform to address systemic barriers such as health workforce migration, financing gaps, and the digital transformation of health. Importantly, it guides multi-sectoral collaboration and supports evidence-based policymaking critical for a country like Suriname with diverse populations and unique geographic challenges. Moving forward, Suriname stands ready to work with PAHO and member states to accelerate implementation of the Sustainable Health Agenda, ensuring that our health systems are stronger, more resilient, and better equipped to deliver universal health coverage and equity in health. Thank you, Mr. Chair.
Thank you, Suriname. I now give the floor to the Bahamas.
Mr. President, the Bahamas welcomes the midterm report on the Sustainable Health Agenda for the Americas 2018-2030. We commend PAHO and member states for their determination and resilience in advancing the health goals despite unprecedented challenges of the COVID-19 pandemic, civil unrest, and funding uncertainties. In line with Goal 1 on equitable access and Goal 2 on stewardship, the Bahamas has set a health system transformation agenda, completed the assessment of its essential public health functions, passed legislation to reduce NCD risk factors, and has taken steps to enact its mental health legislation to close gaps in prevention and care. According to the report, progress has been strongest in areas such as digital transformation and human resources for health. While all of the HRH-related indicators have been evaluated as on track, many of us, particularly those of us in the Caribbean, are not living this progress within our local health system realities. 12 years into the SHORE agenda, We note with concern that 23 of the 60, or almost 40% of the targets are either at risk or have not progressed. As a whole, the midterm report offers an insightful view into the health of the Americas. 5 years remain until the expiration of both the shores and the SDGs. The Bahamas believes that this is the moment to reorient our efforts towards the public health fundamental of root cause analyses. We therefore call for strengthened technical cooperation to systematically quantify and address health inequities, with particular attention to the Caribbean sub-region, where such quantification is non-existent or limited, and where vulnerabilities are pronounced and progress must be accelerated. Mr. President, the Bahamas notes the report and remains fully committed to the Shore 2030 vision. The Bahamas will continue to align our national health planning with regional and global mandates, ensuring we gain momentum on universal health and shape a resilient, technology-enabled health system, one that safeguards the health of our people today while building capacity to withstand the challenges of tomorrow. Thank you.
Thank you, Bahamas. I now give the floor to Antigua and Barbuda.
Thank you, Mr. President of the Directing Council. Antigua and Barbuda acknowledges the midterm report on the implementation of the Sustainable Health Agenda for the Americas 2018 to 2030. We appreciate the report, which allows us to revisit implementation strategies and augment those that will produce desired outcomes by 2030. On the heels of the approval and rollout of the Sustainable Health Agenda for the Americas, the region experienced the devastating effects of the COVID-19 pandemic, which certainly hampered the efforts to advance its implementation in member states. Antigua and Barbuda highlights item 6 of the document, which states that Goal 3, Human Resources for Health, and Goal 6, Information Systems for Health, have made the most significant advances, and that their targets are on track to be met by 2030. Through collaboration and consultation with PAHO, the country has implemented the use of the DHIS2 in primary healthcare systems, a health information system which includes configurable and custom-built modules for data collection, analysis, and sharing. The country is committed to strengthening epidemiological surveillance systems for the early detection, monitoring, and response to emerging and re-emerging diseases, ensuring timely and evidence-based public health interventions. Antigua and Barbuda has also invested in the digital transformation and modernization of health services through the commissioning of a national digital health information system, commencing with our tertiary healthcare facility and subsequent incorporation into all government-owned healthcare facilities, which is expected to have full implementation within the next 2 years. Currently, the Cervical Cancer Elimination Program stands as the only primary care program where registration and results of cervical cancer screening are captured completely through the digital platform. Goal 10, Communicable Diseases, continues to lag in the progress of target achievement. Environmental policies, such as those that address water quality and climate change, are essential to bridging environmental goals to health outcomes through the reduction of health risks and disease burden of climate change and health emergencies. Our region is prone to the dire consequences of tropical cyclones, excessive rainfall, and inundations, which threaten water and sanitation infrastructure and continue the propagation of communicable waterborne diseases. Antigua and Barbuda's National Adaptation Plan 2024 encompasses national commitments that are aligned with the implementation of the agenda. Antigua and Barbuda continues to rely on the technical cooperation of PAHO to fulfill the country's obligation to our people and to our region. Thank you.
Thank you, Antigua and Barbuda. I now give the floor to Trinidad and Tobago.
President, distinguished delegates, Trinidad and Tobago welcomes the midterm report on the Sustainable Health Agenda for the Americas and supports its linkage with the proposed Strategic Plan 2026 to 2031. We recognize the importance of accelerating collective efforts in order to achieve the health targets agreed for our region. At the national level, with the support from the PAHO Country Office, Trinidad and Tobago finalized its country cooperation strategy earlier this year. This strategy closely aligns with the SHA 2030 and sets out our strategic priorities. These are strengthening resilient health systems, tackling non-communicable diseases and mental health, sustaining progress on communicable disease control, building client-resilient health services, and advancing digital health and the adoption of emerging technologies. In line with our government's healthcare reform agenda for 2025 to 2030, we are focused on strengthening community-based NCD services, maternal health and child health, communicable disease preparedness and mental health support, enhancing hospital infrastructure and new cardiac facilities, expanding oral health services, and reducing waiting times for diagnostics and surgery through the use of digital solutions. Mr. President, Trinidad and Tobago reaffirms its commitment to the SHA 2030, as well as the Strategic Plan 2026 to 2031 and our own national health reforms. We will continue to work actively with PAHO to implement, monitor, and evaluate these priorities to improve health outcomes for our people. Thank you.
Thank you, Trinidad and Tobago. I now give the floor to Uruguay.
Muchas gracias, señor presidente. Uruguay agradece la presentación del informe de mitad de periodo sobre la aplicación de la Agenda de Salud Sostenible para las Américas 2018-2030 y destaca su importancia como marco para orientar las políticas sanitarias de la región y alinear las políticas nacionales a los compromisos regionales y globales. Consideramos que su enfoque multisectorial es esencial para abordar las desigualdades que aún persisten en nuestras sociedades. Señor presidente, nos complace notar el progreso alcanzado en algunas de las metas trazadas y destacar la relevancia de que se hayan consolidado progresos en áreas fundamentales como el fortalecimiento de los recursos humanos en salud y el desarrollo de sistemas de información interoperables. No obstante, también destacamos que aún persisten desafíos en áreas críticas que requieren atención urgente. La pandemia del COVID-19 puso en relieve nuestras vulnerabilidades estructurales e impuso desafíos adicionales para varias metas, entre ellas la respuesta a las enfermedades no transmisibles. Ello nos recuerda que la salud debe ser considerada no solo como un derecho humano fundamental, sino también como un pilar del desarrollo sostenible. Uruguay ha trabajado intensamente para mejorar el acceso a la salud para todos y todas a través de la creación del Sistema Nacional Integrado de Salud, creado en el año 2008, el cual ha impactado en mejorar la cobertura sanitaria con pasos sustantivos en el efectivo ejercicio de los derechos en salud. De igual forma, se han adoptado objetivos sanitarios nacionales, los cuales se han ajustado a las metas globales del 2030. Igualmente, ha aprobado, entre otras medidas, una serie de leyes y normativa para el abordaje de algunos de los principales factores de riesgo de enfermedades no transmisibles, incluyendo la política integral para el control de tabaco, que fue impulsada como una política de Estado con un amplio consenso político, y más recientemente con la promoción de la alimentación saludable y la prevención del consumo problemático de alcohol. Asimismo, en el año 2017 se aprobó la Ley de Salud Mental, que tiene por objeto garantizar el derecho a la protección de la salud mental de los habitantes residentes en el país, con una perspectiva de respeto a los derechos humanos de todas las personas. Por otra parte, en diciembre de 2019, el Parlamento aprobó una ley que crea un marco regulatorio para el consumo problemático de bebidas alcohólicas. Lo expuesto demuestra el compromiso de nuestro país para alcanzar las metas acordadas internacionalmente. Finalmente, quisiéramos subrayar que consideramos clave para la segunda etapa de la implementación de la Agenda de Salud Sostenible de las Américas continuar reforzando la resiliencia de los sistemas de salud, el acceso a medicamentos y a los procedimientos de diagnóstico y terapéuticos, los esfuerzos para obtener avances en la prevención y control de las enfermedades no transmisibles, la salud de la primera infancia, infancia y adolescencia, así como la salud mental y la cooperación regional. Uruguay reitera su compromiso de seguir trabajando junto a todos los Estados miembros y con el apoyo de la OPS para que la salud sostenible sea una realidad en las Américas. Muchas gracias.
Thank you, Uruguay. And I'll give the floor to Brazil.
Obrigada, senhor presidente. O Brasil agradece à OPAS pela apresentação do relatório intermediário sobre a Agenda de Saúde Sustentável para as Américas 2018 a 2030. Reconhecemos a importância estratégica da agenda como eixo fundamental para a promoção da saúde, equidade e desenvolvimento sustentável. O documento destaca avanços importantes, especialmente em áreas como recursos humanos em saúde e sistemas de informação. E também faz alertas pertinentes sobre os desafios persistentes, notadamente o retrocesso em indicadores como mortalidade materna e cobertura vacinal. Apesar das dificuldades impostas pela pandemia de Covid-19, o governo do presidente Lula retomou o seu compromisso com a implementação da agenda. Fez esforços para fortalecer a atenção primária por meio de diversas iniciativas, como a expansão da Estratégia Saúde da Família, do Movimento Nacional pela Vacinação e do Programa Saúde Consciência, que visa combater a desinformação e ampliar o acesso à informação científica em saúde. Essas iniciativas contribuíram para melhorias em metas como a ampliação da cobertura em saúde, o fortalecimento da atenção primária e a promoção da saúde mental. Nesse contexto, o Brasil reafirma seu compromisso com a plena implementação da Agenda 2030. Desde 2023, o Brasil retomou com vigor a governança dos Objetivos de Desenvolvimento Sustentável, reativando a Comissão Nacional para os ODS e criando, no Ministério da Saúde, o Grupo de Trabalho Intersetorial para a Implementação e Monitoramento das Metas de Saúde. Senhor Presidente, como oportunamente ressaltado, queremos registrar nosso reconhecimento público à contribuição da diretora emérita da OPAS, a saudosa doutora Carissa Etienne, cuja visão e liderança foram determinantes para a construção da Agenda Sustentável de Saúde para as Américas 2018-2030, entre os muitos legados que deixou para a região. Muito obrigada.
Thank you, Brazil. I now give the floor to Cuba.
Señor presidente, para dar respuesta a los compromisos de la región y en el contexto de la salud pública cubana, el concepto de salud se entiende como un derecho humano fundamental que se garantiza a través de un acceso equitativo a servicios de salud de calidad para toda la población. El Sistema Nacional de Salud ha mantenido un desarrollo continuo y sostenible que ha transitado desde la implantación de un modelo de atención orientado a la cura de las enfermedades hasta el programa del médico y la enfermera de la familia, el desarrollo del capital humano y científico-tecnológico, la colaboración médica internacional, el uso intensivo de la ciencia y el aporte económico de la salud pública. El modelo sanitario cubano pone en primer plano el desarrollo de la atención primaria de salud con énfasis en las acciones de prevención de enfermedades y promoción de estilos de vida saludables sobre la base de la voluntad política del Estado y el Gobierno. Cuba construyó un modelo único de salud cuyos pilares se sustentan, entre otros, en su capital humano y en el desarrollo de una plataforma sanitaria que garantiza accesibilidad, equidad y sostenibilidad al sistema sanitario cubano, el programa del médico y la enfermera de la familia, atención primaria de salud sui generis por su concepción y alcance. La salud pública cubana funciona mediante programas sanitarios según niveles y se articula mediante una red de redes que abarca instituciones, programas, especialidades y otros. El sistema tiene como base conceptual la prevención y control de los factores de riesgo, las condiciones sociodemográficas y económicas y otras que pueden afectar la salud de la población cubana. Una de las particularidades de Cuba es la integración docente asistencial investigativa. Esto ha hecho posible una articulación entre la educación médica, la práctica médica y la organización de los servicios de salud que posibilita la información, la formación integral de los profesionales de la salud y contar en un mismo espacio con las actividades de servicio y desarrollo que responden a las necesidades de salud de la población cubana. El Ministerio de Salud Pública cuenta con un marco regulatorio y legal basado en la Constitución de la República y como referentes los lineamientos de la política económica y social del partido y la revolución. El organismo desarrolla 4 proyectos asociados a 2 macroprogramas contenidos en el Plan Nacional de Desarrollo Económico y Social hasta el 2030. Cuenta con un mecanismo de trabajo para responder a las metas e indicadores de los Objetivos de Desarrollo Sostenible y un sistema de trabajo que le da salida a los objetivos y prioridades sectoriales. Para conducir la gestión sanitaria cubana se aprobaron 3 propósitos generales: mejorar el estado de salud de la población cubana, incrementar la calidad y la satisfacción del pueblo con los servicios que se prestan y hacer eficiente y sostenible el sistema, garantizando su desarrollo. Muchas gracias.
Thank you, Cuba. I now give the floor to Chile.
Gracias, señor presidente. Agradecemos la presentación del informe
y destacamos su relevancia en el contexto actual. Miramos con preocupación los resultados preliminares. Si bien conocemos las causas que pudieron atentar contra el avance de las acciones planteadas, el que haya 23 de 60 metas que se encuentran en riesgo o sin avance nos interpela a redoblar los esfuerzos. Asimismo, la falta de datos sobre indicadores indirectos en 2 metas es una situación que debe ser abordada en el periodo restante. Agradecemos la información de sus causas y la propuesta de abordaje del problema. Más allá del daño provocado por la pandemia de COVID-19, debemos atender a los mencionados obstáculos sistémicos de larga data. Agradecemos a la Secretaría la ampliación de la información de este punto, así como la propuesta de solución de aquellos. Concordamos con necesidad de intervenciones de salud pública sostenidas, estratégicas y eficaces. Sin embargo, no se puede lograr si no conocemos sus amenazas y planteamos soluciones. Reconocemos, por cierto, los avances de la región en el periodo contemplado y celebramos que 35 de las 60 metas establecidas están en condiciones de ser alcanzadas y felicitamos el trabajo de la Organización Panamericana de la Salud y los Estados miembros en ese sentido. Agradecemos también los avances en la adopción y aplicación de la Agenda de Salud Sostenible para las Américas como un instrumento para la planificación del sector de la salud y su necesaria concordancia con los planes estratégicos de OPS, lo cual permite ser coherentes en el trabajo conjunto y evitar la duplicación de indicadores y acciones. Tomamos nota del informe y esperamos el detalle de la aplicación de la agenda y en especial sus conclusiones, enseñanzas y recomendaciones para el segundo término. Muchas gracias.
Thank you, Chile. I now give the floor to Honduras.
Muchas gracias, señor presidente. Honduras está de acuerdo con el informe de mitad de periodo sobre la aplicación de la Agenda de Salud Sostenible para las Américas 2018-2030, porque coincidimos en la importancia de evaluar el progreso de los 11 objetivos y metas de dicha agenda y valorar las brechas, desafíos, lecciones aprendidas que emanan de este informe para abordarlas. Reconocemos el papel central de la OPS que ha desarrollado en la aplicación de la ASA 2030 para lograr la armonización de los objetivos de la agenda con las prioridades de salud pública en el país, a través del plan estratégico de la OPS, con los instrumentos de política, planificación estratégica y estrategias en materia de salud con un enfoque integral basado además en la atención primaria en salud para hacer frente a los principales desafíos en materia de salud pública. Consideramos importante el énfasis en fortalecer las estructuras de gobernanza, asegurar el compromiso político sostenido y promover una mejor colaboración intersectorial a nivel subnacional y nacional, para avanzar en la transformación a un sistema de salud resiliente, sostenible, equitativo, con enfoque en derechos humanos. Asimismo, en colaboración con la OPS, se han integrado en los actuales instrumentos de planificación en salud algunos desafíos emergentes y persistentes sobre la transformación digital en salud y sistemas integrados de información en salud, fortalecimiento de la vigilancia en salud pública, el enfoque de las determinantes sociales, promoción en salud, equidad, participación social y el desarrollo y fortalecimiento de mecanismos de trabajo intersectorial, así como el desafío de establecer mecanismos de protección financiera para la eliminación del gasto de bolsillo en salud de la población, que también se identifican en este informe. En este marco, se espera seguir contando con la cooperación técnica de la OPS. Solicitamos tomar nota del presente informe. Muchas gracias.
Thank you, Honduras. I now give the floor to Paraguay.
Muchas gracias, señor presidente. Paraguay reconoce la importancia de este informe, que constituye una guía para seguir avanzando hacia sistemas de salud más equitativos, resilientes y centrados en las personas. En el ámbito de la transformación digital, el Ministerio de Salud avanzó con la implementación del Sistema de Información en Salud GIS, actualmente en funcionamiento en el 72% de los establecimientos sanitarios, lo que constituye a mejorar la calidad de la atención, optimizar la gestión de datos y facilitar la toma de decisiones basadas en evidencia. Asimismo, desarrolló el registro digital de vacunación accesible en tiempo real para la ciudadanía. En salud materna y neonatal, mi país participa activamente en la campaña regional Cero Muertes Maternas, Evitar lo Evitable, e impulsa el modelo de maternidad segura y centrada en la familia. Además, ha fortalecido la vigilancia epidemiológica mediante talleres en todo el territorio nacional y ejecuta proyectos específicos en comunidades rurales e indígenas del Chaco, con el objetivo de ampliar la cobertura prenatal y reducir las desigualdades persistentes. En promoción de la salud, el país implementa la Política Nacional 2021-2030, que impulsa iniciativas como la estrategia de escuelas saludables, municipios saludables y centros saludables que fomentan entornos seguros para los trabajadores. Además, el Gobierno de Paraguay lleva adelante una política de hambre cero en las escuelas, lo cual representa una oportunidad para promover una vida saludable. En relación con las enfermedades transmisibles, Paraguay ha logrado eliminar la transmisión local de malaria, mantiene activa la vigilancia entomológica del dengue y se encuentra en proceso de introducir la vacuna contra esta enfermedad. Por otra parte, el país cuenta con el Plan Nacional de Enfermedades No Transmisibles, que incluye guías clínicas específicas para obesidad, diabetes, enfermedad renal crónica y EPOC. Se destaca igualmente las acciones en salud mental con la habilitación de una línea telefónica para la prevención del suicidio. En emergencias se han fortalecido planes locales, realizando simulacros y mejorando la resiliencia de la infraestructura hospitalaria. Paraguay reafirma su compromiso con la cooperación regional e insta a la OPS a seguir apoyando las acciones para alcanzar los objetivos comunes de salud en las Américas. Muchas gracias.
Thank you, Paraguay, and I'll give the floor to Barbados.
Mr. President, Director of PAHO, distinguished delegates, Barbados commends PAHO for preparing the midterm report on the implementation of the Sustainable Health Agenda for the Americas 2018 to 2030, which provides a clear, candid, and insightful assessment of our collective journey on the SHA 2030. As we now reach the midpoint of this agenda, the report highlights not only the areas where we have made significant progress, but also those that require urgent action. Despite unprecedented challenges, our region has shown remarkable resilience. Significant public health gains and transformative actions across member states are evident. Goal 3 on human resources for health and Goal 6 on information systems for health remain largely on track, reflecting our shared commitment to strengthen the foundational pillars of our healthcare system. Yet the pandemic has also exposed deep vulnerabilities. Of the 60 targets, 35 are on track, 15 are at risk, and 8 show no progress. Critical areas demand our immediate attention include maternal mortality, non-communicable disease, injury, violence, and mental health disorders. Progress in eliminating communicable diseases and achieving universal access and financial protection requires a renewed focus. The message is clear. Strategic, sustained action is non-negotiable. We must strengthen health systems rooted in primary health care, ensuring equitable access for the most vulnerable, political commitment, lessons learned from the pandemic, and targeted investment in our tools to build resilient systems capable of withstanding future shocks. This report is not just a reflection, it is a call to action. Its insights will guide the PAHO Strategic Plan 2026 to 2031, helping us accelerate progress and leave no one behind. Together, let us seize this moment. Let us renew our commitment to SHA 2030 and turn these lessons into action, health, equity, and resilience for all the Americas. Thank you.
Thank you, Barbados. I'll now give the floor to Guyana.
Mr. President,
Guyana welcomes the presentation of the midterm report on the Sustainable Health Agenda for the Americas 2018 to 2030 and commends PAHO for its stewardship in guiding member states towards the collective goal of equity, resilience, and universal health. We note the progress achieved in several areas, including expanded access to essential health services, improvement in immunization, and strengthened regional cooperation in emergency preparedness. However, the report also highlighted persistent gaps in health equity, human resource financing, and growing burden of NCDs and climate-related health threats. In Guyana, we continue to align our national health strategies with the SHART 2030, focusing on primary health care, digital health transformation, NCDs prevention, maternal and child health, and the reduction of health disparities in hinterland and indigenous communities. We urge PAHO to continue support to strengthening health workforce development and retention, enhancing health system resilience to climate and emerging threats, mobilizing resources and partnership to address inequities, supporting member states in digital health, surveillance, and research for evidence-based policy. Guyana reaffirms its commitment to the principles of Sustainable Health Agenda and will continue to work with PAHO and regional partners to accelerate progress towards universal health and the 2030 targets. Thank you.
Thank you, Guyana. I now give the floor to Haiti.
Monsieur le Président. Monsieur le Président, Haïti salue la présentation du rapport à mi-parcours sur la mise en œuvre du programme d'action sanitaire durable pour les Amériques 2018-2030. Nous reconnaissons l'effort collectif qui a permis d'avancer malgré des circonstances d'une complexité inédite, notamment la pandémie de Covid-19. Nous notons avec satisfaction certains progrès concrets dans la région. Le renforcement des ressources humaines pour la santé avec des politiques et des plateformes de formation innovantes, les avancées dans les systèmes d'information en santé et la digitalisation progressive des outils de suivi. L'adoption de stratégies pour consolider les fonctions essentielles de santé publique afin de rendre nos systèmes plus résilients. Haïti, malgré des contraintes très sévères, a aussi accompli des progrès notables. La consolidation du système national d'information sanitaire SISNU qui permet aujourd'hui de disposer de données plus fiables pour orienter les décisions et suivre les priorités de santé publique. Le renforcement de la vaccination avec des campagnes nationales soutenues par nos partenaires qui ont permis d'éviter la résurgence de certaines maladies évitables par vaccin. Des avancées dans la mise en place de SONUB, soins obstétricaux et néonataux d'urgence de base, pour améliorer la prise en charge des femmes enceintes, même dans des contextes d'accès difficiles. Le développement du plan directeur 2021-2031, aligné sur les priorités du PASDA et sur la vision de soins primaires renforcée. Enfin, la mobilisation croissante de la communauté et de la société civile qui joue un rôle essentiel dans la résilience sanitaire, en particulier face aux urgences. Cependant, nous devons aussi regarder la réalité en face. Nous n'atteindrons pas collectivement toutes les cibles de 2030. Plusieurs défis persistent. La mortalité maternelle demeure élevée dans notre région, bien au-delà de la cible fixée. Les progrès sont trop lents dans la lutte contre les maladies non transmissibles, les troubles de santé mentale et la violence. Les maladies transmissibles et les flambées récurrentes rappellent notre vulnérabilité. Enfin, le financement de la santé et la réduction des inégalités restent fragiles et inachevés. Pour Haïti, ces constats résonnent douloureusement avec notre quotidien. Nous vivons les effets combinés de l'instabilité, de la fragilité de nos systèmes de soins et des contraintes financières aiguës. Pourtant, notre pays réaffirme sa détermination à agir avec l'appui de l'OPS et des partenaires pour renforcer les soins de santé primaires, élargir la protection financière des plus vulnérables et moderniser notre gouvernance sanitaire. Monsieur le Président, nous devons transformer cette évaluation à mi-parcours en un appel à l'action. Le temps est court d'ici 2030. Nous devons investir dans la résilience des systèmes de santé, accélérer la lutte contre les maladies transmissibles et non transmissibles, garantir un financement durable et équitable et mobiliser toute la société, gouvernements, partenaires, communautés et sociétés civiles pour que la santé devienne un levier de stabilité et de développement. Haïti demeure convaincu que malgré nos retards, une action collective audacieuse peut encore rapprocher notre région des engagements que nous avons pris. Chaque progrès compte pour sauver des vies et pour bâtir des systèmes de santé plus justes, plus inclusifs et plus durables. Je vous remercie.
Thank you, Haiti. And now I will give the floor to a United Nations agency and several non-state actors in official relations who have requested to make statements under this agenda item. I give the floor to United Nations Environment Program.
Excellencies, colleagues, the midterm review of the Sustainable Health Agenda for the Americas highlights persistent environmental challenges that continue to shape health outcomes. Many communities remain without reliable access to safe water and sanitation, face daily exposure to polluted air and hazardous chemicals, and are increasingly affected by climate-related emergencies. These conditions fuel inequities and slow the path towards sustainable health agenda in the Americas 2030. UNEP's mandate offers critical opportunities to reinforce this agenda. By working alongside the health actors, UNEP can strengthen health resilience, ensuring health systems are prepared for extreme weather and evolving disease risks, reduce toxic exposures, supporting safer agricultural practices, effective waste management, and stronger chemical regulations, improve water and sanitation security through ecosystem protection and integrated water resource management, advance cross-sectorial governance with health, environment, and agricultural collaboration under the One Health vision, and expand data and accountability, embedding environmental indicators into national monitoring systems. The Sustainable Health Agenda for the Americas demonstrates that lasting improvements in health requires attention to the environment foundations. By aligning UNEP's environmental experience with PAHO's leadership, we can accelerate progress towards healthier and resilient societies across the region. Thank you.
Thank you. I now give the floor to the Coalition for America's Health.
Honorable Presidente, distinguidos delegados, CLAS, la Coalición América Saludable, COLANSA y WOF, World Obesity Federation, acogen con satisfacción el informe de medio término que reafirma compromisos en prevención y atención primaria de salud y los avances de los Estados miembros en la promoción de entornos alimentarios saludables, incluyendo etiquetado frontal, reducción de grasas trans, protección de la lactancia y restricciones publicitarias. Estas políticas son pasos importantes hacia la... Disculpen, tengo un problema acá un problema técnico, pero estas políticas son pasos importantes hacia el cumplimiento de compromisos regionales y globales. Sin embargo, preocupa que los principales indicadores de nutrición, especialmente sobrepeso y obesidad, permanezcan elevados y se mantengan estables, no están cambiando. Ello refleja que las medidas adoptadas, aunque valiosas, resultan insuficientes frente a la magnitud de la crisis de salud derivada del aumento de las enfermedades relacionadas con la alimentación en la región. Este escenario, propiciado por la interferencia de las industrias, continúa debilitando la adopción de políticas efectivas y retrasando avances necesarios. La ausencia de un lenguaje y acciones más firmes en torno a medidas fiscales sobre productos nocivos, así como la falta de un abordaje estructural de los determinantes comerciales de la salud, limita progresos para cumplir con las metas regionales y globales. Reiteramos nuestro compromiso de acompañar a los Estados miembros en acelerar políticas basadas en evidencia y exhortamos a traducir las metas globales en compromisos nacionales ambiciosos, salvaguardando las políticas del conflicto de interés, integrando acciones climáticas y salud e impulsando la participación significativa de la sociedad civil y de las personas que viven con enfermedades no transmisibles. Muchas gracias.
Thank you. I now give the floor to Corporate Accountability.
Muchas gracias, honorable presidente, honorables delegados. Desde Corporate Accountability, Coalición Américas Saludables, Global Alliance for Tobacco Control, Action on Smoking and Health and Vital Strategies, celebramos los avances señalados en el informe de progreso. La región de las Américas ha dado pasos trascendentales en control de tabaco, consolidando su liderazgo en salud pública. Un logro clave ha sido la adopción de la Estrategia de Control de Tabaco 2025-2030 de la Organización Panamericana de la Salud, que refuerza la implementación del Convenio Marco para el Control del Tabaco y responde a los desafíos emergentes. Este hito demuestra que es posible alcanzar consensos políticos firmes sobre medidas que, pese a la incesante interferencia de la industria tabacalera, resultan eficaces para proteger la vida y la salud de millones de personas. Sudamérica ya alcanzó la meta de declararse libre de humo en todos sus países. Este logro debe inspirar hacia una Latinoamérica 100% libre de tabaco, priorizando el fortalecimiento de los marcos regulatorios en el Caribe, donde aún existen importantes brechas. La experiencia regional evidencia cómo la industria tabacalera intenta frenar el progreso mediante narrativas de falsa transformación, la promoción de productos supuestamente de menor riesgo y el uso de grupos de fachada que encubren sus verdaderos intereses. Estos aprendizajes coinciden con el informe de la Relatoría Especial sobre Derechos Económicos, Sociales y Culturales y Ambientales de la Comisión Interamericana de Derechos Humanos sobre Enfermedades no transmisibles, que subraya la urgencia de enfrentar integralmente los factores de riesgo. La experiencia en control de tabaco ofrece lecciones valiosas para robustecer políticas frente a otros determinantes de las enfermedades no transmisibles y consolidar la salud como un derecho humano fundamental. Quedamos atentos a apoyarlos en lo que viene. Muchas gracias.
Thank you, and I give the floor to the International Council of Nurses.
Thank you, Mr. President, delegates. The International Council of Nurses welcomes discussions on the Sustainable Health Agenda for the Americas, focusing on investing in the health workforce. Nurses are vital to health systems, and improving recruitment, retention, and professional development is key to ensuring equitable, high-quality care. We call on member states to invest in strong educational systems, including expanded clinical placements that prepare nurses to meet the evolving health needs of their populations. Investing in nursing education and training in line with the World Health Organization's strategic directions for nursing and midwifery is essential to building resilient health systems and improving patient outcomes. Retention of nurses requires competitive salaries, safe work environments, and career development opportunities. The ICN's report Sustain and Retain in 2022 and Beyond, the global nursing workforce, and the COVID-19 pandemic emphasizes that without adequate support, health systems risk losing skilled nurses, particularly in underserved areas. We are also concerned that the regional maternal mortality ratio continues to suffer setbacks. Accelerated action is needed, including implementation of high-impact interventions. Nurses work closely with women, children, and adolescents across the life course. Beyond providing primary health services and life-saving treatments, nurses improve the quality of the care and increase equitable access to essential health services that reduce maternal, newborn, and child mortality. We highlight the migration of nurses from low and middle-income countries to high-income countries, which can deplete their health workforces. Migrant nurses often face discrimination and barriers that limit their contributions. We support collecting detailed workforce data to better understand the needs, migration trends, and health impacts. In conclusion, investing in nursing education, equitable salaries, supportive work environments, and data-driven workforce planning is essential for recruitment and retention. By doing so, nurses are empowered to provide safe, high-quality care for many, many years, strengthening health systems and improving the health of all communities. Thank you.
Thank you. I now give the floor to the International Federation of Medical Students Associations.
Señor presidente, distinguidos delegados, la Federación Internacional de Asociaciones de Estudiantes de Medicina reafirma su compromiso con la Agenda de Salud Sostenible para las Américas 2018-2030. Reconocemos los avances alcanzados, pero expresamos nuestra preocupación ante el riesgo de que una de cada 4 metas no se cumpla, así como el rezago persistente en salud materna, salud mental, enfermedades transmisibles y no transmisibles. Por ello, hacemos un llamado a garantizar una cobertura universal de salud basada en la equidad y sustentada en la atención primaria de salud, asegurando el acceso de las poblaciones en condiciones de vulnerabilidad, incluyendo los servicios esenciales de salud materna y reproductiva. Priorizar la salud mental mediante la integración de la prevención, la atención y el apoyo psicosocial en los sistemas de atención primaria. Implementar estrategias integrales para prevenir y manejar las enfermedades no transmisibles, con énfasis en la detección temprana, la promoción de la salud y la acción intersectorial sobre los factores de riesgo. Impulsar enfoques intersectoriales frente a los determinantes sociales y ambientales de la salud, incluyendo medidas urgentes ante el cambio climático y sus repercusiones en la salud. Fortalecer el personal de salud a través de inversiones en educación, condiciones laborales justas y la participación significativa de la juventud y la sociedad civil en la toma de decisiones. Asegurar una financiación sostenible y equitativa en salud, protegiendo a las personas de gastos catastróficos y empobrecedores. Reiteramos el llamado de la SHA 2030 a acelerar el progreso mediante sistemas de salud resilientes y centrados en las personas, una gobernanza más sólida y una mayor solidaridad regional. Para ello, es fundamental incorporar esta agenda en las políticas nacionales de salud con mecanismos claros de rendición de cuentas, al tiempo que se fomenta una participación inclusiva en todos los niveles. Los estudiantes de medicina estamos listos para contribuir a través de la incidencia política, el fortalecimiento de capacidades y el trabajo comunitario. Instamos a los Estados miembros y a la OPS a trabajar junto con la juventud y la sociedad civil para garantizar que de aquí a 2030 los compromisos se traduzcan en mejoras concretas en la salud y el bienestar, sin dejar a nadie atrás. Muchas gracias.
Thank you. I now give the floor to Movendi International.
Thank you, Chairperson, distinguished delegates. Movendi International in Alasa welcomes the midterm report on the Sustainable Health Agenda for the Americas 2018-2030. We appreciate its recognition that alcohol is a key driver of the NCD burden in our region. We also share government's deep concern about alcohol industry interference. Our members across the Americas see this every day. Industry interference directly undermines alcohol policy progress. This is a major reason why the target to reduce per capita alcohol use is at risk and not on track. The costs of inaction are staggering. Alcohol is a cross-cutting obstacle to 13 of the 17 Sustainable Development Goals. It fuels NCDs, drains health systems, worsens poverty and inequality, undermines child and youth development, harms road safety, and drives gender-based violence. Yet proven solutions are at hand. The brand new World Health Organization report, Saving Lives, Spending Less, confirms that alcohol taxation is one of the smartest investments governments can make. Well-designed alcohol taxes save lives, reduce health costs, raise revenue. They also promote social justice and unlock resources to build more self-sustaining health systems. This is a quadruple win for people, communities, and governments alike. In this spirit, we call for full implementation of the Global Alcohol Action Plan, and we argue the region of the Americas to follow Europe, Africa, and West Pacific by adopting a regional alcohol action plan tailored to our realities. Movendi International, ALASA, and our members stand ready to support governments, especially in raising alcohol taxes and scaling up all best buys. With evidence-based alcohol policy, the region can deliver on health, development, and justice. Thank you.
Thank you. We've had 21 interventions. It's now 6 minutes to 6. And I'm going to yield the floor to Mr. Master to make a concise response to the comments. Thank you.
Thank you, Mr. President. I'll follow your instructions. Thank you to the 15 member states' interventions and the 7 non-state actors. We are indeed pleased to note that your comments and your suggestions have been, many of them have been taken into consideration in the development of the strategic plan. And as you will see also when you look at the program budget that you approved yesterday, you will see key interventions that address some of these specific challenges that are documented in this report. Also, it's really very encouraging to hear your renewed commitment and the call for action. And just to note as well that when you look at those areas that are lagging behind, especially in the first 5 goals, if you look at them and you look at the strategic plan, those are the areas of health systems and service based on primary health care. And then if you look at the other ones that are lagging behind, also maternal child health, NCDs, and communicable diseases in this report, you will see that those are top-tier priorities that you have identified in the strategic plan. So, and then we have the package of accelerators that will also help us to look and deepen the action where it's needed. I think it's important to note that the lessons, I think as our Minister of Chile highlights in terms of indicators, measurements, and data, that's something that we took very keenly into the strategic plan, and we looked at where there's no data, no indicator, a practical approach, but also improving the setting of baselines and targets based on more realistic projections and the available data. And then the commitment also, as we discussed on Monday, to the need to continue building capacity, to have strong information systems that give us timely information for not just for planning, but for the decision making as we implement. And the other point I think it's important to highlight here is the issue of the going forward. What do we do with this report is really why we develop it and present it to you. How we use it here by our Secretariat, count on that commitment as we develop the new plans and strategies as well in every technical area, but also at country level, as you highlight, at the sub-regional level. And that's something that we leave in your hands. A good report is not just about documenting lessons learned, but implementing it. So also to note that as we continue, some of you mentioned the incoherence in some of the measurements, and I want to be very transparent here. When we set some of those indicators back in 2017, some of them did not have data, but also the targets, some of them were very ambitious and some were very conservative, if I can use that term. And we have been looking at those indicators, so going forward we have to look at the new strategic plan indicators and the targets, but also as we continue to update the assessments, we have opportunities for this. The end of biennium assessment that we will conduct at the end of this year, early next year, will also update some of these information that we have. And we will continue to. And also an important topic that you highlighted, human resource for health. We just launched an external evaluation of human resource for health that will also allow us to have that external view and recommendations on how we continue working on that important area that you have highlighted. With that, distinguished delegates, ministers, thank you again for your comments, and we remain committed here to make the best use of this report together with you and our partners. Thank you, Mr. President.
Thank you, Mr. Mazda. Director.
I'll be very brief, Mr. President, because the time is already very advanced. Now, I want to thank you, member states. I just want to make 2 brief comments. One is about the the situation that you have, that is not only related to the Sustainable Health Agenda for the Americas, but in other documents, in other proposals, that is the lack of data that we have for some indicators that are very interesting indicators that try to measure some very important dimensions, but without the data, the reality is that after 5 years, after 10 years, we still don't have them to measure. So it was one thing that I highlighted to the Secretariat to present it to our member states during the discussion on the strategic plan, to keep in mind that a good indicator that cannot be measured because you don't have data is not a good indicator. It's maybe a wish list of indicators that maybe one day we'll have the data, but it will not tell us what is happening, what are the progresses, what are the failures, what are the gaps and the challenges. So I think that is also an important lesson. The second comment, just to highlight one thing that Ronnie Maza also mentioned. In the next 5 years, and this is also very well aligned with the strategic plan, because we are talking about a similar set of dimensions. The strategic plan and SHA are telling us that in some areas we are progressing, and I want to commend the Council because we are really making some very important progress, but we have some gaps, and we need to review why we are not progressing in these dimensions. Because our role, I think that the main important role that the PAHO has is not to work with you to support what you are doing well, what you know how to do. The real value that the PAHO can bring to the countries is to be innovative, is to say, okay, this strategy was important 10 years ago, worked well until 5 years ago, but now, to reach this vulnerable population, we need to change the strategy. We need to incorporate this new tool. We need to do this in a different way. So this is the most important contribution that we are here to provide to you, these accelerators, how we can increase the reduction of maternal mortality, how we can increase the immunization coverage, reducing preventable deaths related to NCD. So this whole set of dimensions that we need to progress in a more solid way, this in dialogue with you, adapting to the national realities, national needs. I think that we have 5 years to work together to progress, to present more progress, because this will be important for the SHA, will be important for the strategic plan, and we are not talking only about having a good report, showing that everything is green, that we are accomplished, but that we are really making difference in the health of our population. Thank you, Mr. President.
Thank you, Dr. Barbuzo. This has brought us to the end of the discussion on this agenda item, and I would like to inform the Council that the discussions will be noted in the final report. I believe this brings us to the end of today's meeting. We've covered all the agenda items. We continue tomorrow morning and tomorrow, and I'm asking honorable ministers and delegates to come prepared to discuss item 7.1, 7.7, 7.8, A, B, and C, and indeed item 7.9 and item 8, and of course item 9. In other words, come prepared to complete the agenda. I am being told that, if time permits, the plans to hold the 177th session of the Executive Committee. So I guess tomorrow will be a long or a short day, depending on how you want it to be. Having said that, I don't believe there are any announcements. I want to thank you all. We've had a very good day, and I will see you here tomorrow morning at 9. Sorry. If I may, Brazil wanted to make Brazil wants to speak on the adjournment.
Muchas gracias, señor presidente. Les agradezco a ustedes también la atención, sobre todo de los países de Centroamérica, Cuba y México, que les queremos invitar a una reunión para presentar el plan de acción de salud de la COP30, el plan de acción de salud de Belén en la sala 714. Si tienen un poquito más de paciencia, agradeceríamos mucho que se quedaran con nosotros unos minutos más. Gracias.
Thank you.